1. Understanding ADHD. 1.1 What is ADHD? Attention Deficit Hyperactivity Disorder (ADHD) is a neurodevelopmental disorder that affects both children and adults. It is characterized by persistent patterns of inattention, hyperactivity, and impulsivity that can significantly impact daily functioning and quality of life. ADHD is a complex condition that can vary in severity and presentation from person to person. 1.1.1 Types of ADHD. There are three main types of ADHD. Predominantly inattentive presentation. Individuals with this type of ADHD primarily struggle with inattention. They may have difficulty sustaining attention, following instructions, organizing tasks, and often appear forgetful or easily distracted. Predominantly hyperactive impulsive presentation. This type of ADHD is characterized by hyperactivity and impulsivity. Individuals may have trouble sitting still, constantly fidget, interrupt others, and act impulsively without considering the consequences. Combined presentation. This is the most common type of ADHD, where individuals exhibit symptoms of both inattention and hyperactivity impulsivity. 1.1.2 Onset and duration. ADHD typically begins in childhood, with symptoms often becoming noticeable around the age of 3 to 6 years. However, it is important to note that ADHD can persist into adolescence and adulthood. In some cases, symptoms may not be recognized until later in life, especially for individuals with milder forms of the disorder. 1.1.3 Neurobiological factors. Research suggests that ADHD is primarily a neurobiological disorder, with various factors contributing to its development. It is believed to be caused by a combination of genetic, environmental, and neurological factors. Studies have shown that individuals with ADHD may have differences in brain structure and function, particularly in areas responsible for attention, impulse control, and executive functioning. 1.1.4 Common symptoms. The symptoms of ADHD can manifest in different ways and can vary in severity. Some common symptoms include inattention, difficulty sustaining attention, easily distracted, making careless mistakes, forgetfulness, and difficulty organizing tasks. Hyperactivity, restlessness, excessive talking, difficulty staying seated, constantly fidgeting, and feeling an internal sense of restlessness. Impulsivity, acting without thinking, interrupting others, difficulty waiting for turns, and engaging in risky behaviors without considering the consequences. 1.1.5 Impact on daily life. ADHD can have a significant impact on various aspects of daily life, including academic performance. Children with ADHD may struggle with schoolwork, have difficulty following instructions, and exhibit poor organizational skills. They may also experience challenges with time management and completing tasks. Work performance. Adults with ADHD may face difficulties in maintaining focus, meeting deadlines, and staying organized at work. They may also struggle with time management and have trouble prioritizing tasks. Relationships. ADHD can affect relationships, both personal and professional. Individuals with ADHD may have difficulty listening, paying attention, and remembering important details, which can lead to misunderstandings and conflicts. Emotional well-being. ADHD can impact emotional regulation, leading to mood swings, frustration, and impulsivity. Individuals may also experience low self-esteem and feelings of inadequacy due to the challenges they face. 1.1.6 Co-occurring conditions. It is common for individuals with ADHD to have co-occurring conditions, such as learning disabilities. ADHD often coexists with learning disabilities, making it more challenging for individuals to acquire and retain information. Anxiety and depression. ADHD can increase the risk of developing anxiety and depression due to the daily struggles and difficulties faced by individuals with the disorder. Oppositional defiant disorder (ODD). ODD is characterized by defiant and disruptive behavior, and it frequently occurs alongside ADHD. Substance abuse. Individuals with ADHD may be at a higher risk of developing substance abuse issues, as they may turn to substances as a way to cope with their symptoms. 1.1.7 Lifespan outlook. While ADHD is a lifelong condition, its impact can be managed effectively with appropriate treatment and support. With the right strategies and interventions, individuals with ADHD can lead fulfilling and successful lives. It is important to understand that ADHD is not a reflection of intelligence or character, but rather a neurodevelopmental condition that requires understanding, patience, and support from both the individual and their environment. In the following chapters, we will explore the causes, diagnosis, and assessment of ADHD, as well as the common symptoms and challenges faced by individuals with the disorder. We will also delve into various strategies and techniques to manage ADHD effectively and create supportive environments that promote success and well-being. 1.2 Causes and risk factors. ADHD, or Attention Deficit Hyperactivity Disorder, is a neurodevelopmental disorder that affects both children and adults. While the exact cause of ADHD is still not fully understood, research suggests that it is a complex condition influenced by a combination of genetic, environmental, and neurological factors. In this section, we will explore the various causes and risk factors associated with ADHD. 1.2.1 Genetic factors. One of the primary causes of ADHD is believed to be genetic factors. Studies have shown that ADHD tends to run in families, with a higher likelihood of developing the disorder if a close relative, such as a parent or sibling, has been diagnosed with ADHD. Researchers have identified several genes that may contribute to the development of ADHD, although no single gene has been found to be solely responsible for the disorder. It is likely that multiple genes interact with each other and with environmental factors to increase the risk of developing ADHD. 1.2.2 Neurological factors. Neurological factors also play a significant role in the development of ADHD. Research using brain imaging techniques has revealed differences in the structure and functioning of the brains of individuals with ADHD compared to those without the disorder. These differences primarily involve the areas of the brain responsible for attention, impulse control, and executive functions. It is believed that abnormalities in the neurotransmitter systems, such as dopamine and norepinephrine, which regulate these brain functions, contribute to the symptoms of ADHD. 1.2.3 Environmental factors. While genetics and neurological factors play a significant role in the development of ADHD, environmental factors can also contribute to the risk of developing the disorder. Certain prenatal and early childhood factors have been associated with an increased likelihood of developing ADHD. These include 1.2.3.1 Maternal smoking and substance abuse. Exposure to tobacco smoke and substances during pregnancy has been linked to an increased risk of ADHD in children. Studies have shown that smoking during pregnancy can disrupt fetal brain development and increase the likelihood of behavioral problems, including ADHD, in the offspring. Similarly, maternal substance abuse, such as alcohol or illicit drugs, can also have detrimental effects on the developing brain and increase the risk of ADHD. 1.2.3.2 Premature birth and low birth weight. Premature birth and low birth weight have been associated with an increased risk of ADHD. Babies born prematurely or with low birth weight may experience disruptions in brain development, which can contribute to the development of ADHD symptoms later in life. 1.2.3.3 Lead exposure. Exposure to lead, a toxic metal found in old paint, soil, and certain products, has been linked to an increased risk of ADHD. Lead can interfere with brain development and affect cognitive functions, including attention and impulse control. 1.2.3.4 Prenatal and early childhood stress. High levels of stress during pregnancy or early childhood can also increase the risk of developing ADHD. Stressful environments, such as family conflict, neglect, or abuse, can have a negative impact on brain development and increase the likelihood of ADHD symptoms. 1.2.4 Other risk factors. In addition to genetic, neurological, and environmental factors, several other risk factors have been associated with an increased likelihood of developing ADHD. These include 1.2.4.1 Gender. ADHD is more commonly diagnosed in males than females. However, recent research suggests that the gender difference may be due to underdiagnosis or misdiagnosis of ADHD in females, as their symptoms may present differently. 1.2.4.2 Family and social factors. Certain family and social factors, such as low socioeconomic status, family instability, and exposure to violence, have been linked to an increased risk of ADHD. These factors can contribute to a stressful and chaotic environment, which may exacerbate ADHD symptoms. 1.2.4.3 Maternal mental health. Maternal mental health, particularly maternal depression and anxiety, has been associated with an increased risk of ADHD in children. The stress and emotional difficulties experienced by mothers with mental health conditions can impact the child's development and increase the likelihood of ADHD symptoms. 1.2.4.4 Chronic health conditions. Children with chronic health conditions, such as asthma or epilepsy, have a higher risk of developing ADHD. The presence of these conditions may contribute to difficulties with attention and impulse control. In conclusion, ADHD is a complex disorder with multiple causes and risk factors. Genetic, neurological, and environmental factors all play a role in its development. Understanding these factors can help individuals and their families better comprehend the condition and seek appropriate interventions and support. 1.3 Diagnosis and assessment. Diagnosing and assessing ADHD is a crucial step in understanding and managing the condition. It involves a comprehensive evaluation of an individual's symptoms, behaviors, and overall functioning. This process helps to determine whether someone meets the criteria for ADHD and provides valuable information for developing an effective treatment plan. 1.3.1 The diagnostic criteria for ADHD. The diagnosis of ADHD is based on specific criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders DSM-5. According to the DSM-5, individuals must exhibit a persistent pattern of inattention and/or hyperactivity impulsivity that interferes with their daily functioning or development. These symptoms should be present in multiple settings, such as home, school, or work. There are 3 subtypes of ADHD recognized by the DSM-5. Predominantly inattentive presentation. Individuals with this subtype primarily struggle with inattention. They may have difficulty sustaining attention, following instructions, organizing tasks, and often appear forgetful or easily distracted. Predominantly hyperactive impulsive presentation. Individuals with this subtype primarily struggle with hyperactivity and impulsivity. They may have difficulty sitting still, engaging in quiet activities, waiting their turn, and often act without thinking. Combined presentation. Individuals with this subtype exhibit symptoms of both inattention and hyperactivity impulsivity. To meet the diagnostic criteria for ADHD, these symptoms should have been present before the age of 12 and should persist for at least 6 months. Additionally, the symptoms should not be better explained by another mental health condition or a medical condition. 1.3.2 The assessment process. The assessment process for ADHD typically involves multiple steps and may include various professionals, such as psychologists, psychiatrists, pediatricians, or neurologists. Here is an overview of the assessment process. Initial screening. The first step is often an initial screening conducted by a healthcare professional. This may involve a questionnaire or interview to gather information about the individual's symptoms, medical history, and overall functioning. Comprehensive evaluation. If the initial screening suggests the possibility of ADHD, a comprehensive evaluation is conducted. This evaluation may involve interviews with the individual and their family members, as well as the use of standardized rating scales and behavioral assessments. The goal is to gather information about the individual's symptoms, their impact on daily life, and any coexisting conditions. Medical examination. A medical examination is often conducted to rule out any underlying medical conditions that may be causing or contributing to the symptoms. This may include a physical examination, review of medical history, and possibly some laboratory tests. Collateral information. Collateral information from other sources, such as teachers or employers, may be gathered to gain a comprehensive understanding of the individual's functioning in different settings. Differential diagnosis. The assessment process also involves ruling out other conditions that may mimic or coexist with ADHD. This is important to ensure an accurate diagnosis and appropriate treatment. Conditions such as anxiety disorders, learning disabilities, or mood disorders may share similar symptoms with ADHD. Feedback and diagnosis. Once all the information is gathered and analyzed, the healthcare professional will provide feedback to the individual and their family. They will discuss the diagnosis, explain the findings, and answer any questions or concerns. 1.3.3 Challenges in diagnosis. Diagnosing ADHD can be challenging due to several factors. Some of the common challenges include overlapping symptoms. The symptoms of ADHD can overlap with other mental health conditions, such as anxiety or depression. Distinguishing between these conditions can be complex, requiring careful evaluation and consideration of the individual's history and symptoms. Variability in symptoms. ADHD symptoms can vary widely among individuals. Some may exhibit more inattentive symptoms, while others may display more hyperactive impulsive symptoms. This variability can make it difficult to recognize and diagnose ADHD accurately. Coexisting conditions. ADHD often coexists with other mental health conditions, such as learning disabilities or mood disorders. Identifying and addressing these coexisting conditions is essential for effective treatment. Cultural factors. Cultural factors can influence the perception and expression of ADHD symptoms. It is important for healthcare professionals to consider cultural differences and potential biases when assessing and diagnosing ADHD. Developmental considerations. ADHD symptoms can change as an individual grows and develops. What may appear as hyperactivity in a young child may manifest as restlessness or impulsivity in adolescence or adulthood. Considering the developmental stage is crucial for an accurate diagnosis. Despite these challenges, a thorough and comprehensive assessment process, involving multiple sources of information, can help in accurately diagnosing ADHD and developing an appropriate treatment plan. In the next chapter, we will explore the common symptoms and challenges faced by individuals with ADHD, providing a deeper understanding of the condition and its impact on daily life. 1.4 Common symptoms and challenges. ADHD, or attention deficit hyperactivity disorder, is a neurodevelopmental disorder that affects both children and adults. It is characterized by a persistent pattern of inattention, hyperactivity, and impulsivity that can significantly impact daily functioning and quality of life. In this section, we will explore the common symptoms and challenges associated with ADHD. 1.4.1 Inattention. One of the primary symptoms of ADHD is inattention. Individuals with ADHD often struggle to sustain focus and concentration, especially on tasks that are not inherently stimulating or interesting to them. They may have difficulty paying attention to details, making careless mistakes, and following through on instructions or completing tasks. This can lead to challenges in academic or work settings, as well as in personal relationships. 1.4.2 Hyperactivity. Hyperactivity is another hallmark symptom of ADHD, particularly in children. Children with ADHD may exhibit excessive fidgeting, restlessness, and difficulty staying seated. They may also engage in impulsive behaviors, such as interrupting others or blurting out answers before a question is fully asked. While hyperactivity tends to decrease with age, it can still be present in adults with ADHD, albeit in a more subtle form. 1.4.3 Impulsivity. Impulsivity is closely linked to hyperactivity and is a common challenge for individuals with ADHD. Impulsive behaviors can manifest in various ways, such as acting without thinking, making impulsive decisions, and engaging in risky behaviors. This impulsivity can lead to difficulties in social interactions, as well as problems with impulse control, such as excessive spending or substance abuse. 1.4.4 Executive Functioning Deficits. ADHD is also associated with deficits in executive functioning, which refers to a set of cognitive processes that help individuals plan, organize, and regulate their behavior. People with ADHD often struggle with tasks that require organization, time management, and prioritization. They may have difficulty starting and completing tasks, managing their time effectively, and staying organized. These challenges can impact various aspects of life, including school, work, and personal relationships. 1.4.5 Emotional Dysregulation. Emotional dysregulation is a common symptom of ADHD and can manifest as difficulty managing and expressing emotions appropriately. Individuals with ADHD may experience intense emotions, such as anger, frustration, and irritability, which can be triggered by seemingly minor events. They may also have difficulty regulating their emotions, leading to impulsive or inappropriate reactions. This emotional dysregulation can strain relationships and contribute to feelings of low self-esteem. 1.4.6 Academic and Occupational Challenges. The symptoms of ADHD can significantly impact academic and occupational performance. In school, children with ADHD may struggle with staying focused, completing assignments, and following instructions. They may also have difficulty organizing their materials and managing their time effectively. Similarly, adults with ADHD may face challenges in the workplace, such as difficulty staying on task, meeting deadlines, and maintaining attention during meetings or presentations. 1.4.7 Social and Relationship Difficulties. ADHD can also affect social interactions and relationships. The inattention, impulsivity, and hyperactivity associated with ADHD can make it challenging for individuals to engage in meaningful conversations, listen attentively, and maintain focus during social interactions. They may struggle with taking turns, interrupting others, and following social cues, which can lead to misunderstandings and strained relationships. 1.4.8 Low self-esteem and mental health issues. Living with ADHD can take a toll on an individual's self-esteem and mental health. The challenges associated with ADHD, such as academic or occupational difficulties, social struggles, and emotional dysregulation, can contribute to feelings of frustration, failure, and low self-worth. Additionally, individuals with ADHD are at a higher risk of developing co-occurring mental health conditions, such as anxiety and depression. 1.4.9 Impaired time management and organization. Individuals with ADHD often struggle with time management and organization. They may have difficulty estimating how long tasks will take, leading to poor time allocation and a tendency to underestimate deadlines. Additionally, they may struggle with organizing their physical and digital spaces, making it challenging to find important documents or complete tasks efficiently. 1.4.10 Impaired memory and learning. Memory and learning difficulties are common challenges for individuals with ADHD. They may have trouble retaining information, particularly when it is not presented in an engaging or stimulating manner. This can impact academic performance, as well as the ability to learn and apply new skills in various areas of life. In the next chapter, we will explore the impact of ADHD on daily life, including relationships, school, work, and time management. Understanding these challenges is crucial for developing effective strategies and creating supportive environments to manage ADHD successfully. 2. The impact of ADHD on daily life. 2.1 ADHD in relationships. Living with ADHD can have a significant impact on various aspects of life, including relationships. The challenges associated with ADHD can affect both personal and professional relationships, making it crucial to understand how ADHD can impact these connections and develop strategies to manage them effectively. 2.1.1 Understanding the impact. ADHD can affect relationships in several ways. Individuals with ADHD may struggle with maintaining focus and attention, which can lead to difficulties in active listening and engaging in meaningful conversations. They may also have difficulty with impulse control, leading to impulsive reactions or interrupting others during conversations. These challenges can strain relationships and create misunderstandings. Additionally, individuals with ADHD may struggle with organization and time management, which can lead to forgetfulness, missed appointments, and difficulty keeping commitments. This can cause frustration and resentment in relationships, as others may perceive these behaviors as a lack of care or consideration. 2.1.2 Communication Strategies. Effective communication is essential in any relationship, and it becomes even more crucial when one or both individuals have ADHD. Here are some strategies to improve communication. 2.1.2.1 Active listening. Active listening involves fully focusing on and understanding what the other person is saying. To practice active listening, individuals with ADHD can maintain eye contact and provide verbal or nonverbal cues to show engagement. Avoid interrupting or finishing the other person's sentences. Summarize or repeat what the other person said to ensure understanding. 2.1.2.2 Clear and direct communication. Individuals with ADHD may struggle with processing information quickly, so it is important to communicate clearly and directly. Here are some tips. Use simple and concise language. Break down complex information into smaller, more manageable parts. Avoid using ambiguous or vague language. 2.1.2.3 Active engagement. Engaging actively in conversations can help individuals with ADHD stay focused and maintain interest. Some strategies to enhance active engagement include asking questions to clarify information, providing feedback and expressing thoughts or opinions, using visual aids or gestures to enhance understanding. 2.1.3 Managing impulsivity. Impulsivity can be a significant challenge in relationships for individuals with ADHD. It can lead to impulsive reactions, interrupting others, or making hasty decisions. Here are some strategies to manage impulsivity. 2.1.3.1 Pause and reflect. Taking a moment to pause and reflect before responding can help individuals with ADHD manage impulsive reactions. This allows time to consider the consequences of their actions and choose a more thoughtful response. 2.1.3.2 Practice self-control techniques. Learning self-control techniques can help individuals with ADHD manage impulsive behaviors. Some techniques include deep breathing exercises to calm the mind and body, counting to 10 before responding to a situation, engaging in physical activities or hobbies to release excess energy. 2.1.4 Building empathy and understanding. Empathy and understanding are crucial in maintaining healthy relationships. It is important for both individuals to recognize and appreciate the challenges associated with ADHD. Here are some strategies to build empathy and understanding. 2.1.4.1 Education and awareness. Educating oneself and others about ADHD can help build empathy and understanding. Learning about the symptoms, challenges, and strategies for managing ADHD can foster empathy and reduce misconceptions. 2.1.4.2 Open and honest communication. Having open and honest conversations about ADHD can help both individuals understand each other's perspectives and needs. It is important to express feelings, concerns, and expectations in a non-judgmental and supportive manner. 2.1.4.3 Seek professional support. In some cases, seeking professional support, such as couples therapy or family counseling, can be beneficial. A trained therapist can provide guidance and support in navigating the challenges associated with ADHD in relationships. 2.1.5 Balancing independence and support. Finding the right balance between independence and support is crucial in relationships involving ADHD. Here are some strategies to achieve this balance. 2.1.5.1 Establishing boundaries. Setting clear boundaries can help individuals with ADHD understand expectations and responsibilities within the relationship. This can help manage frustrations and avoid misunderstandings. 2.1.5.2 Seeking support. Individuals with ADHD may benefit from seeking support from their partner, family, or friends. Having a support system can provide encouragement, understanding, and assistance in managing ADHD-related challenges. 2.1.5.3 Encouraging independence. While support is important, it is also essential to encourage independence and self-reliance. Allowing individuals with ADHD to take ownership of their responsibilities and make decisions can boost their self-esteem and sense of accomplishment. 2.1.6 Patience and flexibility. Patience and flexibility are key in maintaining relationships when ADHD is involved. It is important to remember that managing ADHD is an ongoing process, and setbacks may occur. Here are some strategies to cultivate patience and flexibility. Practice empathy and understanding. Celebrate progress and small victories. Adapt and adjust expectations as needed. By understanding the impact of ADHD on relationships and implementing effective strategies, individuals with ADHD can foster healthier and more fulfilling connections with their loved ones, colleagues, and friends. 2.2 ADHD in school. School can be a challenging environment for individuals with ADHD. The demands of academic work, the need to stay focused and organized, and the pressure to meet deadlines can all pose significant difficulties for students with ADHD. However, with the right strategies and support, it is possible for students with ADHD to succeed in school and reach their full potential. 2.2.1 Understanding the impact of ADHD on school performance. ADHD can have a significant impact on various aspects of a student's school performance. Some common challenges that students with ADHD may face include attention and focus difficulties. One of the hallmark symptoms of ADHD is difficulty sustaining attention and staying focused. This can make it challenging for students to concentrate during lectures, complete assignments, and follow instructions. As a result, they may miss important information and struggle to keep up with the pace of the classroom. Impulsivity and hyperactivity. Students with ADHD may also struggle with impulsivity and hyperactivity, which can interfere with their ability to participate in class discussions, wait their turn, and follow classroom rules. They may blurt out answers, interrupt others, and have difficulty sitting still for extended periods. Organization and time management issues. Many students with ADHD struggle with organization and time management skills. They may have difficulty keeping track of assignments, remembering deadlines, and managing their time effectively. This can lead to missed assignments, late submissions, and a general sense of disorganization. Poor executive functioning. Executive functioning refers to a set of cognitive processes that help individuals plan, organize, and execute tasks. Students with ADHD often have weaknesses in executive functioning, which can make it challenging for them to break down tasks, prioritize their work, and manage multiple assignments simultaneously. 2.2.2 Strategies for Success in School. While ADHD can present unique challenges in the school setting, there are several strategies that can help students with ADHD thrive academically. Here are some effective strategies to consider. 1. Establish a structured routine. Creating a structured routine can provide students with ADHD with a sense of predictability and help them stay organized. Establish a consistent schedule for waking up, going to bed, completing homework, and studying. Breaking tasks into smaller, manageable chunks can also make them feel less overwhelming. 2. Utilize visual aids and organizational tools. Visual aids and organizational tools can be invaluable for students with ADHD. Use color-coded folders and binders to keep track of assignments and materials. Utilize planners or digital calendars to record due dates and important deadlines. Visual reminders, such as sticky notes or checklists, can help students stay on track and remember important tasks. 3. Seek support from teachers and school staff. It is essential for students with ADHD to communicate their needs to their teachers and school staff. Inform them about your ADHD diagnosis and discuss any accommodations or modifications that may be helpful. This could include preferential seating, extended time for assignments or tests, or the use of assistive technology. 4. Break tasks into manageable steps. Breaking down tasks into smaller, manageable steps can make them feel more achievable for students with ADHD. Teach them how to create a checklist or use a task management app to track their progress. Celebrate small victories along the way to boost motivation and confidence. 5. Use active learning strategies. Engaging in active learning strategies can help students with ADHD stay focused and retain information better. Encourage them to take notes during lectures, participate in class discussions, and use mnemonic devices or visual aids to enhance memory retention. Incorporating movement or hands-on activities into the learning process can also help maintain engagement. 6. Practice self-advocacy skills. Teaching students with ADHD how to advocate for themselves is crucial for their success in school. Encourage them to ask for clarification when they don't understand something, request additional support if needed, and communicate their needs to teachers and peers in a respectful manner. Developing self-advocacy skills empowers students to take control of their education. 7. Implement effective study strategies. Help students with ADHD develop effective study strategies that work for them. This may include breaking study sessions into shorter, focused intervals, using mnemonic devices or acronyms to remember information, and creating visual aids or flashcards to review key concepts. Encourage them to find a quiet and distraction-free study environment. 8. Practice stress management techniques. Stress can exacerbate the symptoms of ADHD and make it even more challenging to focus and perform well in school. Teach students stress management techniques such as deep breathing exercises, mindfulness meditation, and physical activity. Encourage them to engage in activities they enjoy and prioritize self-care. 2.2.3 Collaboration with parents and educators. Collaboration between parents, educators, and other professionals is essential in supporting students with ADHD in the school setting. Open lines of communication and regular meetings can ensure that everyone is working together to provide the necessary support and accommodations. Parents can share valuable insights about their child's strengths and challenges, while educators can provide feedback on the student's progress and suggest additional strategies. By implementing these strategies and fostering a supportive and understanding environment, students with ADHD can overcome the challenges they face in school and achieve academic success. With the right support, they can develop the necessary skills to manage their ADHD symptoms and thrive in their educational journey. 2.3 ADHD and work. Work can be a challenging environment for individuals with ADHD. The demands of deadlines, multitasking, and maintaining focus can often feel overwhelming. However, with the right strategies and support, it is possible to thrive in the workplace and effectively manage ADHD symptoms. In this section, we will explore various techniques and tips to help individuals with ADHD succeed in their professional lives. 2.3.1 Understanding ADHD in the workplace. ADHD can present unique challenges in the workplace. Individuals with ADHD may struggle with maintaining focus, staying organized, managing time, and completing tasks. These difficulties can lead to decreased productivity, missed deadlines, and strained relationships with colleagues. It is important to recognize that ADHD is a neurodevelopmental disorder and not a reflection of intelligence or work ethic. 2.3.2 Disclosing ADHD to employers. Deciding whether or not to disclose your ADHD diagnosis to your employer is a personal decision. While some individuals may choose to disclose their diagnosis to seek accommodations and support, others may prefer to keep it private. If you decide to disclose, it is important to understand your rights under the Americans with Disabilities Act (ADA) and any applicable workplace policies. Discussing your ADHD with your employer can help create a more understanding and supportive work environment. 2.3.3 Seeking accommodations. If you choose to disclose your ADHD diagnosis, you may be eligible for workplace accommodations. Accommodations can help level the playing field and provide support tailored to your specific needs. Some common accommodations for individuals with ADHD include flexible work hours, modified workspaces, noise-canceling headphones, and written instructions. It is important to communicate your needs clearly and work with your employer to find reasonable accommodations that can enhance your productivity and well-being. 2.3.4 Time Management Strategies. Effective time management is crucial for individuals with ADHD in the workplace. Here are some strategies to help you better manage your time. Prioritize tasks. Create a to-do list and prioritize tasks based on their importance and deadlines. Breaking down larger tasks into smaller, manageable steps can also help you stay focused and motivated. Set realistic deadlines. Be mindful of your time limitations and set realistic deadlines for yourself. Avoid overcommitting and allow for extra time to accommodate unexpected challenges. Use visual aids. Visual aids such as calendars, planners, and reminders can be invaluable tools for individuals with ADHD. Use color coding, alarms, and visual cues to help you stay organized and on track. Break tasks into smaller chunks. Large projects can be overwhelming for individuals with ADHD. Break them down into smaller, more manageable tasks, and tackle them one at a time. Minimize distractions. Create a workspace that is free from distractions as much as possible. Turn off notifications on your phone or computer, close unnecessary tabs, and communicate with colleagues about your need for uninterrupted work time. 2.3.5 Organization and Planning. Staying organized is essential for individuals with ADHD in the workplace. Here are some strategies to help you stay organized and manage your workload effectively. Declutter your workspace. A cluttered workspace can be distracting and overwhelming. Take the time to declutter and organize your physical workspace, keeping only the essentials within reach. Use digital tools. Utilize digital tools such as project management software, task management apps, and digital calendars to keep track of deadlines, meetings, and important information. These tools can help you stay organized and ensure that nothing falls through the cracks. Create a filing system. Establish a filing system for both physical and digital documents. Use labels, folders, and color coding to make it easier to locate and retrieve important information when needed. Break tasks into steps. When starting a new project or task, break it down into smaller steps. This will make it easier to plan and execute, ensuring that nothing is overlooked or forgotten. Set reminders. Use reminders and alarms to prompt you to complete tasks or attend meetings. This can help you stay on top of your responsibilities and avoid missing important deadlines. 2.3.6 Communication and Collaboration. Effective communication and collaboration are vital in any workplace setting. Here are some tips to help individuals with ADHD navigate communication and collaboration. Be proactive. Take the initiative to communicate with your colleagues and supervisors. If you need clarification or assistance, don't hesitate to ask for it. Being proactive can help prevent misunderstandings and ensure that everyone is on the same page. Practice active listening. Pay close attention to what others are saying during meetings or conversations. Take notes if necessary and ask for clarification if something is unclear. Active listening can help you stay engaged and avoid misunderstandings. Use technology to your advantage. Email, instant messaging, and project management tools can be valuable communication tools for individuals with ADHD. They provide a written record of conversations and allow for clear and concise communication. Seek feedback. Regularly seek feedback from your colleagues and supervisors. This can help you identify areas for improvement and make necessary adjustments to your work style. Collaborate effectively. When working on team projects, communicate openly and contribute your ideas and insights. Be mindful of deadlines and ensure that your contributions align with the overall goals of the project. 2.3.7 Managing Stress and Self-Care. Workplace stress can exacerbate ADHD symptoms. It is important to prioritize self-care and manage stress effectively. Here are some strategies to help you manage stress in the workplace. Take breaks. Regularly take short breaks throughout the day to recharge and refocus. Use this time to engage in activities that help you relax and clear your mind. Practice stress management techniques. Incorporate stress management techniques such as deep breathing exercises, mindfulness, and physical activity into your daily routine. These techniques can help reduce stress and improve focus. Establish work-life boundaries. Set clear boundaries between work and personal life. Avoid bringing work-related stress home and make time for activities that bring you joy and relaxation. Seek support. Reach out to supportive colleagues, friends, or family members when you need to talk or vent about work-related stress. Having a support system can provide emotional support and help you navigate challenging situations. Remember, managing ADHD in the workplace is a journey. It may take time to find the strategies and accommodations that work best for you. Be patient with yourself, celebrate your successes, and seek support when needed. With the right tools and support, you can thrive in your professional life and effectively manage ADHD. 2.4 ADHD and time management. Time management can be a significant challenge for individuals with ADHD. The difficulty in managing time effectively is often due to the core symptoms of ADHD, such as impulsivity, distractibility, and difficulty with organization and planning. However, with the right strategies and techniques, individuals with ADHD can improve their time management skills and enhance their overall productivity. In this section, we will explore various strategies that can help individuals with ADHD better manage their time and stay on track. 2.4.1 Setting clear goals and priorities. One of the first steps in effective time management is setting clear goals and priorities. Individuals with ADHD often struggle with prioritizing tasks and tend to get overwhelmed by multiple responsibilities. To overcome this challenge, it is essential to identify and prioritize the most important tasks. Start by creating a to-do list and categorize tasks based on their urgency and importance. Breaking down larger tasks into smaller, manageable steps can also make them less overwhelming and easier to tackle. 2.4.2 Creating routines and schedules. Establishing routines and schedules can be incredibly beneficial for individuals with ADHD. Having a structured daily routine helps create a sense of predictability and reduces the likelihood of forgetting important tasks or appointments. Start by creating a daily schedule that includes specific times for activities such as waking up, meals, work or school, exercise, and relaxation. It is important to stick to the schedule as much as possible, but also allow for flexibility when unexpected events arise. 2.4.3 Managing procrastination. Procrastination is a common challenge for individuals with ADHD. The tendency to delay tasks can lead to increased stress and decreased productivity. To overcome procrastination, it is important to understand the underlying reasons behind it. Often, individuals with ADHD struggle with starting tasks due to difficulties with focus and motivation. Breaking tasks into smaller, more manageable parts can make them feel less overwhelming and increase the likelihood of getting started. Additionally, using techniques such as the Pomodoro technique, where tasks are broken down into short, focused bursts of work followed by short breaks, can help improve focus and reduce procrastination. 2.4.4 Using technology and tools. Technology and various tools can be valuable assets in managing time effectively for individuals with ADHD. There are numerous apps and software available that can help with organizing tasks, setting reminders, and managing schedules. Utilizing digital calendars, task management apps, and reminder systems can help individuals with ADHD stay on top of their responsibilities. Additionally, using timers or alarms can be helpful in keeping track of time and staying focused on tasks. 2.4.5 Breaking tasks into manageable chunks. Breaking tasks into smaller, more manageable chunks is a useful strategy for individuals with ADHD. Large tasks can often feel overwhelming and lead to procrastination or avoidance. By breaking tasks down into smaller steps, it becomes easier to focus on one task at a time and make progress. This approach also provides a sense of accomplishment as each smaller task is completed, which can help maintain motivation and momentum. 2.4.6 Minimizing distractions. Distractions can significantly impact time management for individuals with ADHD. It is important to create an environment that minimizes distractions as much as possible. This can include finding a quiet workspace, turning off notifications on electronic devices, and using noise-canceling headphones if necessary. Additionally, practicing techniques such as mindfulness and deep breathing can help individuals with ADHD refocus their attention when distractions arise. 2.4.7 Allowing for flexibility and adjustments. While routines and schedules are essential for effective time management, it is also important to allow for flexibility and adjustments. Recognize that unexpected events or changes in plans can occur, and it is necessary to adapt accordingly. Being flexible and open to making adjustments to the schedule can help reduce stress and maintain a sense of control over time management. 2.4.8 Seeking support and accountability. Seeking support and accountability can be beneficial for individuals with ADHD in managing their time effectively. This can involve enlisting the help of a trusted friend, family member, or coach who can provide guidance, encouragement, and accountability. Working with a professional, such as a therapist or coach specializing in ADHD, can also provide valuable strategies and support in improving time management skills. In conclusion, time management can be a significant challenge for individuals with ADHD. However, by implementing strategies such as setting clear goals and priorities, creating routines and schedules, managing procrastination, utilizing technology and tools, breaking tasks into manageable chunks, minimizing distractions, allowing for flexibility, and seeking support, individuals with ADHD can improve their time management skills and enhance their overall productivity. With practice and perseverance, individuals with ADHD can learn to effectively manage their time and thrive in their daily lives. 3. Developing a treatment plan. 3.1 Medication options. Medication is one of the most common and effective treatment options for managing ADHD. It can help individuals with ADHD improve their focus, attention, and impulse control, allowing them to better manage their symptoms and function more effectively in their daily lives. In this section, we will explore the different types of medications available for ADHD and discuss their benefits, potential side effects, and considerations for choosing the right medication. 3.1.1 Stimulant medications. Stimulant medications are the most commonly prescribed medications for ADHD. They work by increasing the levels of certain chemicals in the brain that are responsible for regulating attention and impulse control. There are two main types of stimulant medications, methylphenidate and amphetamines. Methylphenidate. Methylphenidate is a commonly prescribed stimulant medication for ADHD. It is available in various forms, including immediate release and extended release formulations. Immediate release formulations typically last for a few hours, while extended release formulations can provide symptom relief for up to 12 hours. Some common brand names of methylphenidate include Ritalin, Concerta, and Daytrana. These medications can help improve focus, attention, and impulse control in individuals with ADHD. However, it is important to note that they may have different effects on different individuals, and finding the right dosage and formulation may require some trial and error. Amphetamines. Amphetamines are another type of stimulant medication commonly prescribed for ADHD. They work by increasing the levels of certain neurotransmitters in the brain, which helps improve attention and impulse control. Some common brand names of amphetamines include Adderall, Vyvanse, and Dexedrine. Amphetamines are available in immediate release and extended release formulations. Immediate release formulations typically last for a few hours, while extended release formulations can provide symptom relief for up to 12 hours. Like methylphenidate, finding the right dosage and formulation may require some adjustment. 3.1.2 Non-stimulant medications. While stimulant medications are the first-line treatment for ADHD, they may not be suitable for everyone. In such cases, non-stimulant medications may be considered as an alternative. Non-stimulant medications work differently from stimulants and can be effective in managing ADHD symptoms for some individuals. Atomoxetine. Atomoxetine is a non-stimulant medication that is commonly prescribed for ADHD. It works by increasing the levels of norepinephrine in the brain, which helps improve attention and impulse control. Atomoxetine is available in extended-release capsules and is usually taken once a day. Some common brand names of atomoxetine include Strattera. It may take several weeks for the full effects of atomoxetine to be felt, so patience and consistent use are important when taking this medication. Guanfacine and clonidine. Guanfacine and clonidine are medications that are primarily used to treat high blood pressure but have also been found to be effective in managing ADHD symptoms. They work by affecting certain receptors in the brain, which helps improve attention and impulse control. Some common brand names of guanfacine include Intuniv and Tenix, while clonidine is available under the brand name Capve. These medications are usually taken once or twice a day and may be prescribed in combination with other ADHD medications. 3.1.3 Choosing the right medication. Choosing the right medication for ADHD is a highly individualized process. It is important to work closely with a healthcare professional, such as a psychiatrist or a pediatrician, who specializes in ADHD treatment. They will consider various factors, including the individual's age, medical history, and specific symptoms, to determine the most appropriate medication and dosage. During the medication selection process, it is essential to communicate openly with the healthcare professional about any concerns or side effects experienced. They may need to adjust the dosage or try a different medication to find the most effective treatment plan. It is also important to note that medication alone may not be sufficient for managing ADHD. It is often used in combination with other treatment strategies, such as therapy, lifestyle changes, and support from family and friends. A comprehensive treatment plan that addresses all aspects of ADHD management is typically the most effective approach. In conclusion, medication can be a valuable tool in managing ADHD symptoms. Stimulant medications, such as methylphenidate and amphetamines, are commonly prescribed and can help improve focus, attention, and impulse control. Non-stimulant medications, such as atomoxetine, guanfacine, and clonidine, may be considered as alternatives for individuals who cannot tolerate or do not respond well to stimulants. Choosing the right medication requires careful consideration and collaboration with a healthcare professional. Remember, medication is just one part of a comprehensive treatment plan for ADHD, and it is important to explore other strategies and support systems to effectively manage the condition. 3.2 Therapy and counseling. Therapy and counseling play a crucial role in managing ADHD. While medication can help alleviate some of the symptoms, therapy provides individuals with the tools and strategies they need to cope with the challenges that ADHD presents in their daily lives. Therapy can help individuals develop a better understanding of their condition, learn effective coping mechanisms, and improve their overall well-being. 3.2.1 Types of therapy. There are several types of therapy that have been found to be effective in managing ADHD. The choice of therapy depends on the individual's needs and preferences. Here are some commonly used therapies for ADHD. 3.2.1.1 Cognitive Behavioral Therapy, CBT. Cognitive behavioral therapy, CBT, is a widely used therapeutic approach for ADHD. It focuses on identifying and changing negative thought patterns and behaviors that contribute to ADHD symptoms. CBT helps individuals develop strategies to manage impulsivity, improve organizational skills, and enhance problem-solving abilities. It also addresses emotional regulation and helps individuals develop coping mechanisms for dealing with stress and frustration. 3.2.1.2 Psychoeducation. Psychoeducation is an essential component of ADHD therapy. It involves educating individuals and their families about the nature of ADHD, its symptoms, and its impact on daily life. Psychoeducation helps individuals understand their strengths and weaknesses and provides them with information about available treatment options. It also helps families and loved ones develop a better understanding of ADHD and learn how to provide support. 3.2.1.3 Family Therapy. ADHD can have a significant impact on family dynamics. Family therapy aims to improve communication and understanding within the family unit. It helps family members develop strategies for managing ADHD-related challenges and fosters a supportive and nurturing environment. Family therapy can also address any underlying issues that may be contributing to ADHD symptoms, such as relationship conflicts or parenting difficulties. 3.2.1.4 Social Skills Training. Many individuals with ADHD struggle with social interactions and maintaining relationships. Social skills training focuses on teaching individuals the necessary skills to navigate social situations successfully. It helps individuals develop effective communication skills, improve empathy and understanding, and manage impulsivity in social settings. Social skills training can significantly enhance an individual's ability to form and maintain meaningful relationships. 3.2.2 Benefits of therapy for ADHD. Therapy and counseling offer numerous benefits for individuals with ADHD. Here are some of the key advantages. 3.2.2.1 Skill development. Therapy provides individuals with the opportunity to develop essential skills for managing ADHD. Through therapy, individuals can learn strategies for improving focus and attention, managing impulsivity, and enhancing organizational skills. These skills can have a significant impact on an individual's daily life, helping them succeed in various areas, including school, work, and relationships. 3.2.2.2 Emotional regulation. ADHD can often lead to emotional dysregulation, including difficulties managing anger, frustration, and impulsivity. Therapy can help individuals develop effective techniques for emotional regulation, allowing them to better control their emotions and respond to challenging situations in a more constructive manner. Learning to manage emotions can lead to improved relationships and overall well-being. 3.2.2.3 Improved self-esteem. Many individuals with ADHD struggle with low self-esteem and feelings of inadequacy. Therapy can help individuals develop a more positive self-image by focusing on their strengths and accomplishments. Through therapy, individuals can gain a better understanding of their unique abilities and learn to appreciate their strengths. This increased self-esteem can have a profound impact on an individual's confidence and overall quality of life. 3.2.2.4 Support and validation. Therapy provides a safe and supportive environment where individuals can express their thoughts and feelings without judgment. It offers a space for individuals to discuss their challenges and frustrations related to ADHD. Therapists can provide validation and support, helping individuals feel understood and accepted. This support can be invaluable in managing the emotional and psychological aspects of living with ADHD. 3.2.3 Finding a therapist. Finding the right therapist is essential for effective ADHD management. Here are some tips for finding a therapist. 3.2.3.1 Seek recommendations. Ask for recommendations from trusted sources, such as healthcare professionals, friends, or family members. They may be able to provide referrals to therapists who specialize in ADHD or have experience working with individuals with similar challenges. 3.2.3.2 Research credentials and experience. When considering a therapist, research their credentials and experience. Look for therapists who have specific training or expertise in ADHD. It can also be helpful to find a therapist who has experience working with individuals of your age group, as the challenges and needs may vary. 3.2.3.3 Schedule an initial consultation. Before committing to therapy, schedule an initial consultation with the therapist. This meeting allows you to assess whether you feel comfortable and connected with the therapist. It is essential to find a therapist with whom you have a good rapport and feel understood. 3.2.3.4 Consider insurance coverage and cost. Therapy can be costly, so it is important to consider your insurance coverage and budget. Check with your insurance provider to determine what therapy services are covered. If cost is a concern, inquire about sliding scale fees or community resources that offer affordable therapy options. 3.2.4 Incorporating therapy into treatment. Therapy should be viewed as an integral part of a comprehensive treatment plan for ADHD. It can complement medication and other interventions, providing individuals with the necessary skills and support to manage their symptoms effectively. Regular therapy sessions, combined with medication and lifestyle changes, can significantly improve an individual's ability to cope with ADHD and lead a fulfilling life. In conclusion, therapy and counseling are essential components of managing ADHD. They provide individuals with the tools and strategies needed to navigate the challenges associated with the condition. Therapy can help individuals develop important skills, regulate their emotions, improve self-esteem, and provide much-needed support. Finding the right therapist is crucial, and incorporating therapy into a comprehensive treatment plan can lead to significant improvements in managing ADHD symptoms. 3.3 Lifestyle changes. Living with ADHD can be challenging, but making certain lifestyle changes can greatly improve your ability to manage the symptoms and lead a more fulfilling life. While medication and therapy are important components of treatment, incorporating healthy habits and routines into your daily life can have a significant impact on your overall well-being. In this section, we will explore various lifestyle changes that can help you effectively manage ADHD symptoms and enhance your quality of life. 3.3.1 Establishing a consistent routine. One of the most effective ways to manage ADHD is by establishing a consistent daily routine. Having a structured schedule can help you stay organized, reduce stress, and improve your ability to focus and complete tasks. Start by creating a daily schedule that includes specific times for waking up, meals, work or school activities, exercise, relaxation, and bedtime. Stick to this routine as much as possible, even on weekends or during vacations. Consistency is key in helping your brain establish patterns and develop a sense of predictability. 3.3.2 Prioritizing sleep. Getting enough quality sleep is crucial for individuals with ADHD. Lack of sleep can exacerbate symptoms such as inattention, impulsivity, and irritability. Aim for a consistent sleep schedule, going to bed and waking up at the same time each day. Create a relaxing bedtime routine that includes activities such as reading, taking a warm bath, or practicing relaxation techniques like deep breathing or meditation. Avoid stimulating activities, such as using electronic devices or consuming caffeine, close to bedtime, as they can interfere with your ability to fall asleep. 3.3.3 Regular exercise. Engaging in regular physical activity is not only beneficial for your physical health but also for managing ADHD symptoms. Exercise helps increase dopamine and norepinephrine levels in the brain, which are neurotransmitters that play a crucial role in attention and focus. Find activities that you enjoy and make them a regular part of your routine. Whether it's going for a walk, practicing yoga, playing a sport, or dancing, incorporating exercise into your daily life can help reduce hyperactivity, improve mood, and enhance cognitive function. 3.3.4 Healthy diet. While there is no specific ADHD diet, making healthy food choices can support your overall well-being and help manage symptoms. Opt for a balanced diet that includes a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats. Avoid excessive consumption of sugary foods and drinks, as they can lead to energy crashes and difficulty concentrating. It may also be helpful to eat smaller, frequent meals throughout the day to maintain stable blood sugar levels and prevent hunger-related distractions. 3.3.5 Stress management techniques. Stress can significantly impact individuals with ADHD, making it harder to focus and stay organized. Learning effective stress management techniques can help you better cope with daily challenges. Consider incorporating activities such as deep breathing exercises, mindfulness meditation, journaling, or engaging in hobbies that you find relaxing and enjoyable. It's important to find what works best for you and make time for these activities regularly to reduce stress levels and improve your ability to manage ADHD symptoms. 3.3.6 Minimizing distractions. Creating an environment that minimizes distractions can greatly improve your ability to focus and concentrate. Identify potential distractions in your surroundings and take steps to eliminate or reduce them. This may include organizing your workspace, using noise-canceling headphones, turning off notifications on your electronic devices, or finding a quiet place to work or study. Additionally, breaking tasks into smaller, manageable chunks can help you stay focused and avoid feeling overwhelmed. 3.3.7 Time management strategies. Effective time management is essential for individuals with ADHD. Breaking tasks down into smaller, more manageable steps can make them feel less overwhelming. Consider using tools such as timers, alarms, or smartphone apps to help you stay on track and manage your time effectively. Prioritize tasks based on importance and urgency, and consider using visual aids such as calendars, to-do lists, or color-coded schedules to help you stay organized and remember important deadlines. 3.3.8 Social support. Building a strong support network can be invaluable in managing ADHD. Surround yourself with understanding and supportive individuals who can offer encouragement, guidance, and assistance when needed. This may include family members, friends, support groups, or therapists who specialize in ADHD. Sharing your experiences and challenges with others who can relate can provide a sense of validation and help you develop effective strategies for managing symptoms. 3.3.9 Mindfulness and relaxation techniques. Practicing mindfulness and relaxation techniques can help improve focus, reduce stress, and enhance overall well-being. Mindfulness involves paying attention to the present moment without judgment, allowing you to become more aware of your thoughts, feelings, and sensations. Incorporating mindfulness exercises, such as deep breathing, body scans, or guided meditation, into your daily routine can help calm your mind and improve your ability to stay focused and present. 3.3.10 Seeking professional help. While lifestyle changes can be beneficial in managing ADHD, it's important to remember that everyone's journey is unique. If you find that your symptoms are significantly impacting your daily life and these lifestyle changes are not enough, it may be helpful to seek professional help. A healthcare provider or mental health professional can provide a comprehensive evaluation, offer additional treatment options, and tailor a plan specifically to your needs. By incorporating these lifestyle changes into your daily routine, you can effectively manage ADHD symptoms and improve your overall well-being. Remember, managing ADHD is a lifelong process, and it's important to be patient and kind to yourself as you navigate this journey. With the right strategies and support, you can thrive and lead a fulfilling life with ADHD. 3.4 Alternative treatments. While medication, therapy, and lifestyle changes are often the primary treatment options for ADHD, there are also alternative treatments that some individuals find helpful in managing their symptoms. These alternative treatments can be used in conjunction with traditional approaches or as standalone methods, depending on the individual's preferences and needs. It's important to note that alternative treatments may not have the same level of scientific evidence supporting their effectiveness as traditional treatments, so it's essential to approach them with an open mind and consult with a healthcare professional before incorporating them into your treatment plan. In this section, we will explore some alternative treatments that have been suggested for managing ADHD symptoms. 3.4.1 Mindfulness and meditation. Mindfulness and meditation practices have gained popularity in recent years for their potential benefits in reducing stress, improving focus, and promoting overall well-being. These practices involve bringing one's attention to the present moment and cultivating a non-judgmental awareness of thoughts, emotions, and sensations. For individuals with ADHD, mindfulness and meditation can help enhance self-regulation, increase attention span, and reduce impulsivity. Research suggests that regular mindfulness practice may lead to improvements in executive functioning and emotional regulation, which are areas often affected by ADHD. To incorporate mindfulness and meditation into your daily routine, you can start with short sessions of just a few minutes and gradually increase the duration over time. There are various techniques you can explore, such as focused attention meditation, loving-kindness meditation, or body scan meditation. Additionally, there are numerous smartphone apps and online resources available that offer guided meditation sessions specifically designed for ADHD. 3.4.2 Acupuncture. Acupuncture is an ancient Chinese practice that involves the insertion of thin needles into specific points on the body. It is believed to help restore the flow of energy, known as qi, and promote balance within the body. While the scientific evidence supporting acupuncture as a treatment for ADHD is limited, some individuals report improvements in focus, attention, and overall well-being after receiving acupuncture treatments. Acupuncture may also help alleviate stress and anxiety, which are common co-occurring conditions with ADHD. If you are considering acupuncture as an alternative treatment for ADHD, it's important to consult with a licensed acupuncturist who has experience working with individuals with ADHD. They will be able to assess your specific needs and develop a treatment plan tailored to your condition. 3.4.3 Herbal supplements. Herbal supplements have been used for centuries in traditional medicine systems to support various health conditions, including ADHD. While the scientific evidence for the effectiveness of herbal supplements in managing ADHD symptoms is limited, some individuals find them helpful as complementary treatments. It's important to note that herbal supplements are not regulated by the same standards as prescription medications, so caution should be exercised when considering their use. Some commonly used herbal supplements for ADHD include ginkgo biloba, believed to improve cognitive function and memory. Ginseng, thought to enhance focus and attention. Omega-3 fatty acids, found in fish oil and believed to support brain health. St. John's wort, used for its potential mood-stabilizing effects. Before incorporating any herbal supplements into your treatment plan, it's crucial to consult with a healthcare professional, as they can provide guidance on potential interactions with other medications and ensure your safety. 3.4.4 Neurofeedback. Neurofeedback, also known as EEG biofeedback, is a non-invasive technique that aims to train individuals to regulate their brainwave patterns. It involves using sensors to monitor brain activity and providing real-time feedback to the individual through visual or auditory cues. The goal of neurofeedback is to help individuals learn to self-regulate their brain activity and improve attention, focus, and impulse control. While the research on neurofeedback for ADHD is still evolving, some studies suggest that it may be a promising alternative treatment option. However, it's important to note that the effectiveness of neurofeedback can vary from person to person, and it may require multiple sessions to see noticeable improvements. It's recommended to work with a trained professional who specializes in neurofeedback to ensure proper assessment and guidance throughout the process. 3.4.5 Exercise and physical activity. Regular exercise and physical activity have been shown to have numerous benefits for overall health and well-being, including potential benefits for individuals with ADHD. Engaging in physical activity can help reduce hyperactivity, improve mood, increase attention span, and enhance cognitive function. Exercise releases endorphins, which are natural mood-boosting chemicals in the brain, and can also help reduce stress and anxiety. Incorporating exercise into your daily routine can be as simple as going for a walk, riding a bike, or participating in a sport or fitness class. Finding activities that you enjoy and can sustain over time is key to making exercise a regular part of your ADHD management plan. 3.4.6 Dietary changes. While there is no specific ADHD diet, some individuals find that certain dietary changes can have a positive impact on their symptoms. It's important to note that the relationship between diet and ADHD is complex and can vary from person to person. However, some general recommendations include eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Reducing the consumption of processed foods, sugary snacks, and beverages. Avoiding food additives, such as artificial colors and preservatives, which some individuals may be sensitive to. Considering a trial period of eliminating common allergens, such as gluten or dairy, to see if there is any improvement in symptoms. It's important to consult with a healthcare professional or a registered dietitian before making any significant dietary changes, as they can provide personalized guidance based on your specific needs and medical history. 3.4.7 Yoga and Tai Chi. Yoga and Tai Chi are mind-body practices that combine physical postures, breathing exercises, and meditation. These practices can help improve flexibility, balance, and overall well-being. For individuals with ADHD, practicing yoga or Tai Chi may help reduce stress, increase body awareness, and improve focus and attention. There are various styles and levels of yoga and Tai Chi, so it's important to find a class or instructor that suits your needs and preferences. It's also worth noting that modifications can be made to accommodate different fitness levels or physical limitations. 3.4.8 Art Therapy. Art therapy is a form of therapy that uses creative processes, such as drawing, painting, or sculpting, to promote self-expression and emotional healing. It can provide a nonverbal outlet for individuals with ADHD to express their thoughts and emotions, reduce stress, and improve focus and attention. Engaging in art therapy can also help individuals develop problem-solving skills and enhance self-esteem. Art therapy can be done individually or in a group setting, and it's important to work with a trained art therapist who can guide the process and provide a safe and supportive environment. 3.4.9 Chiropractic Care. Chiropractic care is a form of alternative medicine that focuses on the diagnosis and treatment of musculoskeletal disorders, primarily through manual adjustments and manipulations of the spine. While there is limited scientific evidence supporting chiropractic care as a treatment for ADHD specifically, some individuals report improvements in their overall well-being and symptom management after receiving chiropractic treatments. Chiropractic care may help reduce stress, improve sleep quality, and enhance overall body function. If you are considering chiropractic care as an alternative treatment for ADHD, it's important to consult with a licensed chiropractor who has experience working with individuals with ADHD. They will be able to assess your specific needs and develop a treatment plan tailored to your condition. 3.4.10 Biofeedback. Biofeedback is a technique that involves using electronic devices to measure and provide feedback on physiological processes, such as heart rate, muscle tension, or skin temperature. By learning to control these physiological responses, individuals can gain greater awareness and control over their body's stress response. Biofeedback may help individuals with ADHD improve self-regulation, reduce anxiety, and enhance focus and attention. Working with a trained professional who specializes in biofeedback is recommended to ensure proper assessment and guidance throughout the process. They will be able to tailor the biofeedback training to your specific needs and provide ongoing support. 3.4.11 Aromatherapy. Aromatherapy involves the use of essential oils derived from plants to promote physical and psychological well-being. While the scientific evidence supporting the effectiveness of aromatherapy for ADHD is limited, some individuals find certain essential oils helpful in managing their symptoms. Lavender, chamomile, and vetiver are commonly mentioned as potentially calming and focusing scents. When using essential oils, it's important to follow proper dilution guidelines and consult with a healthcare professional, as some essential oils can cause skin irritation or interact with medications. 3.4.12 Animal-assisted therapy. Animal-assisted therapy involves interactions with trained animals, such as dogs or horses, to promote emotional well-being and improve social skills. Animals can provide comfort, companionship, and a non-judgmental presence, which can be particularly beneficial for individuals with ADHD who may struggle with social interactions or emotional regulation. Animal-assisted therapy may help reduce stress, improve mood, and increase motivation. If you are considering animal-assisted therapy as an alternative treatment for ADHD, it's important to work with a licensed therapist or organization that specializes in this type of therapy. They will be able to assess your specific needs and match you with an appropriate animal-assisted therapy program. 3.4.13 Massage Therapy. Massage therapy involves the manipulation of soft tissues in the body to promote relaxation, reduce muscle tension, and improve overall well-being. While the scientific evidence supporting massage therapy as a treatment for ADHD is 4. Building effective strategies. 4.1 Organization and planning. One of the key challenges faced by individuals with ADHD is difficulty with organization and planning. This can manifest in various ways, such as struggling to keep track of tasks, forgetting important deadlines, or feeling overwhelmed by a lack of structure. However, with the right strategies and techniques, it is possible to improve organization and planning skills, leading to greater productivity and success in daily life. 4.1.1 Creating a system. To effectively manage ADHD, it is crucial to establish a system that helps you stay organized and on top of your responsibilities. This system should be tailored to your individual needs and preferences, as what works for one person may not work for another. Here are some steps to help you create an effective organizational system. Identify your priorities. Start by determining what tasks and responsibilities are most important to you. This will help you allocate your time and energy more effectively. Break tasks into smaller steps. Large tasks can be overwhelming for individuals with ADHD. Break them down into smaller, more manageable steps to make them less daunting and easier to tackle. Use a planner or digital calendar. Find a system that works for you, whether it's a physical planner or a digital calendar app. Use it to record important dates, deadlines, and appointments. Set reminders to help you stay on track. Create to-do lists. Make a daily or weekly to-do list to keep track of tasks that need to be completed. Prioritize the most important tasks and check them off as you go. This will provide a sense of accomplishment and help you stay focused. Establish routines. Establishing consistent routines can be incredibly helpful for individuals with ADHD. Set specific times for activities such as waking up, eating meals, and going to bed. This will provide structure and make it easier to stay organized. Use visual cues. Visual cues can be powerful tools for organization. Use color-coded labels, sticky notes, or visual reminders to help you remember important tasks or deadlines. Minimize distractions. Create an environment that minimizes distractions. Find a quiet space to work, turn off notifications on your phone or computer, and use noise-canceling headphones if necessary. 4.1.2 Time Management Techniques. Effective time management is essential for individuals with ADHD. Poor time management can lead to missed deadlines, increased stress, and a sense of being overwhelmed. Here are some techniques to help you better manage your time. Set realistic goals. Break down your tasks and set realistic goals for what you can accomplish within a given time frame. Avoid overloading yourself with too many tasks at once. Use time blocking. Time blocking involves scheduling specific blocks of time for different activities or tasks. This helps you allocate your time more effectively and ensures that important tasks are not overlooked. Prioritize tasks. Determine which tasks are most important and prioritize them accordingly. Focus on completing high-priority tasks first before moving on to less urgent ones. Use timers and alarms. Set timers or alarms to help you stay on track and manage your time more effectively. This can be particularly useful for tasks that tend to take longer than expected or for activities that you tend to lose track of time while doing. Practice the Pomodoro Technique. The Pomodoro Technique involves working in short bursts of focused activity, typically 25 minutes, followed by a short break. This can help improve focus and prevent burnout. Delegate tasks. If possible, delegate tasks that can be done by others. This can help lighten your workload and free up time for more important tasks. Learn to say no. It's important to recognize your limits and not overcommit yourself. Learn to say no to tasks or activities that are not essential or that would overwhelm your schedule. 4.1.3 Managing Paperwork and Documents. For many individuals with ADHD, managing paperwork and documents can be a significant challenge. The following strategies can help you stay organized and prevent important documents from getting lost or misplaced. Create a filing system. Establish a filing system that works for you. Use labeled folders or binders to categorize and store important documents. Consider using color-coded labels to make it easier to locate specific documents. Scan and digitize documents. Consider scanning important documents and storing them digitally. This can help reduce clutter and make it easier to search for specific documents when needed. Set up reminders. Use reminders or alerts to prompt you to review and organize your paperwork regularly. This will help prevent documents from piling up and becoming overwhelming. Designate a specific area. Designate a specific area in your home or office for paperwork and documents. Keep this area clean and clutter-free to make it easier to find what you need. Use a document management app. Consider using a document management app or software to help you organize and track important documents. These tools often have features such as document search, tagging, and cloud storage. Remember, developing effective organization and planning skills takes time and practice. Be patient with yourself as you implement these strategies and make adjustments as needed. With consistent effort and the right tools, you can improve your ability to stay organized and manage your ADHD more effectively. 4.2 Improving Focus and Attention. One of the core challenges faced by individuals with ADHD is difficulty in maintaining focus and attention. This can have a significant impact on various aspects of their lives, including school, work, and relationships. However, there are several strategies and techniques that can be employed to improve focus and attention and help individuals with ADHD manage their symptoms more effectively. 4.2.1 Creating a distraction-free environment. Creating a distraction-free environment is essential for individuals with ADHD to improve their focus and attention. Minimizing external distractions can significantly enhance their ability to concentrate on tasks at hand. Here are some tips to create a conducive environment. Organize your workspace. Keep your workspace clean and clutter-free. Remove any unnecessary items that may distract you. Use organizers and storage solutions to keep your materials and supplies neatly arranged. Minimize noise. Noise can be a major distraction for individuals with ADHD. Find a quiet place to work or study, away from loud noises and interruptions. Consider using noise-canceling headphones or playing soft background music to drown out any distracting sounds. Manage digital distractions. Digital devices can be a major source of distraction. Turn off notifications on your phone or computer to minimize interruptions. Use website blockers or apps that limit your access to social media and other distracting websites during focused work or study sessions. Establish boundaries. Communicate with those around you about the importance of uninterrupted focus time. Let your family, friends, or colleagues know when you need to concentrate and ask for their support in minimizing distractions during those periods. 4.2.2 Implementing time management techniques. Effective time management is crucial for individuals with ADHD to improve their focus and attention. By organizing their time and tasks, they can prioritize their activities and allocate sufficient time for each task. Here are some time management techniques that can be helpful. Use a planner or digital calendar. Keep track of your tasks, appointments, and deadlines using a planner or a digital calendar. Break down larger tasks into smaller, manageable steps and assign specific time slots for each task. Set realistic goals. Set achievable goals for yourself and break them down into smaller milestones. This will help you stay focused and motivated as you make progress towards your larger objectives. Use timers and reminders. Set timers to allocate specific time periods for focused work or study. Use reminders or alarms to prompt you to switch tasks or take breaks at regular intervals. This can help you maintain a structured routine and prevent you from getting too absorbed in a single task. Prioritize tasks. Identify the most important tasks that need to be completed and prioritize them accordingly. Focus on completing high-priority tasks first before moving on to less urgent ones. This will help you stay on track and ensure that important deadlines are met. 4.2.3 Practicing mindfulness and meditation. Mindfulness and meditation techniques can be highly beneficial for individuals with ADHD in improving their focus and attention. These practices involve training the mind to stay present and focused, reducing distractions and enhancing mental clarity. Here are some mindfulness and meditation techniques to consider. Deep breathing exercises. Take a few moments throughout the day to practice deep breathing exercises. Focus on your breath as you inhale and exhale slowly. This can help calm your mind, reduce stress, and improve your ability to concentrate. Body scan meditation. Sit or lie down in a comfortable position and bring your attention to different parts of your body, starting from your toes and moving up to your head. Notice any sensations or tension in each area and consciously release any tension you may be holding. This practice can help you become more aware of your body and bring your focus to the present moment. Guided visualization. Close your eyes and imagine yourself in a calm and peaceful environment. Visualize yourself successfully completing tasks and staying focused. This technique can help you create a positive mental image and enhance your ability to concentrate. Mindful eating. Pay attention to the sensory experience of eating, such as the taste, texture, and smell of the food. Slow down and savor each bite, fully engaging your senses. This practice can help improve your ability to stay present and focused on the task at hand. 4.2.4 Engaging in regular physical exercise. Regular physical exercise has been shown to have numerous benefits for individuals with ADHD, including improved focus and attention. Exercise helps increase blood flow to the brain, releases endorphins that boost mood, and reduces hyperactivity and impulsivity. Here are some ways to incorporate exercise into your routine. Choose activities you enjoy. Find physical activities that you enjoy and are more likely to stick with. This could include activities such as walking, jogging, swimming, dancing, or playing a sport. Engaging in activities you find enjoyable will make it easier to incorporate exercise into your daily routine. Schedule exercise breaks. Set aside specific times during the day for exercise breaks. This could be a short walk during your lunch break or a workout session in the morning or evening. Regular exercise breaks can help refresh your mind, increase energy levels, and improve your ability to focus. Combine exercise with other tasks. If finding time for exercise is a challenge, try combining it with other tasks. For example, you can listen to educational podcasts or audiobooks while going for a walk or use a stationary bike while watching your favorite TV show. This way, you can make the most of your time and incorporate exercise into your daily activities. Consider group activities. Joining a sports team or exercise class can provide social support and motivation. Engaging in group activities can also help improve your focus and attention as you interact with others and follow instructions. Improving focus and attention is a key aspect of managing ADHD. By creating a distraction-free environment, implementing effective time management techniques, practicing mindfulness and meditation, and engaging in regular physical exercise, individuals with ADHD can enhance their ability to concentrate and stay focused on tasks. These strategies, along with other techniques discussed in this book, can help individuals with ADHD thrive and lead fulfilling lives. 4.3 Managing impulsivity. Impulsivity is a common symptom of ADHD that can significantly impact daily life. Individuals with ADHD often struggle with acting before thinking, making impulsive decisions, and having difficulty controlling their impulses. This can lead to a variety of challenges in various areas of life, including relationships, work, and personal well-being. However, there are strategies and techniques that can help individuals with ADHD manage their impulsivity and make more thoughtful and deliberate choices. 4.3.1 Understanding impulsivity. Impulsivity is characterized by a lack of self-control and the tendency to act on immediate desires or urges without considering the consequences. It can manifest in various ways, such as interrupting others, blurting out inappropriate comments, engaging in risky behaviors, or making impulsive purchases. Impulsivity can have a negative impact on relationships, as it may lead to misunderstandings, conflicts, and hurt feelings. It can also hinder academic or professional success, as impulsive actions may result in poor decision-making or incomplete tasks. 4.3.2 Recognizing triggers. One of the first steps in managing impulsivity is to identify the triggers that lead to impulsive behaviors. Triggers can vary from person to person, but common ones include stress, boredom, frustration, or excitement. By recognizing these triggers, individuals with ADHD can become more aware of their impulsive tendencies and develop strategies to prevent or redirect impulsive actions. 4.3.3 Pause and reflect. When faced with an impulsive urge or desire, it can be helpful to pause and take a moment to reflect before acting. This pause allows individuals with ADHD to consider the potential consequences of their actions and make a more thoughtful decision. Taking a deep breath, counting to 10, or physically removing oneself from the situation can provide the necessary space to regain control and make a more rational choice. 4.3.4 Delayed gratification. Practicing delayed gratification is an effective strategy for managing impulsivity. This involves resisting the immediate desire for instant rewards and instead focusing on long-term goals. By delaying gratification, individuals with ADHD can develop patience and self-control. Setting specific goals and reminding oneself of the bigger picture can help maintain motivation and reduce impulsive behaviors. 4.3.5 Utilizing cognitive behavioral techniques. Cognitive behavioral techniques can be beneficial in managing impulsivity. These techniques involve identifying and challenging negative thought patterns and replacing them with more positive and rational thoughts. By recognizing impulsive thoughts and reframing them, individuals with ADHD can gain better control over their actions. Cognitive behavioral therapy (CBT) can be particularly helpful in teaching individuals with ADHD how to identify and modify impulsive behaviors. 4.3.6 Developing coping strategies. Developing coping strategies can assist individuals with ADHD in managing impulsivity. These strategies can include creating a structured environment, establishing routines, and setting clear boundaries. Having a predictable and organized routine can help reduce impulsive behaviors by providing a sense of stability and control. Additionally, practicing relaxation techniques, such as deep breathing exercises or mindfulness meditation, can help individuals with ADHD manage stress and reduce impulsive reactions. 4.3.7 Seeking support. Seeking support from others can be invaluable in managing impulsivity. Friends, family members, or support groups can provide understanding, encouragement, and accountability. Sharing experiences and strategies with others who have ADHD can also offer valuable insights and coping mechanisms. Additionally, working with a therapist or counselor who specializes in ADHD can provide guidance and support in developing effective strategies for managing impulsivity. 4.3.8 Medication and other treatment options. In some cases, medication may be prescribed to help manage impulsivity in individuals with ADHD. Stimulant medications, such as methylphenidate or amphetamines, can help improve impulse control and reduce impulsive behaviors. However, medication should always be used in conjunction with other strategies and under the guidance of a healthcare professional. 4.3.9 Practice self-care. Taking care of oneself is crucial in managing impulsivity. Engaging in regular exercise, getting enough sleep, and maintaining a healthy diet can all contribute to improved self-regulation and impulse control. Engaging in activities that promote relaxation and stress reduction, such as hobbies or mindfulness practices, can also help individuals with ADHD manage impulsivity more effectively. 4.3.10 Celebrate progress. Managing impulsivity is an ongoing process, and it is important to acknowledge and celebrate progress along the way. Recognizing and celebrating small victories can provide motivation and reinforce positive behaviors. Whether it's resisting an impulsive urge, making a thoughtful decision, or successfully redirecting impulsive actions, each step forward is a significant achievement. By implementing these strategies and techniques, individuals with ADHD can gain better control over their impulsivity and make more deliberate choices. It is important to remember that managing impulsivity takes time and practice, but with persistence and support, individuals with ADHD can develop effective strategies to navigate their daily lives more successfully. 4.4 Enhancing memory and learning. Memory and learning are essential aspects of managing ADHD. Difficulties with memory and learning can significantly impact daily life, including academic performance, work productivity, and overall functioning. However, there are strategies and techniques that can help individuals with ADHD enhance their memory and improve their learning abilities. In this section, we will explore various approaches to enhance memory and learning for individuals with ADHD. 4.4.1 Understanding memory and ADHD. Memory is the ability to encode, store, and retrieve information. It plays a crucial role in learning, as it allows us to retain and recall information when needed. However, individuals with ADHD often experience challenges with working memory, which is the ability to hold and manipulate information in the mind for a short period. Working memory difficulties can make it challenging to follow instructions, remember details, and stay focused on tasks. It can also affect the ability to organize thoughts and ideas, leading to difficulties in expressing oneself effectively. Understanding these challenges is the first step in developing strategies to enhance memory and learning. 4.4.2 Strategies to enhance memory. 4.4.2.1 Create a structured environment. Creating a structured environment can help individuals with ADHD improve their memory. Establishing consistent routines, organizing physical spaces, and using visual aids can provide a framework that supports memory and learning. Some strategies to consider include establishing a daily routine. Having a predictable schedule can help individuals with ADHD remember important tasks and activities. Organizing physical spaces. Keeping work and living spaces tidy and clutter-free can reduce distractions and improve focus and memory. Using visual aids. Utilizing calendars, to-do lists, and reminders can help individuals with ADHD remember important dates, deadlines, and tasks. 4.4.2.2 Utilize mnemonic devices. Mnemonic devices are memory aids that help individuals remember information through associations or patterns. They can be particularly useful for individuals with ADHD who struggle with rote memorization. Some common mnemonic devices include acronyms, creating a word or phrase using the first letter of each item to be remembered. Visualization, creating mental images or visual representations of information to be remembered. Chunking, breaking down information into smaller, more manageable chunks to aid in memory retention. 4.4.2.3 Practice active learning techniques. Active learning techniques engage individuals in the learning process, making it easier to remember and understand information. Some effective active learning strategies for individuals with ADHD include summarizing information in their own words. Encouraging individuals to summarize what they have learned in their own words helps reinforce memory and understanding. Teaching others. Explaining concepts or information to someone else can enhance memory and comprehension. Engaging in hands-on activities. Incorporating hands-on activities or interactive exercises can help individuals with ADHD better retain information. 4.4.3 Improving learning strategies. In addition to enhancing memory, individuals with ADHD can benefit from improving their overall learning strategies. By adopting effective learning techniques, individuals can optimize their learning experience and improve their academic and professional performance. Here are some strategies to consider. 4.4.3.1 Break tasks into manageable steps. Breaking down tasks into smaller, manageable steps can make learning more approachable for individuals with ADHD. This approach helps prevent overwhelm and allows for better focus and attention. Some tips for breaking tasks into manageable steps include creating a checklist. Breaking down tasks into a checklist format helps individuals track their progress and stay organized. Setting realistic goals. Setting achievable goals for each step of the learning process helps individuals stay motivated and focused. 4.4.3.2 Use multisensory learning techniques. Engaging multiple senses during the learning process can enhance memory and understanding. Multisensory learning techniques involve incorporating visual, auditory, and kinesthetic elements into the learning experience. Some examples of multisensory learning techniques include using visual aids. Incorporating diagrams, charts, and graphs to visualize information. Listening to audio recordings. Recording lectures or important information and listening to them repeatedly. Engaging in hands-on activities. Participating in experiments, simulations, or interactive exercises to reinforce learning. 4.4.3.3 Practice regular review and repetition. Regular review and repetition are essential for long-term memory retention. By revisiting and reinforcing learned material, individuals with ADHD can solidify their understanding and recall information more effectively. Some strategies for regular review and repetition include creating a review schedule, setting aside dedicated time for reviewing previously learned material. Using spaced repetition techniques, gradually increasing the time intervals between review sessions to reinforce memory retention. 4.4.4 Seeking additional support. While implementing these strategies can be beneficial, it is essential to remember that everyone's learning style and needs are unique. Some individuals with ADHD may require additional support to enhance their memory and learning abilities. Seeking assistance from educators, tutors, or learning specialists can provide personalized strategies and guidance tailored to individual needs. Additionally, technology can be a valuable tool for individuals with ADHD. Various apps, software, and tools are designed to support memory and learning. These tools can assist with note-taking, organization, time management, and task tracking, helping individuals with ADHD stay on top of their learning and improve their memory. Remember, enhancing memory and learning is a continuous process. It requires patience, practice, and a willingness to adapt and try different strategies. By implementing these techniques and seeking appropriate support, individuals with ADHD can develop effective memory and learning skills, leading to improved academic and professional success. 5. Creating supportive environments. 5.1 Home environment. The home environment plays a crucial role in managing ADHD. It is the place where individuals with ADHD spend a significant amount of their time, and creating a supportive and structured environment can greatly contribute to their overall well-being and success. In this section, we will explore various strategies and tips for creating an ADHD-friendly home environment. 5.1.1 Organizing the physical space. One of the first steps in creating a supportive home environment for individuals with ADHD is to organize the physical space. A cluttered and disorganized environment can be overwhelming and distracting for someone with ADHD. Here are some tips to help you get started. Declutter. Begin by decluttering the space and getting rid of unnecessary items. Keep only the essentials and find designated places for each item. Create designated spaces. Assign specific areas for different activities, such as a study area, a relaxation corner, and a place for hobbies. This helps individuals with ADHD to associate each space with its intended purpose and reduces distractions. Use storage solutions. Invest in storage solutions such as bins, shelves, and drawers to keep items organized and easily accessible. Labeling containers can also be helpful in maintaining order. Minimize visual distractions. Reduce visual distractions by keeping surfaces clear and minimizing the number of decorations or knickknacks. Use curtains or blinds to control natural light and create a calm and focused atmosphere. 5.1.2 Establishing routines and schedules. Consistency and structure are essential for individuals with ADHD. Establishing routines and schedules can help create a sense of predictability and reduce anxiety. Here are some suggestions for implementing effective routines. Morning and evening routines. Create a consistent morning and evening routine that includes activities such as waking up and going to bed at the same time, personal hygiene, meal times, and preparing for the day ahead or winding down. Daily schedules. Develop a daily schedule that includes specific times for activities such as school or work, meals, breaks, exercise, and leisure time. Use visual aids such as calendars or whiteboards to make the schedule visible and easily accessible. Task lists. Break down tasks into smaller, manageable steps and create to-do lists. Prioritize tasks and use timers or alarms to help stay on track and manage time effectively. Transition strategies. Individuals with ADHD often struggle with transitioning from one activity to another. Use visual cues, timers, or reminders to signal upcoming transitions and help ease the transition process. 5.1.3 Creating a distraction-free zone. Minimizing distractions is crucial for individuals with ADHD to maintain focus and concentration. Creating a designated distraction-free zone can provide a space where they can work or engage in activities without interruptions. Here are some tips for creating a distraction-free zone. Choose a quiet area. Select a quiet area in the home where there are minimal distractions, such as noise or visual stimuli. This could be a separate room, a corner of a room, or a specific workspace. Remove electronic distractions. Keep electronic devices such as smartphones, tablets, or gaming consoles out of the distraction-free zone. If necessary, use apps or software to block access to distracting websites or apps during focused work or study time. Provide necessary supplies. Ensure that the distraction-free zone is equipped with all the necessary supplies and materials needed for the specific activity. This reduces the need to leave the area and minimizes potential distractions. Establish boundaries. Communicate with family members or roommates about the importance of respecting the distraction-free zone. Set clear boundaries and establish rules to minimize interruptions during designated focus time. 5.1.4 Promoting a calm and supportive atmosphere. Creating a calm and supportive atmosphere at home can greatly benefit individuals with ADHD. Here are some strategies to promote a positive environment. Reduce noise. Minimize noise distractions by using noise-canceling headphones, playing soft background music, or using white noise machines. Creating a quiet environment can help improve focus and concentration. Encourage breaks. Allow for regular breaks during tasks or activities to prevent burnout and maintain productivity. Encourage individuals with ADHD to engage in activities that help them relax and recharge, such as going for a walk or practicing deep breathing exercises. Provide emotional support. Individuals with ADHD may face challenges and frustrations. Offer emotional support and understanding, and encourage open communication. Create a safe space where they can express their feelings and concerns without judgment. Celebrate achievements. Recognize and celebrate achievements, no matter how small. Positive reinforcement can boost motivation and self-esteem. Encourage individuals with ADHD to set goals and acknowledge their progress. By implementing these strategies and creating a supportive home environment, individuals with ADHD can better manage their symptoms and thrive in their daily lives. Remember that each person is unique, and it may take some trial and error to find the strategies that work best for them. 5.2 School or work environment. Creating a supportive environment is crucial for individuals with ADHD to thrive in their academic or professional settings. The school or work environment plays a significant role in managing ADHD symptoms and maximizing productivity. In this section, we will explore various strategies and techniques to create an environment that supports individuals with ADHD in their educational or professional pursuits. 5.2.1 Organization and structure. One of the key elements in managing ADHD in the school or work environment is establishing a sense of organization and structure. This can be achieved through several strategies. 5.2.1.1 Clear and consistent expectations. Setting clear and consistent expectations is essential for individuals with ADHD. Whether it's a teacher, supervisor, or employer, providing clear instructions and guidelines can help individuals with ADHD understand what is expected of them. This clarity allows them to focus on their tasks and reduces the likelihood of becoming overwhelmed or distracted. 5.2.1.2 Visual Organization Systems. Visual organization systems can be highly effective for individuals with ADHD. Utilizing tools such as calendars, to-do lists, and color-coded folders can help individuals with ADHD keep track of their assignments, deadlines, and responsibilities. Visual cues provide a tangible reminder of tasks and help individuals stay organized and focused. 5.2.1.3 Structured routines and schedules. Establishing structured routines and schedules can greatly benefit individuals with ADHD. Having a consistent daily routine helps individuals with ADHD manage their time effectively and reduces the likelihood of forgetting important tasks or assignments. Breaking down larger tasks into smaller, manageable steps can also make them more approachable and less overwhelming. 5.2.2 Minimizing distractions. Distractions can significantly impact the focus and productivity of individuals with ADHD. Creating an environment that minimizes distractions can greatly enhance their ability to concentrate and complete tasks. Here are some strategies to consider. 5.2.2.1 Designated workspaces. Having a designated workspace can help individuals with ADHD separate their work or study environment from other distractions. This space should be organized, free from clutter, and equipped with the necessary materials and resources. It is also important to ensure that the workspace is comfortable and conducive to concentration. 5.2.2.2 Noise control. Noise can be a major distraction for individuals with ADHD. Providing noise-canceling headphones or creating a quiet area can help minimize auditory distractions. Additionally, using white noise machines or calming background music can help individuals with ADHD maintain focus and block out external noises. 5.2.2.3 Digital distractions. In today's digital age, managing digital distractions is crucial. Individuals with ADHD may find it helpful to use website blockers or apps that limit access to social media or other distracting websites during work or study periods. Turning off notifications on electronic devices can also reduce the temptation to constantly check messages or emails. 5.2.3 Accommodations and support. In both educational and professional settings, accommodations and support can make a significant difference in the success of individuals with ADHD. Here are some strategies to consider. 5.2.3.1 Individualized Education Plans, IEPs, or 504 plans. For students with ADHD, an Individualized Education Plan, IEP, or a 504 plan can provide necessary accommodations and support. These plans outline specific accommodations, such as extended time on tests or assignments, preferential seating, or access to note-taking assistance. Collaborating with teachers and school administrators to develop these plans can ensure that students with ADHD receive the support they need to succeed academically. 5.2.3.2 Workplace accommodations. In the workplace, individuals with ADHD may benefit from certain accommodations. This could include flexible work hours, the option to work in a quiet space, or the use of assistive technology. Open communication with supervisors or human resources departments can help identify and implement appropriate accommodations. 5.2.3.3 Supportive networks. Building a supportive network is crucial for individuals with ADHD. This can include seeking support from teachers, colleagues, mentors, or support groups. Having individuals who understand and can provide guidance and encouragement can make a significant difference in managing ADHD in the school or work environment. 5.2.4 Effective communication. Effective communication is vital for individuals with ADHD to navigate the school or work environment successfully. Here are some strategies to improve communication. 5.2.4.1 Clear and direct communication. When communicating with individuals with ADHD, it is important to be clear, concise, and direct. Avoid using ambiguous language or excessive details that may lead to confusion or overwhelm. Providing information in a straightforward manner helps individuals with ADHD understand expectations and tasks more effectively. 5.2.4.2 Active listening. Active listening is a valuable skill when communicating with individuals with ADHD. It involves giving full attention to the speaker, maintaining eye contact, and providing verbal or nonverbal cues to show understanding. Active listening helps individuals with ADHD feel heard and understood, fostering positive relationships and effective communication. 5.2.4.3 Written communication. Utilizing written communication can be beneficial for individuals with ADHD. Providing written instructions, meeting agendas, or summaries can serve as a reference point and help individuals with ADHD stay organized and focused. Written communication also allows individuals to review information at their own pace and refer back to it when needed. Creating a supportive school or work environment is essential for individuals with ADHD to thrive and reach their full potential. By implementing strategies such as organization and structure, minimizing distractions, providing accommodations and support, and improving communication. Individuals with ADHD can effectively manage their symptoms and succeed in their academic or professional pursuits. 5.3 Social support networks. Living with ADHD can be challenging, but having a strong support network can make a significant difference in managing the condition. Social support networks consist of individuals who provide emotional, practical, and informational support to those with ADHD. These networks can include family members, friends, teachers, colleagues, support groups, and healthcare professionals. In this section, we will explore the importance of social support networks and provide strategies for building and maintaining them. 5.3.1 The importance of social support. Social support plays a crucial role in managing ADHD. It provides individuals with a sense of belonging, understanding, and validation. Here are some key benefits of having a strong social support network. Emotional support. Living with ADHD can be emotionally challenging. Having someone who understands and empathizes with your struggles can provide comfort and reassurance. Emotional support can help reduce stress, anxiety, and feelings of isolation. Practical support. Practical support involves assistance with daily tasks and responsibilities. This can include help with organizing, planning, and managing time. Having someone who can offer practical support can alleviate some of the burdens associated with ADHD and improve overall functioning. Informational support. Social support networks can also provide valuable information and resources. They can offer guidance on treatment options, coping strategies, and access to relevant research and literature. Having access to accurate and reliable information can empower individuals with ADHD to make informed decisions about their treatment and management. Accountability. A supportive network can help individuals with ADHD stay accountable to their goals and commitments. Whether it's a study buddy, a workout partner, or a mentor, having someone who holds you accountable can increase motivation and help you stay on track. 5.3.2 Building a social support network. Building a social support network takes time and effort, but the benefits are well worth it. Here are some strategies to help you build and maintain a strong support network. Identify supportive individuals. Start by identifying individuals in your life who are supportive and understanding. This could be family members, close friends, or colleagues who have shown empathy and willingness to help. Reach out to them and let them know about your ADHD diagnosis and the support you may need. Join support groups. Support groups provide a safe space for individuals with ADHD to connect, share experiences, and learn from one another. Look for local or online support groups that cater specifically to ADHD. These groups can provide a wealth of knowledge, understanding, and a sense of community. Seek professional help. In addition to your personal network, consider seeking professional help from therapists, counselors, or ADHD coaches. These professionals can provide specialized guidance and support tailored to your specific needs. Communicate your needs. Open and honest communication is essential in building and maintaining a support network. Clearly communicate your needs, challenges, and goals to your support system. This will help them understand how they can best support you. Be a supportive friend. Building a support network is a two-way street. Be willing to offer support and understanding to others in your network. By being a supportive friend, you can strengthen your relationships and create a reciprocal support system. 5.3.3 Maintaining a social support network. Once you have established a social support network, it's important to maintain and nurture those relationships. Here are some tips for maintaining a strong support network. Regular communication. Stay in touch with your support system regularly. This can be through phone calls, text messages, or in-person meetings. Regular communication helps maintain the connection and ensures that you have someone to turn to when needed. Express gratitude. Take the time to express gratitude to those who support you. Let them know how much their support means to you and how it has positively impacted your life. A simple thank you can go a long way in maintaining strong relationships. Attend support group meetings. If you are part of a support group, make an effort to attend meetings regularly. These meetings provide an opportunity to connect with others who understand your experiences and can offer valuable insights and support. Be open to feedback. Be open to receiving feedback from your support system. They may offer suggestions or insights that can help you better manage your ADHD. Remember, feedback is meant to be constructive and supportive. Seek professional help when needed. If you are facing challenges that your support network cannot address, don't hesitate to seek professional help. Therapists, counselors, and ADHD coaches can provide additional guidance and support. Conclusion. Social support networks are an essential component of managing ADHD. They provide emotional, practical, and informational support, helping individuals with ADHD navigate the challenges they face. By building and maintaining a strong support network, individuals with ADHD can enhance their overall well-being and improve their ability to manage their symptoms effectively. Remember, you are not alone in your journey, and there are people who are willing to support you every step of the way. 5.4 Self-care and stress management. Living with ADHD can be challenging, but with the right self-care strategies and stress management techniques, you can effectively manage your symptoms and improve your overall well-being. Self-care is essential for individuals with ADHD as it helps reduce stress, improve focus, and maintain a healthy lifestyle. In this section, we will explore various self-care practices and stress management techniques that can greatly benefit individuals with ADHD. 5.4.1 Prioritize self-care. Taking care of yourself should be a top priority when managing ADHD. Here are some self-care practices that can help you maintain a healthy mind and body. 5.4.1.1 Physical exercise. Engaging in regular physical exercise is not only beneficial for your physical health but also for your mental well-being. Exercise helps release endorphins, which are natural mood boosters. It can also improve focus and attention, reduce impulsivity, and enhance overall cognitive function. Find an exercise routine that you enjoy, whether it's going for a walk, practicing yoga, or participating in team sports. 5.4.1.2 Healthy eating. A balanced diet plays a crucial role in managing ADHD symptoms. Avoiding processed foods and incorporating nutrient-rich foods can help stabilize your energy levels and improve focus. Include plenty of fruits, vegetables, whole grains, and lean proteins in your diet. Additionally, limit your intake of sugary snacks and drinks, as they can lead to energy crashes and difficulty concentrating. 5.4.1.3 Sufficient sleep. Getting enough sleep is vital for individuals with ADHD. Lack of sleep can worsen symptoms such as inattention, impulsivity, and irritability. Establish a consistent sleep routine by going to bed and waking up at the same time every day. Create a relaxing bedtime routine that includes activities such as reading a book or taking a warm bath to help signal your body that it's time to wind down. 5.4.1.4 Relaxation techniques. Incorporating relaxation techniques into your daily routine can help reduce stress and promote a sense of calm. Techniques such as deep breathing exercises, progressive muscle relaxation, and meditation can be highly beneficial. Find a relaxation technique that resonates with you and practice it regularly, especially during times of heightened stress or anxiety. 5.4.2 Stress management techniques. Stress can exacerbate ADHD symptoms, making it crucial to develop effective stress management techniques. Here are some strategies that can help you better manage stress. 5.4.2.1 Time management. Effective time management can significantly reduce stress levels. Break tasks into smaller, manageable chunks and prioritize them based on importance. Use tools such as calendars, planners, or smartphone apps to help you stay organized and on track. Set realistic deadlines and allow yourself breaks in between tasks to prevent burnout. 5.4.2.2 Mindfulness and meditation. Practicing mindfulness and meditation can help calm a racing mind and improve focus. Mindfulness involves being fully present in the moment and non-judgmentally observing your thoughts and feelings. Meditation, on the other hand, involves focusing your attention on a specific object or activity, such as your breath or a mantra. Both practices can help reduce stress and enhance overall well-being. 5.4.2.3 Stress-relieving activities. Engaging in activities that you find enjoyable and relaxing can help alleviate stress. Find hobbies or activities that help you unwind and make time for them regularly. It could be anything from reading a book, listening to music, taking a bath, or spending time in nature. Experiment with different activities and find what works best for you in reducing stress. 5.4.2.4 Social support. Having a strong support system can greatly help in managing stress. Reach out to friends, family, or support groups who understand and empathize with your experiences. Sharing your thoughts and feelings with others can provide emotional support and help alleviate stress. Surround yourself with positive and understanding individuals who can offer encouragement and guidance. 5.4.3 Creating a self-care routine. Developing a self-care routine can provide structure and stability in your daily life. Here are some steps to help you create a personalized self-care routine. Identify your self-care needs. Reflect on activities that make you feel good and help you relax. Consider physical, emotional, and mental aspects of self-care. Set realistic goals. Start small and gradually incorporate self-care activities into your routine. Set achievable goals that are manageable within your schedule. Schedule self-care time. Block out specific times in your schedule dedicated solely to self-care activities. Treat this time as non-negotiable and prioritize it. Experiment and adapt. Try different self-care activities and techniques to find what works best for you. Be open to adjusting your routine as needed to meet your changing needs. Stay consistent. Consistency is key when it comes to self-care. Make self-care a regular part of your routine to reap the long-term benefits. Remember, self-care is not selfish but rather a necessary practice to maintain your well-being and effectively manage ADHD. By prioritizing self-care and implementing stress management techniques, you can lead a more balanced and fulfilling life. 6. Improving time management. 6.1 Setting goals and priorities. Setting goals and priorities is an essential skill for managing ADHD. When you have ADHD, it can be challenging to stay focused and organized, which can make it difficult to achieve your desired outcomes. However, by learning how to set goals and establish priorities, you can improve your ability to stay on track and accomplish what you set out to do. Why setting goals is important. Setting goals provides you with a clear direction and purpose. It helps you identify what you want to achieve and gives you something to work towards. When you have ADHD, it's easy to get overwhelmed by the multitude of tasks and responsibilities that come your way. By setting goals, you can break down these overwhelming tasks into smaller, manageable steps, making it easier to stay focused and motivated. Goals also provide a sense of structure and organization. When you have a clear goal in mind, you can prioritize your tasks and allocate your time and energy accordingly. This helps you avoid getting sidetracked by less important or non-essential activities. By setting goals, you can create a roadmap for success and ensure that you are making progress towards what truly matters to you. SMART goals. When setting goals, it's important to make them SMART, specific, measurable, achievable, relevant, and time-bound. This framework helps you create goals that are clear, realistic, and actionable. Specific. Clearly define what you want to achieve. The more specific your goal is, the easier it will be to create a plan and take the necessary steps to achieve it. For example, instead of setting a vague goal like, improve my time management, make it more specific by saying, create a daily schedule and stick to it. Measurable. Establish criteria to measure your progress and determine when you have achieved your goal. This helps you stay motivated and track your success. For example, if your goal is to exercise regularly, you can measure it by the number of days per week or the duration of each workout session. Achievable. Set goals that are within your reach and consider your abilities and resources. It's important to challenge yourself, but also be realistic about what you can accomplish. Setting unattainable goals can lead to frustration and disappointment. Break down larger goals into smaller, more manageable steps to make them achievable. Relevant. Ensure that your goals align with your values, interests, and long-term objectives. Setting goals that are meaningful to you will increase your motivation and commitment to achieving them. Consider how each goal contributes to your overall well-being and personal growth. Time-bound. Set a deadline or time frame for achieving your goal. This adds a sense of urgency and helps you stay focused and accountable. Breaking down your goal into smaller milestones with specific deadlines can also help you stay on track and measure your progress along the way. Prioritizing tasks. In addition to setting goals, it's crucial to prioritize your tasks effectively. When you have ADHD, it's easy to get overwhelmed by the sheer number of tasks and responsibilities that need your attention. By prioritizing tasks, you can ensure that you are focusing on what is most important and urgent. One effective way to prioritize tasks is by using the Eisenhower matrix, also known as the urgent important matrix. This matrix categorizes tasks into 4 quadrants. Urgent and important. These are tasks that require immediate attention and have a significant impact on your goals or well-being. Prioritize these tasks and tackle them first. Important but not urgent. These tasks are important for your long-term goals but do not require immediate attention. Schedule time for these tasks and make sure they don't get neglected. Urgent but not important. These tasks may seem urgent, but they do not contribute significantly to your goals or well-being. Delegate or eliminate these tasks whenever possible to free up time for more important activities. Not urgent and not important. These tasks are neither urgent nor important. Avoid spending too much time on these tasks as they can be distractions and prevent you from focusing on what truly matters. By using the Eisenhower matrix, you can prioritize your tasks based on their importance and urgency, allowing you to make better decisions about how to allocate your time and energy. Breaking down goals into actionable steps. Once you have set your goals and prioritized your tasks, it's essential to break down your goals into actionable steps. This helps you create a clear plan of action and makes your goals more manageable. Start by identifying the specific actions or tasks required to achieve each goal. Break them down into smaller, bite-sized steps that are easier to accomplish. Assign deadlines or timeframes to each step to keep yourself accountable and on track. For example, if your goal is to complete a project at work, break it down into smaller tasks such as conducting research, creating an outline, writing the first draft, and revising and editing. Assign specific deadlines to each task to ensure that you are making progress towards your goal. Breaking down goals into actionable steps not only makes them more achievable but also provides a sense of accomplishment as you complete each task. Celebrate your progress along the way, and don't forget to adjust your plan if necessary to stay flexible and adaptable. Conclusion. Setting goals and establishing priorities are crucial skills for managing ADHD. By setting SMART goals, prioritizing tasks effectively, and breaking down goals into actionable steps, you can improve your focus, stay organized, and achieve what you set out to do. Remember to be patient with yourself and celebrate your progress along the way. With practice and perseverance, you can master the art of setting goals and priorities, leading to greater success and fulfillment in managing your ADHD. 6.2 Creating routines and schedules. Creating and following routines and schedules can be incredibly beneficial for individuals with ADHD. These structured plans help to establish a sense of order and predictability, which can greatly improve focus, productivity, and overall well-being. In this section, we will explore the importance of routines and schedules for managing ADHD and provide practical tips for creating and implementing them effectively. The benefits of routines and schedules. Routines and schedules provide a framework for daily activities, helping individuals with ADHD to better manage their time and responsibilities. Here are some key benefits of establishing and following routines and schedules. Improved time management. Routines and schedules help individuals with ADHD allocate time for different tasks and activities, ensuring that they are completed in a timely manner. This can prevent procrastination and reduce the stress of last-minute deadlines. Enhanced focus and attention. By following a set routine or schedule, individuals with ADHD can train their brains to focus on specific tasks at designated times. This helps to minimize distractions and increase productivity. Reduced decision-making fatigue. Routines and schedules eliminate the need for constant decision-making, as they provide a predetermined plan for each day. This can alleviate the mental fatigue often experienced by individuals with ADHD when faced with numerous choices. Improved organization and planning. Following a routine or schedule promotes better organization and planning skills. It allows individuals with ADHD to break down larger tasks into smaller, more manageable steps, making them easier to tackle. Increased independence. Routines and schedules empower individuals with ADHD to take control of their daily lives. By following a structured plan, they can become more self-reliant and less reliant on external reminders or prompts. Tips for creating routines and schedules. Creating effective routines and schedules requires careful thought and consideration. Here are some practical tips to help you develop a routine or schedule that works for you. 1. Understand your needs and priorities. Before creating a routine or schedule, take some time to reflect on your specific needs and priorities. Consider the tasks and activities that are most important to you in the times of day when you feel most energized and focused. This self-awareness will help you design a routine or schedule that aligns with your individual strengths and preferences. 2. Start small and gradually build. When implementing a new routine or schedule, it's important to start small and gradually build upon it. Begin by incorporating one or two specific tasks or activities into your daily routine, and then gradually add more as you become comfortable. This approach prevents overwhelm and increases the likelihood of long-term success. 3. Be realistic and flexible. While it's important to have a structured plan, it's equally important to be realistic and flexible. Recognize that unexpected events or distractions may arise, and be prepared to adapt your routine or schedule accordingly. Allow for some flexibility in your plan to accommodate unforeseen circumstances without feeling overwhelmed or discouraged. 4. Break tasks into manageable chunks. For individuals with ADHD, large tasks can often feel overwhelming and lead to procrastination. To overcome this, break down larger tasks into smaller, more manageable chunks. This makes them easier to approach and increases the likelihood of completion. Set specific time blocks for each task or chunk to ensure that you stay on track. 5. Use visual cues and reminders. Visual cues and reminders can be powerful tools for individuals with ADHD. Use color-coded calendars, sticky notes, or digital reminders to help you stay organized and on schedule. Place these visual cues in prominent locations where you are likely to see them, such as on your desk or refrigerator. 6. Incorporate transition times. Transition times are periods between tasks or activities when you switch your focus from one thing to another. For individuals with ADHD, transitions can be challenging and may lead to a loss of focus. To mitigate this, incorporate transition times into your schedule. Use these periods to take a short break, engage in a quick mindfulness exercise, or prepare mentally for the next task. 7. Seek accountability and support. Accountability and support can greatly enhance the effectiveness of your routines and schedules. Share your plans with a trusted friend, family member, or therapist who can help keep you accountable. Consider joining a support group or seeking professional guidance to receive additional support and guidance in managing your ADHD. Conclusion. Creating and following routines and schedules can be a game changer for individuals with ADHD. By establishing a structured plan, you can improve time management, enhance focus and attention, reduce decision-making fatigue, and increase independence. Remember to tailor your routines and schedules to your specific needs, start small, be realistic and flexible, and seek accountability and support. With consistent practice and perseverance, you can master the art of managing ADHD through effective routines and schedules. 6.3 Managing procrastination. Procrastination is a common challenge for individuals with ADHD. It can be difficult to stay focused and motivated, leading to delays in completing tasks and meeting deadlines. However, with the right strategies and techniques, it is possible to overcome procrastination and improve productivity. In this section, we will explore various approaches to managing procrastination and staying on track. 6.3.1 Understanding procrastination. Procrastination is the act of delaying or postponing tasks that need to be accomplished. It often involves avoiding or putting off important responsibilities in favor of more immediate and pleasurable activities. For individuals with ADHD, procrastination can be particularly problematic due to difficulties with executive functions such as planning, prioritizing, and initiating tasks. There are several reasons why individuals with ADHD may struggle with procrastination. One common factor is the tendency to prioritize short-term rewards over long-term goals. This can lead to a cycle of procrastination, where immediate gratification takes precedence over completing important tasks. Additionally, difficulties with time management and organization can contribute to procrastination, as individuals may struggle to break tasks down into manageable steps or create effective schedules. 6.3.2 Identifying procrastination patterns. Before tackling procrastination, it is important to identify and understand your own patterns of procrastination. Take some time to reflect on the tasks or situations that tend to trigger procrastination for you. Are there specific types of tasks that you consistently put off? Do you find yourself procrastinating more when you are feeling overwhelmed or stressed? By recognizing these patterns, you can develop targeted strategies to address them. 6.3.3 Breaking tasks down. One effective strategy for managing procrastination is to break tasks down into smaller, more manageable steps. Often, the sheer size or complexity of a task can be overwhelming and lead to avoidance. By breaking it down into smaller, actionable steps, you can make the task feel more achievable and less daunting. Start by identifying the specific actions required to complete the task. Then, prioritize these actions based on their importance and urgency. Create a to-do list or use a task management app to keep track of these steps. As you complete each step, you will gain a sense of accomplishment and momentum, which can help to combat procrastination. 6.3.4 Setting clear goals and deadlines. Setting clear goals and deadlines is crucial for managing procrastination. Without specific targets to work towards, it is easy to lose focus and put off tasks indefinitely. When setting goals, make sure they are realistic, measurable, and time-bound. Break larger goals into smaller milestones to make progress more tangible and achievable. In addition to setting goals, establish deadlines for each task or milestone. Having a specific timeframe in which to complete a task can create a sense of urgency and help to overcome procrastination. Use reminders or alarms to stay on track and hold yourself accountable to these deadlines. 6.3.5 Creating a productive environment. Your environment can have a significant impact on your ability to stay focused and avoid procrastination. Create a dedicated workspace that is free from distractions and conducive to productivity. Remove any unnecessary clutter or items that may tempt you to procrastinate. Consider using tools or apps that can help you stay organized and focused. For example, there are various time management apps available that can help you track your progress, set timers for focused work sessions, and block distracting websites or notifications. 6.3.6 Utilizing time management techniques. Several time management techniques can be helpful in managing procrastination. One popular technique is the Pomodoro technique, which involves working in focused bursts of 25 minutes followed by short breaks. This structured approach can help to maintain focus and prevent procrastination. Another technique is the Eisenhower matrix, which involves categorizing tasks based on their urgency and importance. By prioritizing tasks and focusing on those that are both urgent and important, you can avoid the trap of procrastination. 6.3.7 Seeking accountability and support. Accountability and support can be powerful tools in overcoming procrastination. Share your goals and deadlines with a trusted friend, family member, or mentor who can help keep you accountable. Consider joining a support group or finding an accountability partner who also struggles with procrastination. Together, you can provide encouragement, share strategies, and hold each other accountable. 6.3.8 Managing distractions. Distractions can derail even the most well-intentioned efforts to avoid procrastination. Identify the specific distractions that tend to pull you away from your tasks and develop strategies to minimize their impact. This may involve turning off notifications on your phone, using website blockers to limit access to distracting websites, or finding a quiet space away from noise and interruptions. 6.3.9 Practicing self-compassion. It is important to approach the challenge of managing procrastination with self-compassion. Remember that procrastination is a common struggle, and it does not define your worth or abilities. Be patient with yourself and celebrate small victories along the way. If you do find yourself procrastinating, acknowledge it without judgment and refocus your attention on the task at hand. 6.3.10 Celebrating progress. Finally, celebrate your progress and accomplishments. Recognize and reward yourself for completing tasks and meeting deadlines. This positive reinforcement can help to reinforce productive behaviors and motivate you to continue overcoming procrastination. By implementing these strategies and techniques, you can effectively manage procrastination and improve your ability to stay focused and productive. Remember that managing ADHD and overcoming procrastination is an ongoing process, so be patient with yourself and continue to refine your approach as needed. 6.4 Using technology and tools. In today's digital age, technology has become an integral part of our lives. It has revolutionized the way we communicate, work, and even manage our daily tasks. For individuals with ADHD, technology can be a powerful tool to help improve focus, organization, and time management. In this section, we will explore various technologies and tools that can assist individuals with ADHD in managing their symptoms and enhancing their productivity. 6.4.1 Digital calendars and reminder apps. One of the biggest challenges for individuals with ADHD is keeping track of appointments, deadlines, and important tasks. Digital calendars and reminder apps can be incredibly helpful in this regard. These tools allow you to input and organize your schedule, set reminders for upcoming events, and receive notifications to help you stay on track. When choosing a digital calendar or reminder app, look for features such as the ability to set recurring events, color code tasks, and sync across multiple devices. Popular options include Google Calendar, Microsoft Outlook, and Apple Calendar. Additionally, there are specialized ADHD-focused apps available, such as My Life Organized and Any.do, which offer features specifically designed to support individuals with ADHD. 6.4.2 Task Management Apps. Managing tasks and staying organized can be a significant challenge for individuals with ADHD. Task management apps can provide structure and help break down larger tasks into smaller, more manageable steps. These apps often include features such as to-do lists, prioritization tools, and progress tracking. Some popular task management apps include Todoist, Trello, and Asana. These apps allow you to create and categorize tasks, set due dates, and receive reminders. They also offer collaboration features, making them useful for both personal and professional use. Experiment with different apps to find the one that best suits your needs and preferences. 6.4.3 Note-taking apps. Taking effective notes is crucial for learning and retaining information. However, traditional pen and paper note-taking methods may not always be practical or efficient for individuals with ADHD. Note-taking apps provide a digital alternative that allows for easy organization, searchability, and accessibility. Apps like Evernote, Microsoft OneNote, and Google Keep offer features such as the ability to create different notebooks, tag notes for easy retrieval, and sync across devices. Some apps even allow you to add audio recordings, images, and web clippings to your notes, making them more dynamic and interactive. 6.4.4 Focus and Productivity Apps. Maintaining focus and avoiding distractions can be a significant challenge for individuals with ADHD. Fortunately, there are several apps available that can help improve focus and productivity. These apps often utilize techniques such as time management, Pomodoro technique, and blocking distracting websites or apps. Forest, Focus at Will, and Freedom are popular apps that help individuals stay focused by blocking access to social media, gaming, or other distracting websites. They also provide features like timers, ambient sounds, and productivity tracking to enhance concentration and productivity. 6.4.5 Mindfulness and Meditation Apps. Practicing mindfulness and meditation can be beneficial for individuals with ADHD, as it helps calm the mind, reduce stress, and improve focus. Mindfulness and meditation apps provide guided meditation sessions, breathing exercises, and relaxation techniques that can be easily accessed anytime, anywhere. Apps like Headspace, Calm, and Insight Timer offer a variety of guided meditations, sleep aids, and stress reduction exercises. These apps can be particularly helpful for individuals with ADHD who struggle with anxiety or have difficulty quieting their racing thoughts. 6.4.6 Assistive Technology. In addition to apps and digital tools, there are various assistive technologies available that can further support individuals with ADHD. These technologies aim to enhance focus, organization, and time management. For example, noise-canceling headphones can help block out distractions in noisy environments, allowing for better concentration. Text-to-speech software can assist with reading comprehension by converting written text into spoken words. Voice recognition software can be used for dictation, making it easier to capture thoughts and ideas without the need for typing. 6.4.7 Wearable Devices. Wearable devices, such as smartwatches and fitness trackers, can also be valuable tools for individuals with ADHD. These devices offer features like reminders, alarms, and activity tracking, which can help individuals stay organized, manage their time, and maintain a healthy lifestyle. Smartwatches, such as the Apple Watch or Fitbit, can sync with your digital calendar and send notifications directly to your wrist. This can be particularly useful for individuals who struggle with remembering appointments or tend to lose track of time. 6.4.8 Online Support Communities and Forums. Technology not only provides practical tools but also offers a platform for individuals with ADHD to connect and support one another. Online support communities and forums can be a valuable resource for sharing experiences, seeking advice, and finding encouragement. Platforms like Reddit, Attitude Mag, and Chat provide forums where individuals with ADHD can connect with others who understand their challenges. These communities offer a safe space to ask questions, share strategies, and gain insights from those who have first-hand experience with ADHD. In conclusion, technology and tools can be powerful allies in managing ADHD symptoms and improving productivity. From digital calendars and reminder apps to task management and note-taking apps, there are numerous options available to support individuals with ADHD in their daily lives. Experiment with different technologies and tools to find the ones that work best for you and incorporate them into your routine. Remember, technology is a tool, and it's essential to use it mindfully and purposefully to maximize its benefits. 7. Developing effective study skills. 7.1 Note-taking strategies. Taking effective notes is an essential skill for individuals with ADHD. It can help you stay focused, retain information, and organize your thoughts. In this section, we will explore some note-taking strategies specifically tailored to individuals with ADHD. 7.1.1 Simplify and summarize. One of the key challenges for individuals with ADHD is processing and organizing information quickly. To overcome this, it is important to simplify and summarize the information as you take notes. Instead of trying to write down every single detail, focus on capturing the main ideas, key points, and supporting examples. Use bullet points, headings, and subheadings to structure your notes and make them easier to review later. 7.1.2 Use visual aids. Visual aids can be incredibly helpful for individuals with ADHD as they provide a visual representation of information. Consider using diagrams, charts, graphs, and mind maps to illustrate concepts and relationships between ideas. These visual aids can make your notes more engaging and easier to understand. Additionally, using different colors and highlighting important information can help you quickly identify key points when reviewing your notes. 7.1.3 Active listening and engagement. Active listening is crucial for effective note-taking. When listening to a lecture or participating in a discussion, engage with the material by asking questions, making connections, and seeking clarification. Actively participating in the learning process will not only help you stay focused but also enhance your understanding of the subject matter. As you listen, jot down any questions or thoughts that arise, and make sure to include them in your notes. 7.1.4 Organize and structure. Organizing your notes is essential for easy retrieval and review. Consider using different methods to structure your notes, such as outlining, numbering, or using headings and subheadings. This will help you create a logical flow and hierarchy within your notes. Additionally, consider using dividers or separate notebooks for different subjects or topics to keep your notes organized and easily accessible. 7.1.5 Review and revise. Regularly reviewing and revising your notes is crucial for retaining information and reinforcing your understanding. Set aside dedicated time to review your notes, preferably within 24 hours of taking them. This will help consolidate the information in your memory and identify any gaps or areas that need further clarification. As you review, consider adding additional information, clarifying unclear points, and connecting new information to existing knowledge. 7.1.6 Utilize technology. Technology can be a valuable tool for individuals with ADHD when it comes to note-taking. Consider using note-taking apps or software that allow you to type, record, and organize your notes digitally. These tools often offer features like searchability, synchronization across devices, and the ability to add multimedia elements. Experiment with different apps or software to find the one that best suits your needs and preferences. 7.1.7 Seek support. If you find note-taking particularly challenging, don't hesitate to seek support from teachers, classmates, or professionals. Many educational institutions offer resources and accommodations for individuals with ADHD, such as note-taking services or assistive technology. Additionally, consider forming study groups or finding a study buddy who can help you fill in any gaps in your notes or provide additional perspectives on the material. 7.1.8 Practice and experiment. Note-taking is a skill that improves with practice. Experiment with different strategies and techniques to find what works best for you. It may take some trial and error to discover the most effective way to capture and organize information. Be patient with yourself and remember that everyone's note-taking style is unique. Embrace the process of learning and adapting your note-taking strategies to suit your individual needs and preferences. 7.1.9 Stay engaged and focused. Lastly, it is important to stay engaged and focused during lectures or study sessions to maximize the effectiveness of your note-taking. Minimize distractions by finding a quiet and comfortable study environment, turning off notifications on your electronic devices, and using techniques like the Pomodoro technique, working in short bursts with regular breaks, to maintain focus. Engage with the material actively, ask questions, and participate in discussions to enhance your understanding and retention of the information. By implementing these note-taking strategies, individuals with ADHD can improve their ability to capture, retain, and organize information effectively. Remember, note-taking is a personal process, so feel free to adapt and modify these strategies to suit your unique learning style and preferences. With practice and perseverance, you can master the art of note-taking and enhance your overall academic and professional success. 7.2 Reading comprehension techniques. Reading comprehension is a crucial skill for individuals with ADHD, as it directly impacts their ability to understand and retain information from written texts. Difficulties with reading comprehension can lead to frustration, decreased academic performance, and a lack of confidence in one's abilities. However, with the right strategies and techniques, individuals with ADHD can improve their reading comprehension skills and become more effective readers. In this section, we will explore some techniques that can help individuals with ADHD enhance their reading comprehension abilities. 7.2.1 Active reading. Active reading is a technique that involves actively engaging with the text while reading. Instead of passively reading through the material, individuals with ADHD can use the following strategies to improve their comprehension. Preview the text. Before diving into the reading, take a few minutes to preview the text. Skim through the headings, subheadings, and any bold or italicized text. This will give you an overview of the content and help you anticipate what to expect. Set a purpose. Determine why you are reading the text. Are you reading for information, entertainment, or to answer specific questions? Having a clear purpose in mind will help you stay focused and engaged throughout the reading. Take notes. As you read, jot down key points, summaries, or questions in the margins or on a separate sheet of paper. This will help you actively process the information and reinforce your understanding of the material. Highlight or underline. Use a highlighter or underline important information or passages that stand out to you. This visual cue can help you remember and locate key points later on. Pause and reflect. Take short breaks during your reading to reflect on what you've read so far. Ask yourself questions about the content and try to summarize the main ideas in your own words. This will help consolidate your understanding and reinforce your memory of the material. 7.2.2 Chunking and summarizing. Breaking down the text into smaller, manageable chunks can make it easier for individuals with ADHD to comprehend and retain information. Here are some techniques to help with chunking and summarizing. Paragraph by paragraph approach. Instead of trying to read the entire text in one go, focus on one paragraph at a time. After reading each paragraph, take a moment to summarize the main idea or key points in your own words. This will help you process the information more effectively. Use headings and subheadings. Headings and subheadings provide a roadmap of the text and can help you identify the main ideas and supporting details. Pay attention to these headings and use them as cues to guide your reading and comprehension. Create visual summaries. After reading a section or chapter, create a visual summary of the main ideas using diagrams, mind maps, or flowcharts. Visual representations can help you organize and remember the information more effectively. 7.2.3 Active questioning. Asking questions while reading can help individuals with ADHD stay engaged and actively process the information. Here are some strategies for active questioning. Ask yourself questions. Before, during, and after reading, ask yourself questions about the content. What do you already know about the topic? What are you curious to learn? What connections can you make between the text and your own experiences or prior knowledge? This active questioning will help you stay focused and deepen your understanding of the material. Write down questions. As you read, write down any questions that arise in your mind. These questions can be about unclear concepts, conflicting information, or anything that you find interesting or confusing. Later, you can seek answers to these questions through further research or discussion. Discuss with others. Engage in discussions with classmates, friends, or study groups about the reading material. Share your questions, insights, and interpretations, and listen to others' perspectives. This collaborative approach can enhance your comprehension and provide different viewpoints on the text. 7.2.4 Visualization and imagery. Creating mental images while reading can enhance comprehension and make the text more memorable. Here are some techniques for using visualization and imagery. Visualize the content. As you read, try to create mental images of the concepts, events, or characters described in the text. Imagine the details, colors, and emotions associated with the content. This visualization technique can make the material more engaging and help you remember it better. Make connections. Connect the information in the text to your own experiences, prior knowledge, or other texts you have read. This will help you create a web of associations and make the content more meaningful and relatable. Use sensory imagery. Engage your senses while reading by imagining the sounds, smells, tastes, and textures described in the text. This multisensory approach can make the reading experience more vivid and immersive. By implementing these reading comprehension techniques, individuals with ADHD can improve their ability to understand and retain information from written texts. Remember, practice and consistency are key to developing these skills. With time and effort, you can become a more effective reader and overcome the challenges associated with ADHD. 7.3 Test preparation and test-taking tips. Tests can be a significant source of stress and anxiety for individuals with ADHD. The pressure to perform well, the time constraints, and the need to focus for an extended period can all pose challenges. However, with effective test preparation and test-taking strategies, individuals with ADHD can overcome these difficulties and perform at their best. In this section, we will explore some tips and techniques to help you prepare for tests and navigate the test-taking process successfully. 7.3.1 Create a study plan. One of the most crucial aspects of test preparation is creating a study plan. A study plan helps you organize your time effectively and ensures that you cover all the necessary material before the test. Here are some steps to create an effective study plan. Assess the test content. Start by understanding the test format and the topics that will be covered. Break down the material into manageable sections and allocate time accordingly. Set realistic goals. Determine how much time you need to study each day and set achievable goals. Be mindful of your attention span and schedule regular breaks to maintain focus. Prioritize the material. Identify the areas that require more attention and prioritize them in your study plan. Focus on understanding the concepts rather than memorizing information. Create a study schedule. Allocate specific time slots for studying each day and stick to the schedule. Consistency is key when it comes to effective studying. Use active learning techniques. Engage actively with the material by summarizing key points, creating flashcards, or teaching the concepts to someone else. Active learning enhances understanding and retention. 7.3.2 Utilize effective study techniques. In addition to creating a study plan, utilizing effective study techniques can significantly improve your test preparation. Here are some techniques that can help individuals with ADHD. Chunking. Break down the material into smaller, manageable chunks. Focus on one section at a time and review it thoroughly before moving on to the next. Visual aids. Utilize visual aids such as diagrams, charts, and mind maps to organize information and make it easier to understand and remember. Multisensory learning. Engage multiple senses while studying to enhance learning. For example, read the material aloud, highlight important points, and use tactile objects to reinforce concepts. Practice with sample tests. Familiarize yourself with the test format by practicing with sample tests or past exams. This will help you become comfortable with the structure and timing of the test. Review and self-assessment. Regularly review the material you have studied and assess your understanding. Identify areas of weakness and revisit them to reinforce your knowledge. 7.3.3 Manage test anxiety. Test anxiety is common among individuals with ADHD, but there are strategies to help manage it. Here are some tips to reduce test anxiety. Practice relaxation techniques. Deep breathing exercises, progressive muscle relaxation, and mindfulness meditation can help calm your mind and reduce anxiety before and during the test. Positive self-talk. Replace negative thoughts with positive affirmations. Remind yourself of your capabilities and focus on your strengths. Visualize success. Imagine yourself performing well on the test. Visualize yourself confidently answering questions and achieving a positive outcome. Get enough sleep. Prioritize sleep in the days leading up to the test. A well-rested mind performs better and is more resilient to stress. Arrive early and be prepared. Plan to arrive at the test location early to avoid rushing and additional stress. Make sure you have all the necessary materials, such as pens, calculators, or any permitted resources. 7.3.4 Test-taking strategies. During the test, it is essential to employ effective test-taking strategies to maximize your performance. Here are some strategies to consider. Read the instructions carefully. Take the time to read and understand the instructions before starting the test. Pay attention to any specific requirements or limitations. Skim through the entire test. Quickly skim through the entire test to get an overview of the questions and allocate your time accordingly. Identify any challenging or time-consuming questions that you may want to tackle later. Answer easy questions first. Start by answering the questions you find easier and are confident about. This will help build momentum and boost your confidence. Manage your time. Keep track of the time and allocate it wisely. If you get stuck on a difficult question, move on and come back to it later if time permits. Eliminate incorrect options. When faced with multiple choice questions, eliminate any obviously incorrect options. This increases your chances of selecting the correct answer. Review your answers. If time allows, review your answers before submitting the test. Look for any errors or areas that need clarification. Remember, test taking is not just about knowledge but also about managing your ADHD symptoms effectively. By implementing these strategies and practicing them consistently, you can improve your test performance and reduce test-related stress and anxiety. 7.4 Managing distractions. One of the biggest challenges for individuals with ADHD is managing distractions. Distractions can come in many forms, such as external stimuli, internal thoughts, or even the environment itself. These distractions can make it difficult to stay focused and complete tasks efficiently. However, with the right strategies and techniques, it is possible to minimize distractions and improve focus. In this section, we will explore various methods to help individuals with ADHD manage distractions effectively. 7.4.1 Creating a distraction-free environment. Creating a distraction-free environment is crucial for individuals with ADHD. By minimizing external distractions, it becomes easier to maintain focus and concentration. Here are some strategies to create a conducive environment. Organize your workspace. Keep your workspace clean and clutter-free. Remove any unnecessary items that may divert your attention. Use storage solutions like bins or folders to keep things organized. Designate a quiet area. Find a quiet area where you can work without interruptions. If possible, create a separate space dedicated solely to work or study. This can help minimize distractions from other people or activities. Manage noise. Noise can be a significant distraction for individuals with ADHD. Consider using noise-canceling headphones or playing soft background music to drown out external noises. Experiment with different soundscapes, such as nature sounds or instrumental music, to find what works best for you. Control visual distractions. Minimize visual distractions by using curtains or blinds to block out external stimuli. If you find yourself getting distracted by movement outside, consider using window film or frosted glass to obscure the view. 7.4.2 Implementing time blocking. Time blocking is a technique that involves scheduling specific blocks of time for different tasks or activities. This method can be particularly helpful for individuals with ADHD as it provides structure and helps prioritize tasks. Here's how you can implement time blocking. Identify your priorities. Start by identifying the most important tasks or activities that need to be accomplished. Break them down into smaller, manageable chunks if necessary. Allocate specific time blocks. Assign specific time blocks for each task or activity. Be realistic about the time needed for each task and allow for breaks in between. Stick to the schedule. Once you have created your time blocks, make a commitment to stick to the schedule as much as possible. Avoid getting sidetracked by unrelated tasks or distractions during the allocated time. Use visual cues. Use visual cues, such as color-coded calendars or timers, to help you stay on track and transition between tasks. Set reminders or alarms to signal the start and end of each time block. 7.4.3 Practicing mindfulness. Mindfulness is a powerful technique that can help individuals with ADHD manage distractions and improve focus. By practicing mindfulness, you can train your mind to stay present and reduce the impact of external distractions. Here are some mindfulness techniques to try. Deep breathing. Take a few moments to focus on your breath. Inhale deeply through your nose, hold for a few seconds, and exhale slowly through your mouth. This simple technique can help calm your mind and bring your attention back to the present moment. Body scan. Close your eyes and bring your attention to different parts of your body, starting from your toes and moving up to your head. Notice any sensations or tension in each area and consciously release any tension you may be holding. Guided meditation. Use guided meditation apps or recordings to help you practice mindfulness. These resources provide step-by-step instructions and can be particularly helpful for beginners. Stay non-judgmental. When practicing mindfulness, it's important to adopt a non-judgmental attitude towards your thoughts and distractions. Instead of getting frustrated or critical, simply acknowledge the distraction and gently bring your focus back to the present moment. 7.4.4 Utilizing technology tools. Technology can be both a source of distraction and a valuable tool for managing ADHD. By utilizing the right technology tools, you can enhance your focus and productivity. Here are some tools that can help. Focus apps. There are various apps available that can help you stay focused and minimize distractions. These apps often use techniques like the Pomodoro technique, where you work for a set period and then take short breaks. Task management apps. Use task management apps to create to-do lists, set reminders, and track your progress. These apps can help you stay organized and prioritize your tasks effectively. Website blockers. If you find yourself getting easily distracted by social media or other websites, consider using website blockers. These tools allow you to block specific websites or set time limits for accessing them. Digital calendars. Use digital calendars to schedule your tasks, appointments, and deadlines. Set reminders to ensure you stay on top of your commitments. Remember, managing distractions is an ongoing process, and what works for one person may not work for another. It's important to experiment with different strategies and techniques to find what works best for you. With practice and perseverance, you can develop effective methods to manage distractions and improve your focus and productivity. 8. Improving focus and attention. 8.1 Mindfulness and meditation. Mindfulness and meditation are powerful tools that can greatly benefit individuals with ADHD. These practices help to cultivate a state of focused attention and awareness, allowing individuals to better manage their symptoms and improve their overall well-being. In this section, we will explore the benefits of mindfulness and meditation for individuals with ADHD and provide practical tips on how to incorporate these practices into daily life. The benefits of mindfulness and meditation. Improved focus and attention. One of the core symptoms of ADHD is difficulty sustaining attention. Mindfulness and meditation practices can help individuals with ADHD develop the ability to focus their attention on the present moment, enhancing their overall concentration and reducing distractions. Reduced impulsivity. Impulsivity is another common challenge faced by individuals with ADHD. Mindfulness and meditation can help individuals develop greater self-awareness and self-control, allowing them to pause and make more thoughtful decisions rather than acting on impulse. Stress reduction. ADHD can often be accompanied by high levels of stress and anxiety. Mindfulness and meditation practices have been shown to reduce stress and promote relaxation, helping individuals with ADHD manage their emotions more effectively. Improved emotional regulation. Individuals with ADHD may struggle with regulating their emotions, experiencing intense mood swings and difficulty managing frustration. Mindfulness and meditation practices can help individuals develop emotional resilience and regulate their emotions more effectively. Enhanced self-awareness. Mindfulness and meditation practices encourage individuals to cultivate a non-judgmental awareness of their thoughts, emotions, and bodily sensations. This increased self-awareness can help individuals with ADHD recognize their patterns of thinking and behavior, allowing them to make positive changes and develop healthier habits. Incorporating mindfulness and meditation into daily life. Start small. Begin by dedicating just a few minutes each day to mindfulness and meditation. Set aside a specific time and find a quiet space where you can practice without distractions. Focus on the breath. A simple and effective way to start practicing mindfulness is by focusing on the breath. Sit comfortably, close your eyes, and bring your attention to your breath. Notice the sensation of the breath as it enters and leaves your body, without trying to change it in any way. Body scan meditation. Another helpful practice is the body scan meditation. Start by bringing your attention to your feet and slowly move your awareness up through your body, noticing any sensations or areas of tension. This practice helps to cultivate a greater sense of bodily awareness and relaxation. Mindful eating. Use meal times as an opportunity to practice mindfulness. Slow down and savor each bite, paying attention to the taste, texture, and smell of the food. This practice can help individuals with ADHD develop a healthier relationship with food and reduce impulsive eating. Guided meditations. There are numerous guided meditation apps and websites available that can provide structured guidance for individuals new to mindfulness and meditation. These resources can be particularly helpful for individuals with ADHD who may benefit from a more structured approach. Mindfulness in daily activities. Incorporate mindfulness into your daily activities by bringing your full attention to the task at hand. Whether it's washing dishes, walking, or brushing your teeth, try to engage all your senses and be fully present in the moment. Mindfulness in movement. Engaging in mindful movement practices such as yoga or Tai Chi can be particularly beneficial for individuals with ADHD. These practices combine physical movement with mindfulness, helping to improve focus, balance, and overall well-being. Overcoming challenges. It's important to acknowledge that practicing mindfulness and meditation can be challenging, especially for individuals with ADHD who may struggle with sitting still or quieting their minds. Here are some tips to help overcome common challenges. Start with short sessions. Begin with shorter meditation sessions and gradually increase the duration as you become more comfortable. Even a few minutes of practice can have a positive impact. Use guided meditations. Guided meditations can provide structure and guidance, making it easier to stay focused. Experiment with different guided meditations to find ones that resonate with you. Find a supportive community. Joining a mindfulness or meditation group can provide support and accountability. Being part of a community can also offer opportunities for learning and sharing experiences. Be kind to yourself. It's normal to have wandering thoughts during meditation. Instead of getting frustrated, gently bring your attention back to the present moment. Remember that mindfulness is a practice, and it takes time and patience to develop. Conclusion. Mindfulness and meditation offer valuable tools for individuals with ADHD to manage their symptoms, improve focus and attention, reduce impulsivity, and enhance overall well-being. By incorporating these practices into daily life, individuals with ADHD can cultivate a greater sense of self-awareness, emotional regulation, and resilience. Start small, be patient, and embrace the journey of mindfulness and meditation as you navigate the challenges of ADHD. 8.2 Exercise and physical activity. Exercise and physical activity play a crucial role in managing ADHD symptoms and improving overall well-being. Engaging in regular exercise not only benefits physical health but also has a positive impact on mental health and cognitive function. In this section, we will explore the various ways in which exercise can help individuals with ADHD and provide practical tips for incorporating physical activity into daily routines. 8.2.1 The benefits of exercise for ADHD. Exercise has been shown to have numerous benefits for individuals with ADHD. Here are some of the ways in which regular physical activity can help manage ADHD symptoms. 1. Improved focus and attention. Engaging in exercise increases the production of neurotransmitters such as dopamine, norepinephrine, and serotonin, which are essential for regulating attention and focus. Regular physical activity can enhance cognitive function, making it easier for individuals with ADHD to concentrate and stay on task. 2. Reduced hyperactivity and impulsivity. Exercise provides an outlet for excess energy and helps reduce hyperactivity and impulsivity commonly associated with ADHD. Physical activity allows individuals to channel their energy in a productive and controlled manner, leading to a calmer and more focused state of mind. 3. Enhanced executive functioning. Executive functions, such as planning, organizing, and problem-solving, can be challenging for individuals with ADHD. Regular exercise has been found to improve executive functioning by stimulating the prefrontal cortex, the part of the brain responsible for these cognitive processes. This improvement can lead to better decision-making, time management, and goal-setting abilities. 4. Mood regulation. Exercise has a positive impact on mood and emotional well-being. It stimulates the release of endorphins, which are natural mood boosters. Regular physical activity can help reduce symptoms of anxiety and depression often experienced by individuals with ADHD, promoting a more positive and stable emotional state. 5. Better sleep quality. Many individuals with ADHD struggle with sleep difficulties. Engaging in regular exercise can help regulate sleep patterns and improve sleep quality. Physical activity promotes the release of melatonin, a hormone that regulates sleep-wake cycles, making it easier to fall asleep and stay asleep throughout the night. 8.2.2 Types of exercise for ADHD. When it comes to exercise for individuals with ADHD, the key is to find activities that are enjoyable, engaging, and sustainable. Here are some types of exercise that can be particularly beneficial. 1. Aerobic exercise. Aerobic exercises, such as running, swimming, cycling, or dancing, are excellent choices for individuals with ADHD. These activities increase heart rate and oxygen flow to the brain, promoting improved focus, attention, and overall cognitive function. 2. Strength training. Strength training exercises, such as weightlifting or bodyweight exercises, help build muscle strength and improve overall physical fitness. These activities can also have a positive impact on mental health and cognitive function, contributing to better ADHD management. 3. Yoga and mind-body practices. Yoga and other mind-body practices, such as Tai Chi or Qigong, combine physical movement with mindfulness and deep breathing. These activities can help individuals with ADHD improve focus, reduce stress, and enhance overall well-being. 4. Team sports and group activities. Participating in team sports or group activities can provide individuals with ADHD with social interaction, structure, and a sense of belonging. Sports like soccer, basketball, or martial arts can help improve physical fitness while also promoting teamwork and cooperation. 8.2.3 Tips for incorporating exercise into daily life. Here are some practical tips for incorporating exercise into daily routines to effectively manage ADHD symptoms. 1. Find activities you enjoy. Choose activities that you genuinely enjoy and look forward to. This will increase your motivation to engage in regular exercise and make it a sustainable habit. 2. Set realistic goals. Start with small, achievable goals and gradually increase the intensity and duration of your exercise sessions. Setting realistic goals will help you stay motivated and avoid burnout. 3. Create a routine. Establish a consistent exercise routine by scheduling specific times for physical activity. This will help make exercise a regular part of your daily life. 4. Make it social. Consider exercising with a friend or joining a group class. Exercising with others can provide motivation, accountability, and social interaction. 5. Break it up. If finding time for a long exercise session is challenging, break it up into shorter bursts throughout the day. Even brief periods of physical activity can have a positive impact on ADHD symptoms. 6. Make it fun and varied. Keep your exercise routine interesting by trying different activities and incorporating variety. This will prevent boredom and help maintain your enthusiasm for exercise. 7. Use technology to your advantage. Utilize fitness apps, wearable devices, or online workout videos to track your progress, set goals, and stay motivated. Technology can provide structure and guidance for your exercise routine. 8. Stay consistent. Consistency is key when it comes to reaping the benefits of exercise for ADHD management. Aim for regular physical activity, even on days when motivation is low. The long-term rewards will be worth the effort. Incorporating regular exercise and physical activity into your daily routine can significantly improve ADHD symptoms and overall well-being. By understanding the benefits of exercise, exploring different types of activities, and implementing practical tips, you can harness the power of physical activity to effectively manage ADHD. 8.3 Nutrition and brain health. Proper nutrition plays a crucial role in maintaining overall health and well-being, and this is especially true for individuals with ADHD. The food we consume directly impacts our brain function, mood, and cognitive abilities. By making mindful choices about what we eat, we can support our brain health and improve our ability to manage ADHD symptoms effectively. 8.3.1 The importance of a balanced diet. A balanced diet is essential for everyone, but it holds particular significance for individuals with ADHD. Consuming a variety of nutrient-rich foods ensures that our bodies receive the necessary vitamins, minerals, and antioxidants to function optimally. When it comes to managing ADHD, certain nutrients have been found to have a positive impact on brain health and cognitive function. 8.3.2 Omega-3 fatty acids. Omega-3 fatty acids, particularly EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid, are essential for brain development and function. These healthy fats are found in fatty fish like salmon, mackerel, and sardines, as well as in walnuts, flax seeds, and chia seeds. Research suggests that omega-3 fatty acids may help reduce ADHD symptoms, such as inattention and hyperactivity. 8.3.3 Protein. Protein is an essential macronutrient that provides the building blocks for neurotransmitters, the chemical messengers in our brain. Including high-quality protein sources in our diet, such as lean meats, poultry, fish, eggs, dairy products, legumes, and tofu, can help support optimal brain function and improve focus and attention. 8.3.4 Complex carbohydrates. Complex carbohydrates, such as whole grains, fruits, and vegetables, provide a steady release of glucose into the bloodstream, which is the brain's primary source of energy. Unlike simple carbohydrates found in sugary snacks and processed foods, complex carbohydrates provide sustained energy and help maintain stable blood sugar levels. This can prevent energy crashes and support consistent focus and attention throughout the day. 8.3.5 Micronutrients. Certain vitamins and minerals are essential for brain health and can have a positive impact on ADHD symptoms. These include 8.3.5.1 Vitamin B6 and magnesium. Vitamin B6 and magnesium are involved in the production of neurotransmitters and play a crucial role in brain function. Foods rich in vitamin B6 include poultry, fish, bananas, and chickpeas. Magnesium can be found in leafy green vegetables, nuts, seeds, and whole grains. 8.3.5.2 Zinc and iron. Zinc and iron are important for cognitive function and attention. Good sources of zinc include oysters, beef, poultry, and pumpkin seeds. Iron can be found in red meat, poultry, seafood, beans, and fortified cereals. 8.3.5.3 Vitamin C and antioxidants. Vitamin C and antioxidants help protect the brain from oxidative stress and inflammation. Citrus fruits, berries, bell peppers, and leafy green vegetables are excellent sources of vitamin C. Antioxidants can also be found in colorful fruits and vegetables, such as berries, tomatoes, spinach, and kale. 8.3.6 Hydration. Staying hydrated is essential for optimal brain function. Dehydration can lead to fatigue, difficulty concentrating, and decreased cognitive performance. It is important to drink enough water throughout the day and limit the consumption of sugary beverages, as they can cause energy crashes and negatively impact focus and attention. 8.3.7 Avoiding potential triggers. While certain foods can support brain health, others may have a negative impact on ADHD symptoms. It is important to be mindful of potential triggers and make informed choices about what we consume. Some individuals with ADHD may be sensitive to food additives, artificial colors, preservatives, and high levels of sugar. Paying attention to how certain foods affect your symptoms can help you make personalized dietary choices. 8.3.8 Meal planning and preparation. Planning and preparing meals in advance can be beneficial for individuals with ADHD. By having nutritious meals readily available, you can avoid relying on unhealthy convenience foods. Consider creating a weekly meal plan, making a grocery list, and preparing meals in batches to save time and ensure you have balanced meals throughout the week. 8.3.9 Seeking professional guidance. If you are unsure about how to optimize your nutrition for managing ADHD, it may be helpful to consult with a registered dietitian or nutritionist who specializes in ADHD. They can provide personalized guidance and help you create a nutrition plan that suits your specific needs and preferences. Remember, nutrition is just one piece of the puzzle when it comes to managing ADHD. It is important to combine a balanced diet with other strategies, such as medication, therapy, and lifestyle changes, to effectively manage symptoms and improve overall well-being. 8.4 Sleep and rest. Sleep and rest play a crucial role in managing ADHD symptoms and improving overall well-being. Adequate sleep is essential for maintaining focus, attention, and emotional regulation. Unfortunately, individuals with ADHD often struggle with sleep-related difficulties, such as insomnia, restless sleep, and difficulty falling asleep or staying asleep. In this section, we will explore the importance of sleep for individuals with ADHD and provide strategies to improve sleep quality and establish healthy sleep habits. 8.4.1 The importance of sleep for ADHD. Sleep is a fundamental biological process that allows our bodies and minds to recharge and rejuvenate. For individuals with ADHD, quality sleep is particularly important as it directly impacts their ability to manage symptoms effectively. Lack of sleep can exacerbate ADHD symptoms, leading to increased impulsivity, decreased attention span, and heightened emotional reactivity. Research has shown that individuals with ADHD are more likely to experience sleep problems compared to those without the condition. This can be attributed to several factors, including difficulties in regulating the sleep-wake cycle, increased levels of hyperactivity and restlessness, and the presence of co-occurring conditions such as anxiety or depression. 8.4.2 Establishing a healthy sleep routine. Creating a consistent and structured sleep routine can significantly improve sleep quality for individuals with ADHD. Here are some strategies to help establish healthy sleep habits. Set a regular sleep schedule. Try to go to bed and wake up at the same time every day, even on weekends. This helps regulate your body's internal clock and promotes better sleep. Create a calming bedtime routine. Engage in relaxing activities before bed, such as reading a book, taking a warm bath, or practicing deep breathing exercises. Avoid stimulating activities, such as using electronic devices or engaging in intense physical exercise, close to bedtime. Create a sleep-friendly environment. Make your bedroom a comfortable and conducive space for sleep. Ensure the room is dark, quiet, and at a comfortable temperature. Consider using earplugs, eye masks, or white noise machines to block out any distractions. Limit exposure to electronic devices. The blue light emitted by electronic devices can interfere with sleep. Avoid using smartphones, tablets, or computers for at least an hour before bed. If necessary, use blue light filters or apps that reduce the impact of blue light. Avoid caffeine and stimulants. Caffeine and other stimulants can disrupt sleep patterns. Limit your intake of caffeinated beverages, such as coffee, tea, and energy drinks, especially in the afternoon and evening. Exercise regularly. Engaging in regular physical activity during the day can promote better sleep at night. However, avoid exercising too close to bedtime, as it can increase alertness and make it harder to fall asleep. Manage stress and anxiety. Stress and anxiety can interfere with sleep. Practice relaxation techniques, such as meditation, deep breathing, or journaling, to help calm your mind before bed. If necessary, seek professional help to address any underlying stress or anxiety issues. 8.4.3 Addressing sleep disorders. In some cases, individuals with ADHD may also experience sleep disorders that require additional attention and treatment. Two common sleep disorders associated with ADHD are insomnia and sleep apnea. Insomnia. Insomnia refers to difficulty falling asleep or staying asleep. If you consistently struggle with insomnia, it is important to consult with a healthcare professional who can provide guidance and recommend appropriate interventions. Cognitive behavioral therapy for insomnia, CBTI, is a commonly used treatment approach that can help improve sleep quality. Sleep apnea. Sleep apnea is a condition characterized by pauses in breathing during sleep. It can lead to fragmented sleep and excessive daytime sleepiness. If you suspect you may have sleep apnea, it is important to undergo a sleep study to receive an accurate diagnosis. Treatment options for sleep apnea may include continuous positive airway pressure, CPAP therapy, or lifestyle modifications. 8.4.4 The role of napping. Napping can be a beneficial strategy for individuals with ADHD, as it can help combat daytime sleepiness and improve cognitive functioning. However, it is important to approach napping strategically to avoid disrupting nighttime sleep. Here are some guidelines for effective napping. Keep naps short. Aim for power naps that last between 10 to 30 minutes. Longer naps can leave you feeling groggy and interfere with nighttime sleep. Time your naps wisely. Schedule naps earlier in the day to avoid interfering with your regular sleep schedule. Napping too close to bedtime can make it harder to fall asleep at night. Create a nap-friendly environment. Find a quiet and comfortable space where you can relax and nap undisturbed. Consider using an eye mask, earplugs, or white noise machines to create a soothing environment. Experiment with different nap durations. Some individuals with ADHD may benefit from shorter, more frequent naps throughout the day, while others may find longer naps more beneficial. Experiment with different nap durations to find what works best for you. 8.4.5 Seeking professional help. If you continue to experience persistent sleep difficulties despite implementing healthy sleep habits, it may be beneficial to seek professional help. A healthcare professional, such as a sleep specialist or psychiatrist, can evaluate your sleep patterns, identify any underlying sleep disorders, and recommend appropriate treatment options. Remember, improving sleep quality is a gradual process, and it may take time to establish healthy sleep habits. Be patient with yourself and remain consistent in implementing the strategies discussed in this section. With time and practice, you can improve your sleep patterns, enhance your overall well-being, and better manage your ADHD symptoms. 9. Managing emotions and impulsivity. 9.1 Emotional regulation techniques. Emotional regulation is a crucial skill for individuals with ADHD. Many people with ADHD struggle with managing their emotions, experiencing intense feelings of frustration, anger, and impulsivity. These emotions can often be overwhelming and can negatively impact relationships, work, and overall well-being. However, with the right techniques and strategies, individuals with ADHD can learn to regulate their emotions effectively. 9.1.1 Recognizing and identifying emotions. The first step in emotional regulation is to recognize and identify the emotions you are experiencing. This may seem simple, but for individuals with ADHD, it can be challenging. ADHD can make it difficult to accurately identify and label emotions, leading to confusion and frustration. To improve emotional regulation, it is essential to develop self-awareness and mindfulness. One effective technique is to practice mindfulness meditation. Mindfulness involves paying attention to the present moment without judgment. By practicing mindfulness regularly, individuals with ADHD can become more aware of their emotions as they arise. This awareness allows them to identify and label their emotions accurately. Another helpful strategy is to keep an emotion journal. Take a few minutes each day to write down your emotions and the situations that triggered them. This practice can help you become more aware of your emotional patterns and provide insights into the specific triggers that lead to intense emotions. 9.1.2 Deep breathing and relaxation techniques. When emotions become overwhelming, it is essential to have strategies to calm the mind and body. Deep breathing exercises and relaxation techniques can be powerful tools for emotional regulation. Deep breathing involves taking slow, deep breaths, focusing on the sensation of the breath entering and leaving the body. This technique helps activate the body's relaxation response, reducing feelings of stress and anxiety. Practice deep breathing whenever you feel overwhelmed or notice intense emotions arising. Progressive muscle relaxation is another effective technique for managing emotions. This technique involves tensing and then releasing different muscle groups in the body, promoting a sense of relaxation and calm. By systematically relaxing the muscles, individuals with ADHD can release tension and reduce emotional intensity. 9.1.3 Cognitive restructuring. Cognitive restructuring is a technique that involves challenging and changing negative or irrational thoughts that contribute to intense emotions. Individuals with ADHD often have a tendency to engage in negative self-talk and catastrophize situations, leading to heightened emotional responses. To practice cognitive restructuring, start by identifying the negative thoughts or beliefs that contribute to your emotional distress. Ask yourself if these thoughts are rational and if there is evidence to support them. Then, challenge these thoughts by replacing them with more realistic and positive alternatives. For example, if you find yourself thinking, "I always mess up everything," challenge this thought by reminding yourself of times when you have succeeded or done well. Replace the negative thought with a more positive and realistic one, such as, "I have had successes in the past, and I am capable of doing well." 9.1.4 Mindfulness-based stress reduction. Mindfulness-based stress reduction (MBSR) is a program that combines mindfulness meditation, yoga, and body awareness to help individuals manage stress and regulate their emotions. MBSR has been found to be particularly beneficial for individuals with ADHD, as it helps improve attention, reduce impulsivity, and enhance emotional regulation. The practice of MBSR involves regular meditation sessions, body scan exercises, and gentle yoga movements. By incorporating these practices into your daily routine, you can develop greater self-awareness, reduce stress, and improve emotional regulation. 9.1.5 Seeking support and therapy. Managing emotions can be challenging, and it is essential to seek support when needed. Therapy, such as cognitive behavioral therapy, CBT, can be highly beneficial for individuals with ADHD. CBT focuses on identifying and changing negative thought patterns and developing effective coping strategies. In therapy, you can work with a trained professional to explore the underlying causes of your emotional difficulties and develop personalized strategies for emotional regulation. Additionally, support groups can provide a safe space to share experiences, learn from others, and gain valuable insights into managing emotions. 9.1.6 Practicing self-care. Taking care of yourself is crucial for emotional regulation. Engaging in activities that bring you joy, relaxation, and fulfillment can help reduce stress and improve overall emotional well-being. Make time for hobbies, exercise, spending time with loved ones, and engaging in activities that promote self-care. Additionally, prioritize self-care activities that help you recharge and relax. This may include taking regular breaks, getting enough sleep, practicing good nutrition, and engaging in activities that promote mental and physical well-being. Remember, emotional regulation is a skill that takes time and practice to develop. Be patient with yourself and celebrate small victories along the way. With consistent effort and the right techniques, individuals with ADHD can learn to effectively manage their emotions and thrive in their daily lives. 9.2 Anger and frustration management. Living with ADHD can often lead to feelings of anger and frustration. The challenges of managing symptoms such as impulsivity, difficulty focusing, and hyperactivity can create a sense of frustration and irritability. It is important to develop effective strategies to manage these emotions and prevent them from negatively impacting your daily life and relationships. Understanding anger and frustration. Anger and frustration are natural emotions that everyone experiences from time to time. However, individuals with ADHD may find it more challenging to regulate these emotions due to the impulsivity and difficulty with emotional regulation that often accompany the condition. It is important to recognize that anger and frustration are normal responses to difficult situations, but it is how we manage and express these emotions that can make a significant difference. Recognizing triggers. One of the first steps in managing anger and frustration is to identify the triggers that lead to these emotions. Triggers can vary from person to person, but common ones include feeling overwhelmed, experiencing a lack of control, facing criticism or rejection, or dealing with unexpected changes. By becoming aware of your personal triggers, you can develop strategies to prevent or minimize their impact on your emotions. Developing coping mechanisms. Once you have identified your triggers, it is essential to develop coping mechanisms to manage anger and frustration effectively. Here are some strategies that can help. Deep breathing and relaxation techniques. Deep breathing exercises and relaxation techniques can be powerful tools for managing anger and frustration. When you feel your emotions escalating, take a moment to focus on your breath. Inhale deeply through your nose, hold for a few seconds, and then exhale slowly through your mouth. Repeat this process several times, allowing your body to relax and your mind to calm down. Physical activity. Engaging in physical activity can be an excellent outlet for releasing pent-up anger and frustration. Exercise helps to reduce stress and increase the production of endorphins, which are natural mood boosters. Whether it's going for a run, practicing yoga, or participating in a team sport, finding a physical activity that you enjoy can be a healthy way to manage your emotions. Journaling. Writing down your thoughts and feelings in a journal can be a therapeutic way to process and release anger and frustration. Take a few minutes each day to write about your emotions, the situations that triggered them, and any insights or solutions that come to mind. Journaling can provide a sense of release and clarity, allowing you to gain a better understanding of your emotions and develop strategies for managing them. Cognitive restructuring. Cognitive restructuring involves challenging and changing negative thought patterns that contribute to anger and frustration. When you find yourself becoming angry or frustrated, take a step back and examine your thoughts. Are they based on accurate information? Or are there alternative explanations or perspectives? By challenging negative thoughts and replacing them with more positive and realistic ones, you can reduce the intensity of your emotions. Seeking support. Managing anger and frustration can be challenging on your own. It can be helpful to seek support from friends, family, or a therapist who can provide guidance and understanding. Talking about your emotions with someone you trust can provide a fresh perspective and help you develop effective strategies for managing your anger and frustration. Communication and conflict resolution. Effective communication is crucial in managing anger and frustration in relationships. When expressing your emotions, it is important to use I statements to avoid blaming or accusing others. For example, instead of saying, "You always make me angry," try saying, "I feel frustrated when this happens." This approach allows you to express your emotions without putting the other person on the defensive. Conflict resolution skills are also essential in managing anger and frustration. Learning how to negotiate, compromise, and find mutually beneficial solutions can help prevent conflicts from escalating and reduce feelings of anger and frustration. It is important to approach conflicts with an open mind and a willingness to listen and understand the other person's perspective. Practice self-care. Taking care of yourself is crucial in managing anger and frustration. Make sure to prioritize self-care activities that help you relax and recharge. This can include activities such as practicing mindfulness or meditation, engaging in hobbies you enjoy, spending time in nature, or pampering yourself with a soothing bath or massage. By prioritizing self-care, you can reduce stress levels and improve your overall well-being, making it easier to manage anger and frustration. Conclusion. Managing anger and frustration is an important aspect of living with ADHD. By recognizing triggers, developing coping mechanisms, improving communication and conflict resolution skills, and practicing self-care, you can effectively manage these emotions and prevent them from negatively impacting your life. Remember, it is normal to experience anger and frustration, but it is how you choose to respond to these emotions that can make all the difference. 9.3 Impulse Control Strategies. Impulsivity is a common challenge for individuals with ADHD. It can manifest in various ways, such as acting without thinking, interrupting others, or engaging in risky behaviors. Learning to manage impulsivity is crucial for individuals with ADHD to improve their focus, decision-making, and overall well-being. In this section, we will explore effective strategies to help individuals with ADHD develop impulse control. 9.3.1 Understanding Impulsivity. Before diving into strategies, it is important to understand the nature of impulsivity in ADHD. Impulsivity is often a result of difficulties in inhibiting immediate responses and considering the consequences of actions. It can be influenced by factors such as hyperactivity, distractibility, and poor executive functioning. By recognizing the underlying causes of impulsivity, individuals with ADHD can better tailor their strategies to address this specific challenge. 9.3.2 Pause and reflect. One of the most effective strategies for managing impulsivity is to pause and reflect before acting on an impulse. This simple technique allows individuals with ADHD to create a moment of awareness and give themselves time to consider the potential consequences of their actions. Taking a deep breath and counting to 10 can help create a mental space for reflection. By consciously slowing down their response, individuals with ADHD can make more thoughtful decisions and avoid impulsive behaviors. 9.3.3 Cognitive Restructuring. Cognitive restructuring is a technique that involves challenging and reframing impulsive thoughts and beliefs. Individuals with ADHD often have automatic thoughts that drive their impulsive behaviors. By identifying these thoughts and questioning their validity, individuals can gain better control over their impulses. For example, if someone with ADHD has the automatic thought, "I must act on this idea immediately," they can challenge it by asking themselves, "Is it really necessary to act right away? What are the potential consequences of waiting and considering other options?" 9.3.4 Delayed gratification. Delayed gratification is a powerful strategy for managing impulsivity. It involves resisting immediate rewards or impulses in favor of long-term goals or benefits. Individuals with ADHD can practice delayed gratification by setting small goals that require patience and self-control. For example, they can delay watching their favorite TV show until they have completed a task or wait to make a purchase until they have saved enough money. By practicing delayed gratification, individuals with ADHD can strengthen their impulse control muscles and improve their ability to resist impulsive urges. 9.3.5 Utilize visual cues. Visual cues can be helpful in reminding individuals with ADHD to pause and think before acting impulsively. They can place visual reminders, such as sticky notes or symbols, in strategic locations to prompt them to consider the consequences of their actions. For example, they can place a sticky note on their computer screen that says, "Pause and reflect," or use a symbol like a traffic light to remind themselves to stop and think before proceeding. These visual cues serve as gentle reminders to engage in more thoughtful decision-making. 9.3.6 Practice mindfulness. Mindfulness is a powerful tool for managing impulsivity. By practicing mindfulness, individuals with ADHD can develop greater self-awareness and learn to observe their thoughts and impulses without immediately acting on them. Mindfulness exercises, such as deep breathing, body scans, or meditation, can help individuals with ADHD cultivate a sense of calm and reduce impulsive reactions. Regular mindfulness practice can also improve attention and focus, which indirectly supports impulse control. 9.3.7 Seek support. Managing impulsivity can be challenging, and it is important for individuals with ADHD to seek support from others. This can include family members, friends, or support groups who understand the unique challenges of ADHD. By sharing their experiences and learning from others, individuals with ADHD can gain valuable insights and strategies for managing impulsivity. Supportive individuals can also provide encouragement and accountability, which can be instrumental in developing impulse control. 9.3.8 Engage in physical activity. Physical activity is not only beneficial for overall health but can also help individuals with ADHD manage impulsivity. Engaging in regular exercise releases endorphins, which can improve mood and reduce impulsive behaviors. Activities such as walking, running, swimming, or practicing yoga can provide an outlet for excess energy and help individuals with ADHD channel their impulses in a more controlled manner. Incorporating physical activity into daily routines can contribute to better impulse control and overall well-being. 9.3.9 Develop coping strategies. Developing coping strategies specific to impulsive behaviors can be highly effective for individuals with ADHD. These strategies can include techniques such as distraction, self-talk, or engaging in alternative activities. For example, if someone with ADHD feels the urge to interrupt during a conversation, they can practice deep breathing and remind themselves to listen actively instead. By developing coping strategies, individuals with ADHD can redirect their impulses in more constructive ways and reduce the negative impact of impulsivity on their daily lives. 9.3.10 Celebrate progress. Managing impulsivity is a journey, and it is important for individuals with ADHD to celebrate their progress along the way. Recognizing and acknowledging small victories can provide motivation and reinforce positive behaviors. Whether it is successfully resisting an impulsive urge or making a thoughtful decision, each step towards improved impulse control is worth celebrating. By focusing on progress rather than perfection, individuals with ADHD can build confidence and continue to develop their impulse control skills. In conclusion, managing impulsivity is a crucial aspect of managing ADHD. By implementing strategies such as pausing and reflecting, cognitive restructuring, practicing delayed gratification, utilizing visual cues, practicing mindfulness, seeking support, engaging in physical activity, developing coping strategies, and celebrating progress, individuals with ADHD can improve their impulse control and lead more fulfilling lives. It is important to remember that managing impulsivity takes time and effort, but with persistence and the right strategies, individuals with ADHD can develop effective impulse control skills. 9.4 Conflict resolution skills. Living with ADHD can sometimes lead to conflicts and misunderstandings in relationships, both personal and professional. The impulsivity, inattention, and emotional dysregulation associated with ADHD can make it challenging to navigate conflicts effectively. However, by developing conflict resolution skills, individuals with ADHD can learn to manage conflicts in a constructive and positive way. 9.4.1 Understanding conflict. Conflict is a natural part of any relationship. It arises when there is a disagreement or difference of opinion between two or more individuals. In the context of ADHD, conflicts can occur due to misunderstandings, impulsive reactions, or difficulties in managing emotions. It is important to recognize that conflicts are not inherently negative but can provide an opportunity for growth and understanding. 9.4.2 Active listening. One of the key skills in conflict resolution is active listening. This involves fully focusing on the other person's perspective and understanding their point of view without interrupting or formulating a response. For individuals with ADHD, active listening can be challenging due to difficulties in sustaining attention. However, practicing active listening can significantly improve communication and reduce conflicts. To practice active listening, it is important to maintain eye contact, nod or provide verbal cues to show understanding, and ask clarifying questions to ensure comprehension. Avoid distractions and try to stay present in the conversation. By actively listening, you can demonstrate empathy and create a safe space for open communication. 9.4.3 Effective communication. Effective communication is crucial in resolving conflicts. Individuals with ADHD may struggle with impulsivity and may blurt out their thoughts without considering the impact of their words. It is important to take a moment to pause and think before responding, especially during heated discussions. Using I statements can also be helpful in expressing your feelings and needs without sounding accusatory. For example, instead of saying, "You never listen to me," you can say, "I feel unheard when I don't get a chance to express my thoughts." This approach encourages open dialogue and reduces defensiveness. Additionally, being aware of nonverbal communication cues, such as body language and tone of voice, can help in conveying your message effectively. Pay attention to your own nonverbal cues as well, as they can unintentionally communicate emotions or attitudes. 9.4.4 Managing emotions. Emotional dysregulation is a common challenge for individuals with ADHD, and it can escalate conflicts if not managed effectively. It is important to develop strategies to regulate emotions during conflicts. Taking a few deep breaths, counting to 10, or stepping away from the situation temporarily can help in calming down and gaining perspective. Expressing emotions assertively rather than aggressively is also crucial in conflict resolution. Assertiveness involves expressing your needs and concerns while respecting the other person's perspective. It is important to avoid personal attacks or blaming the other person, as this can escalate the conflict further. 9.4.5 Finding common ground. In conflicts, it is essential to find common ground and areas of agreement. This can help in building a foundation for resolving the conflict and finding mutually beneficial solutions. Look for shared goals or interests and focus on finding solutions that address the needs of all parties involved. Brainstorming together and considering multiple perspectives can lead to creative and collaborative problem solving. It is important to be open-minded and willing to compromise when necessary. Remember that the goal is not to win the argument but to find a resolution that respects everyone's needs. 9.4.6 Seeking mediation or professional help. In some cases, conflicts may be too complex or deeply rooted to resolve independently. Seeking the help of a mediator or a professional therapist can provide valuable guidance and support in navigating conflicts. A mediator can facilitate communication and help in finding common ground, while a therapist can provide strategies for managing emotions and improving communication skills. 9.4.7 Practice and Patience. Developing conflict resolution skills takes practice and patience. It is important to be gentle with yourself and acknowledge that mistakes may happen along the way. Reflect on past conflicts and identify areas for improvement. By consistently practicing active listening, effective communication, and emotional regulation, you can gradually enhance your conflict resolution skills. Remember that conflicts are a normal part of relationships, and resolving them in a healthy and constructive manner can strengthen bonds and foster understanding. By investing time and effort into developing conflict resolution skills, individuals with ADHD can navigate conflicts more effectively and build healthier relationships. 10. Building healthy habits. 10.1 Creating a balanced lifestyle. Living with ADHD can be challenging, but with the right strategies and lifestyle adjustments, it is possible to manage the symptoms and lead a fulfilling life. One key aspect of managing ADHD is creating a balanced lifestyle that supports your overall well-being. In this section, we will explore various ways to achieve this balance and improve your quality of life. 10.1.1 Prioritizing self-care. Self-care is essential for everyone, but it is especially important for individuals with ADHD. Taking care of your physical, mental, and emotional well-being can significantly impact your ability to manage ADHD symptoms effectively. Here are some self-care practices to consider. Establishing a daily routine. Creating a structured daily routine can provide a sense of stability and help you stay organized. Set specific times for waking up, eating meals, exercising, working, and going to bed. Having a routine can reduce stress and make it easier to manage your time and tasks. Engaging in regular exercise. Physical activity has numerous benefits for individuals with ADHD. Exercise helps release excess energy, improves focus and attention, reduces impulsivity, and enhances overall well-being. Find activities that you enjoy, such as walking, swimming, dancing, or playing a sport, and aim for at least 30 minutes of exercise most days of the week. Practicing mindfulness and relaxation techniques. Mindfulness and relaxation techniques can help calm a busy mind and reduce stress. Consider incorporating practices such as deep breathing exercises, meditation, yoga, or Tai Chi into your daily routine. These activities can improve focus, increase self-awareness, and promote a sense of calm and balance. Engaging in hobbies and creative outlets. Engaging in hobbies and creative outlets can provide a much-needed break from daily responsibilities and help you recharge. Whether it's painting, playing a musical instrument, gardening, or writing, find activities that bring you joy and allow you to express yourself. These activities can also improve focus and boost your mood. 10.1.2 Nurturing relationships. Building and maintaining healthy relationships is crucial for overall well-being. Here are some strategies to help you navigate relationships while managing ADHD. Effective communication. Clear and open communication is essential in any relationship. Be honest about your ADHD and how it may impact your interactions. Educate your loved ones about the condition and explain your specific challenges and needs. Encourage open dialogue and active listening to foster understanding and empathy. Setting boundaries. Setting boundaries is important for maintaining healthy relationships. Communicate your needs and limitations to others, and be assertive in expressing what you can and cannot do. Establishing boundaries can help prevent overwhelm and reduce stress. Seeking support. Don't be afraid to ask for support when you need it. Reach out to trusted friends, family members, or support groups who can provide understanding and encouragement. Consider joining ADHD support groups or seeking therapy to gain additional tools and strategies for managing your symptoms. Building empathy and understanding. Developing empathy and understanding for others can strengthen your relationships. Take the time to listen and try to see things from their perspective. Practice patience and compassion, both for yourself and for those around you. 10.1.3 Managing stress. Stress can exacerbate ADHD symptoms, so it's crucial to develop effective stress management techniques. Here are some strategies to help you manage stress. Identifying stress triggers. Become aware of the situations, people, or activities that tend to trigger stress for you. Once you identify these triggers, you can develop strategies to minimize their impact or avoid them altogether. Practicing relaxation techniques. Engage in relaxation techniques regularly to reduce stress levels. Deep breathing exercises, progressive muscle relaxation, and guided imagery are effective techniques that can help you relax and calm your mind. Time management. Effective time management can significantly reduce stress. Break tasks into smaller, manageable steps, prioritize them, and create a schedule or to-do list. Use tools such as calendars, planners, or smartphone apps to help you stay organized and on track. Seeking emotional support. When stress becomes overwhelming, seek emotional support from trusted individuals. Talk to a friend, family member, or therapist who can provide guidance and help you navigate challenging situations. 10.1.4 Finding work-life balance. Balancing work and personal life is essential for overall well-being. Here are some strategies to help you find a healthy work-life balance. Setting realistic expectations. Be realistic about what you can accomplish in a given time frame. Avoid overcommitting yourself and learn to say no when necessary. Setting realistic expectations can help reduce stress and prevent burnout. Taking breaks. Taking regular breaks throughout the workday can improve focus and productivity. Incorporate short breaks into your schedule to rest, stretch, or engage in a quick mindfulness exercise. These breaks can help recharge your brain and prevent mental fatigue. Creating boundaries. Establish clear boundaries between work and personal life. Avoid bringing work-related tasks or stress into your personal time. Set specific work hours and try to disconnect from work-related activities outside of those hours. Seeking flexibility. If possible, seek flexibility in your work environment. Discuss potential accommodations with your employer, such as flexible work hours or the option to work remotely. Having a flexible work arrangement can help reduce stress and improve your overall well-being. By creating a balanced lifestyle that prioritizes self-care, nurtures relationships, manages stress, and finds work-life balance, you can effectively manage ADHD symptoms and improve your overall quality of life. Remember that finding what works best for you may require some trial and error, so be patient and persistent in implementing these strategies. 10.2 Exercise and physical health. Exercise plays a crucial role in managing ADHD symptoms and promoting overall well-being. Engaging in regular physical activity can have a positive impact on focus, attention, impulsivity, and mood. In this section, we will explore the benefits of exercise for individuals with ADHD and provide practical tips for incorporating physical activity into your daily routine. The benefits of exercise for ADHD. Improved focus and attention. Exercise has been shown to enhance cognitive function, including attention and focus. When you engage in physical activity, your brain releases neurotransmitters like dopamine and norepinephrine, which are essential for regulating attention and improving executive functions. Reduced hyperactivity and impulsivity. Regular exercise can help reduce hyperactivity and impulsivity, common symptoms of ADHD. Physical activity provides an outlet for excess energy and helps individuals with ADHD channel their impulses in a controlled and productive manner. Enhanced mood and emotional well-being. Exercise stimulates the release of endorphins, which are natural mood boosters. Regular physical activity can help reduce symptoms of anxiety and depression often associated with ADHD, promoting a more positive and balanced emotional state. Improved sleep quality. Many individuals with ADHD struggle with sleep difficulties. Engaging in regular exercise can help regulate sleep patterns, promote better sleep quality, and reduce insomnia symptoms. A good night's sleep is essential for optimal cognitive functioning and overall well-being. Increased brain function and cognitive performance. Exercise has been shown to enhance brain function and cognitive performance. Physical activity increases blood flow to the brain, delivering oxygen and nutrients necessary for optimal cognitive functioning. Regular exercise can improve memory, learning, and problem-solving skills. Types of exercise for ADHD. When it comes to exercise, finding activities that you enjoy and can sustain over time is key. Here are some types of exercise that can be particularly beneficial for individuals with ADHD. Aerobic exercise. Activities that get your heart rate up, such as running, swimming, cycling, or dancing, are excellent choices for individuals with ADHD. Aerobic exercise increases blood flow to the brain, promoting focus, attention, and overall cognitive function. Strength training. Incorporating strength training exercises, such as weightlifting or resistance training, can help improve muscle tone, coordination, and overall physical strength. Strength training also releases endorphins, promoting a positive mood and reducing stress. Yoga and mind-body exercises. Yoga, Tai Chi, and other mind-body exercises can be beneficial for individuals with ADHD. These activities combine physical movement with mindfulness and deep breathing, promoting relaxation, focus, and emotional well-being. Team sports and group activities. Engaging in team sports or group activities can provide social interaction, structure, and a sense of belonging. Sports like soccer, basketball, or martial arts can help individuals with ADHD develop teamwork skills, improve coordination, and manage impulsivity. Tips for incorporating exercise into your routine. Here are some practical tips for incorporating exercise into your daily routine to manage ADHD symptoms effectively. Start slow and gradually increase intensity. If you're new to exercise or have been inactive for a while, start with low-intensity activities and gradually increase the duration and intensity over time. This approach will help you build stamina and avoid burnout. Find activities you enjoy. Choose activities that you genuinely enjoy and look forward to. Whether it's dancing, hiking, swimming, or playing a sport, finding activities that bring you joy will increase your motivation to stick with them. Set realistic goals. Set realistic and achievable exercise goals that align with your abilities and schedule. Start with small goals and gradually increase them as you progress. Celebrate your accomplishments along the way to stay motivated. Make it a habit. Schedule regular exercise sessions into your daily or weekly routine. Treat exercise as a non-negotiable appointment with yourself. Consistency is key to reaping the long-term benefits of physical activity. Mix it up. Variety is essential to prevent boredom and maintain motivation. Incorporate a mix of aerobic exercises, strength training, and mind-body activities into your routine. This variety will keep your workouts interesting and target different aspects of your physical and mental well-being. Find an exercise buddy. Exercising with a friend or joining a group class can provide accountability and make the experience more enjoyable. Having a workout partner can also make exercise feel like a social activity, enhancing motivation and adherence. Use exercise as a break. When you find yourself struggling with focus or feeling overwhelmed, take a short exercise break. Engaging in physical activity can help reset your brain, increase alertness, and improve productivity. Remember, it's essential to consult with your healthcare provider before starting any new exercise program, especially if you have any underlying health conditions. They can provide personalized recommendations and ensure that you engage in activities that are safe and suitable for your individual needs. By incorporating regular exercise into your routine, you can harness its powerful benefits to manage ADHD symptoms, improve overall well-being, and lead a healthier, more balanced life. 10.3 Nutrition and Diet. Proper nutrition and a healthy diet play a crucial role in managing ADHD symptoms and promoting overall well-being. While there is no specific ADHD diet, certain foods and nutrients can support brain health and improve focus, attention, and impulse control. In this section, we will explore the impact of nutrition on ADHD and provide practical tips for incorporating a balanced diet into your daily routine. 10.3.1 The role of nutrition in ADHD. Research suggests that there is a strong connection between nutrition and ADHD symptoms. While food alone cannot cause or cure ADHD, it can significantly influence brain function and behavior. Certain nutrients are essential for optimal brain health and can help regulate neurotransmitters, which are chemicals that transmit signals in the brain. Omega-3 fatty acids. Omega-3 fatty acids, particularly EPA and DHA, are crucial for brain development and function. Studies have shown that individuals with ADHD often have lower levels of omega-3 fatty acids in their blood. Including foods rich in omega-3s, such as fatty fished salmon, mackerel, sardines, walnuts, flax seeds, and chia seeds, in your diet may help improve attention and reduce impulsivity. Protein. Protein is essential for the production of neurotransmitters, including dopamine and norepinephrine, which play a role in attention and focus. Including lean sources of protein, such as chicken, turkey, fish, eggs, beans, and tofu, in your meals can help stabilize blood sugar levels and promote sustained energy throughout the day. Complex carbohydrates. Complex carbohydrates, such as whole grains, fruits, and vegetables, provide a steady release of glucose into the bloodstream, which is the brain's primary source of energy. Avoiding refined sugars and processed foods can help prevent blood sugar spikes and crashes, which can negatively impact focus and mood. Vitamins and minerals. Adequate intake of vitamins and minerals is essential for overall brain health. Some key nutrients that may benefit individuals with ADHD include B vitamins. B vitamins, particularly B6, B9 folate, and B12, are involved in the production of neurotransmitters and can support cognitive function. Good sources of B vitamins include leafy green vegetables, legumes, whole grains, and lean meats. Magnesium. Magnesium plays a role in regulating neurotransmitters and has been linked to improved attention and reduced hyperactivity. Foods rich in magnesium include dark leafy greens, nuts, seeds, and whole grains. Zinc. Zinc is involved in neurotransmitter function and can support cognitive performance. Good sources of zinc include seafood, lean meats, legumes, and nuts. 10.3.2 Practical tips for a balanced diet. Maintaining a balanced diet can be challenging, especially for individuals with ADHD who may struggle with impulsivity and disorganization. However, with some planning and strategies, it is possible to incorporate healthy eating habits into your daily routine. Here are some practical tips to help you establish a balanced diet. Meal planning. Plan your meals in advance to ensure you have nutritious options readily available. Create a weekly meal plan, make a shopping list, and stock your kitchen with healthy ingredients. Having a plan in place can help you make better food choices and avoid relying on unhealthy convenience foods. Regular meal times. Establish regular meal times and try to stick to a consistent eating schedule. This can help regulate blood sugar levels and prevent energy crashes throughout the day. Aim for 3 balanced meals and 2 to 3 healthy snacks to keep your energy levels stable. Include protein and fiber. Make sure each meal contains a good source of protein and fiber. Protein-rich foods can help keep you feeling full and focused, while fiber aids in digestion and promotes a steady release of energy. Incorporate lean meats, fish, beans, whole grains, fruits, and vegetables into your meals. Limit processed foods and sugars. Minimize your intake of processed foods, sugary snacks, and beverages. These foods can lead to blood sugar spikes and crashes, causing fluctuations in energy levels and mood. Opt for whole, unprocessed foods whenever possible. Hydration. Stay hydrated by drinking plenty of water throughout the day. Dehydration can negatively impact cognitive function and energy levels. Carry a water bottle with you and set reminders to drink water regularly. Mindful eating. Practice mindful eating by paying attention to your food and eating slowly. This can help you recognize hunger and fullness cues, prevent overeating, and promote better digestion. Supplements. While it is best to obtain nutrients from whole foods, some individuals may benefit from supplements. Consult with a healthcare professional before starting any supplements to ensure they are safe and appropriate for you. 10.3.3 Food sensitivities and elimination diets. Some individuals with ADHD may have sensitivities or allergies to certain foods, which can exacerbate symptoms. Common culprits include artificial additives, food dyes, gluten, and dairy products. If you suspect that certain foods may be affecting your ADHD symptoms, you may consider trying an elimination diet. An elimination diet involves removing potential trigger foods from your diet for a period of time and then gradually reintroducing them to identify any adverse reactions. Keep a food diary to track your symptoms and consult with a healthcare professional or registered dietitian for guidance on implementing an elimination diet safely and effectively. 10.3.4 Conclusion. While nutrition alone cannot cure ADHD, adopting a balanced diet can support brain health and improve symptoms. By incorporating omega-3 fatty acids, protein, complex carbohydrates, and essential vitamins and minerals into your meals, you can provide your brain with the nutrients it needs to function optimally. Remember to plan your meals, establish regular eating times, and be mindful of your food choices. By making small changes to your diet, you can take an active role in managing your ADHD symptoms and promoting overall well-being. 10.4 Sleep and rest. Sleep and rest play a crucial role in managing ADHD symptoms and promoting overall well-being. Adequate sleep is essential for maintaining focus, attention, and emotional regulation. Unfortunately, individuals with ADHD often struggle with sleep-related difficulties, such as insomnia, restless sleep, and difficulty falling asleep or staying asleep. In this section, we will explore the importance of sleep for individuals with ADHD and provide strategies to improve sleep quality and establish healthy sleep habits. 10.4.1 The importance of sleep for ADHD. Sleep is a fundamental biological process that allows our bodies and minds to recharge and rejuvenate. For individuals with ADHD, quality sleep is particularly important as it directly impacts their ability to manage symptoms effectively. Lack of sleep can exacerbate ADHD symptoms, leading to increased impulsivity, decreased attention span, and heightened emotional reactivity. Research has shown that individuals with ADHD often experience sleep disturbances, including difficulty falling asleep, frequent awakenings during the night, and restless sleep. These sleep difficulties can be attributed to various factors, such as hyperactivity, racing thoughts, and heightened sensitivity to stimuli. Additionally, the use of stimulant medications commonly prescribed for ADHD can also affect sleep patterns. 10.4.2 Establishing a healthy sleep routine. Creating a consistent and structured sleep routine can significantly improve sleep quality for individuals with ADHD. Here are some strategies to establish a healthy sleep routine. Set a regular sleep schedule. Try to go to bed and wake up at the same time every day, even on weekends. Consistency helps regulate your body's internal clock and promotes better sleep. Create a calming bedtime routine. Engage in relaxing activities before bed, such as reading a book, taking a warm bath, or practicing deep breathing exercises. Avoid stimulating activities, such as using electronic devices or engaging in intense physical exercise, close to bedtime. Create a sleep-friendly environment. Make your bedroom a comfortable and conducive space for sleep. Ensure the room is dark, quiet, and at a comfortable temperature. Consider using earplugs, eye masks, or white noise machines to block out any disruptive sounds or lights. Limit exposure to electronic devices. The blue light emitted by electronic devices can interfere with your sleep. Avoid using electronic devices, such as smartphones, tablets, or laptops, at least an hour before bedtime. If necessary, use blue light filters or night mode settings on your devices. Avoid caffeine and stimulants. Caffeine and other stimulants can disrupt sleep patterns. Limit your consumption of caffeinated beverages, such as coffee, tea, and energy drinks, especially in the afternoon and evening. Exercise regularly. Engaging in regular physical activity can promote better sleep. However, try to avoid intense exercise close to bedtime, as it may increase alertness and make it harder to fall asleep. Manage stress and anxiety. Stress and anxiety can interfere with sleep. Practice stress management techniques, such as mindfulness meditation, deep breathing exercises, or journaling, to help calm your mind before bed. 10.4.3 Addressing sleep disorders. In some cases, individuals with ADHD may also experience sleep disorders, such as insomnia or sleep apnea. If you suspect you have a sleep disorder, it is essential to consult with a healthcare professional for proper diagnosis and treatment. Here are some common sleep disorders that individuals with ADHD may experience. Insomnia. Insomnia involves difficulty falling asleep, staying asleep, or experiencing non-restorative sleep. Cognitive behavioral therapy for insomnia, CBTI, is a highly effective treatment approach that focuses on changing behaviors and thoughts that contribute to sleep difficulties. Sleep apnea. Sleep apnea is a condition characterized by pauses in breathing during sleep. It can lead to fragmented sleep and excessive daytime sleepiness. Treatment options for sleep apnea may include continuous positive airway pressure, CPAP therapy, lifestyle changes, or surgical interventions. Restless legs syndrome, RLS. RLS is a neurological disorder characterized by an irresistible urge to move the legs, often accompanied by uncomfortable sensations. Treatment for RLS may involve medications, lifestyle changes, and managing underlying conditions. 10.4.4 Tips for better sleep. In addition to establishing a healthy sleep routine, here are some additional tips to improve sleep quality for individuals with ADHD. Create a comfortable sleep environment. Invest in a supportive mattress, comfortable pillows, and breathable bedding to create a comfortable sleep environment. Avoid napping. If you struggle with falling asleep or staying asleep at night, try to avoid daytime napping. If you must nap, limit it to a short duration and avoid napping too close to bedtime. Limit exposure to stimulating activities. Engage in calming activities before bed, such as reading a book, listening to soothing music, or practicing relaxation techniques. Avoid heavy meals and stimulants before bed. Eating a heavy meal or consuming stimulants, such as nicotine or alcohol, close to bedtime can disrupt sleep. Opt for light, nutritious snacks if you feel hungry before bed. Create a worry journal. If racing thoughts keep you awake at night, try writing down your worries or thoughts in a journal before bed. This can help clear your mind and promote relaxation. Remember, improving sleep quality takes time and consistency. Be patient with yourself as you establish healthy sleep habits and seek professional help if you continue to experience significant sleep difficulties. By prioritizing sleep and rest, you can enhance your overall well-being and better manage your ADHD symptoms. 11. Navigating relationships. 11.1 Communication skills. Effective communication is essential in all aspects of life, and it plays a crucial role in managing ADHD. Individuals with ADHD often face challenges in expressing themselves, understanding others, and maintaining healthy relationships. However, by developing and honing communication skills, individuals with ADHD can improve their interactions, reduce misunderstandings, and build stronger connections with others. 11.1.1 Active listening. One of the fundamental aspects of effective communication is active listening. Active listening involves fully engaging with the speaker, paying attention to both verbal and nonverbal cues, and demonstrating genuine interest in what the other person is saying. For individuals with ADHD, active listening can be particularly challenging due to difficulties with attention and focus. However, practicing active listening skills can significantly enhance communication. To become a better active listener, it is important to eliminate distractions and create a conducive environment for communication. This may involve finding a quiet space, turning off electronic devices, and maintaining eye contact with the speaker. Additionally, individuals with ADHD can employ techniques such as summarizing the speaker's main points, asking clarifying questions, and providing verbal and nonverbal feedback to demonstrate their engagement. 11.1.2 Clear and concise communication. Individuals with ADHD often struggle with impulsivity and may have a tendency to speak quickly or interrupt others. This can lead to misunderstandings and hinder effective communication. To overcome these challenges, it is important to practice clear and concise communication. When expressing thoughts or ideas, individuals with ADHD can benefit from taking a moment to gather their thoughts before speaking. This allows them to articulate their ideas more clearly and avoid rambling or going off on tangents. Additionally, using simple and straightforward language can help ensure that the message is easily understood by others. 11.1.3 Nonverbal communication. Nonverbal communication plays a significant role in conveying messages and understanding others. Individuals with ADHD may struggle with interpreting nonverbal cues, such as facial expressions, body language, and tone of voice. However, by paying close attention to these cues and practicing awareness, individuals with ADHD can improve their understanding of nonverbal communication. It is important to remember that nonverbal cues can vary across different individuals and cultures. Therefore, it is essential to be mindful of these differences and avoid making assumptions. Additionally, individuals with ADHD can benefit from practicing their own nonverbal communication skills, such as maintaining appropriate eye contact, using open and welcoming body language, and modulating their tone of voice to convey their intended message. 11.1.4 Empathy and understanding. Developing empathy and understanding is crucial for effective communication, especially when managing ADHD. It is important to recognize that individuals with ADHD may have unique challenges and experiences that impact their communication style. By cultivating empathy, individuals can create a supportive and understanding environment that fosters open and honest communication. To develop empathy, it is important to actively listen to others' perspectives, validate their feelings and experiences, and refrain from judgment or criticism. Additionally, individuals with ADHD can benefit from educating their friends, family, and colleagues about ADHD and its impact on communication. By promoting understanding and empathy, individuals with ADHD can build stronger relationships and improve their overall communication skills. 11.1.5 Conflict resolution. Conflict is a natural part of any relationship, but individuals with ADHD may face additional challenges when it comes to resolving conflicts effectively. Difficulties with impulse control, emotional regulation, and communication can exacerbate conflicts and make resolution more challenging. However, by employing effective conflict resolution strategies, individuals with ADHD can navigate conflicts in a constructive and positive manner. One important aspect of conflict resolution is active listening, as mentioned earlier. By actively listening to the other person's perspective and understanding their concerns, individuals with ADHD can demonstrate empathy and work towards finding a mutually beneficial solution. It is also important to express one's own thoughts and feelings clearly and assertively, while remaining respectful and open to compromise. Additionally, individuals with ADHD can benefit from taking breaks during conflicts to manage their emotions and regain focus. This can help prevent impulsive reactions and allow for more thoughtful and productive communication. Seeking the assistance of a mediator or therapist can also be beneficial in resolving conflicts and improving communication within relationships. In conclusion, effective communication skills are vital for managing ADHD and building healthy relationships. By practicing active listening, clear and concise communication, understanding nonverbal cues, developing empathy, and employing effective conflict resolution strategies, individuals with ADHD can enhance their communication abilities and foster stronger connections with others. 11.2 Building empathy and understanding. Living with ADHD can be challenging not only for the individual with the condition but also for their loved ones and those around them. One of the key aspects of managing ADHD effectively is building empathy and understanding within relationships. When there is a strong foundation of empathy and understanding, it becomes easier to navigate the unique challenges that ADHD presents and create a supportive environment for everyone involved. The importance of empathy. Empathy is the ability to understand and share the feelings of another person. It is a crucial skill when it comes to managing ADHD because it allows individuals to put themselves in the shoes of someone with the condition and gain a deeper understanding of their experiences. By developing empathy, loved ones can better comprehend the struggles faced by someone with ADHD and offer support and understanding. Understanding ADHD. To build empathy, it is essential to have a solid understanding of ADHD. Educating yourself about the condition can help dispel misconceptions and stereotypes, allowing you to approach ADHD with a more informed and compassionate perspective. Learn about the symptoms, challenges, and strengths associated with ADHD. Understand that ADHD is a neurodevelopmental disorder that affects the brain's executive functions, such as attention, impulse control, and organization. Open and honest communication. Communication is the foundation of any healthy relationship, and it becomes even more crucial when managing ADHD. Open and honest communication allows for the sharing of thoughts, feelings, and concerns, fostering understanding and empathy. Encourage open dialogue with your loved one with ADHD, and create a safe space where they feel comfortable expressing their experiences and challenges. Likewise, be open to listening and understanding their perspective without judgment. Active listening. Active listening is a skill that can greatly enhance empathy and understanding. It involves fully focusing on and comprehending what the other person is saying, without interrupting or formulating a response in your mind. When engaging in active listening, give your full attention to the person speaking, maintain eye contact, and provide verbal and nonverbal cues to show that you are fully present. This practice allows you to truly understand their experiences and emotions. Validate feelings and experiences. Validation is a powerful tool in building empathy. When someone with ADHD shares their feelings or experiences, it is important to validate them by acknowledging their emotions and letting them know that their experiences are valid and understood. Avoid dismissing or minimizing their struggles, as this can lead to feelings of frustration and isolation. Instead, offer reassurance and support, letting them know that you are there for them. Educate others. Building empathy and understanding extends beyond your immediate relationships. It is important to educate others about ADHD to combat stigma and promote understanding in the wider community. Share accurate information about ADHD with friends, family, teachers, and colleagues. By raising awareness and dispelling misconceptions, you can create a more inclusive and supportive environment for individuals with ADHD. Patience and flexibility. Managing ADHD requires patience and flexibility. Understand that individuals with ADHD may have difficulty with certain tasks or behaviors due to their condition. Instead of becoming frustrated or critical, approach these situations with patience and a willingness to adapt. Be flexible in finding alternative strategies or accommodations that can help them succeed. By demonstrating patience and flexibility, you can foster a sense of understanding and support. Seek professional help. Sometimes, building empathy and understanding may require professional guidance. Consider seeking therapy or counseling to gain a deeper understanding of ADHD and its impact on relationships. A therapist can provide valuable insights, tools, and strategies for managing ADHD within the context of your specific relationships. They can also help facilitate open and honest communication, resolve conflicts, and strengthen empathy. Practice self-care. Building empathy and understanding also involves taking care of yourself. Managing ADHD can be emotionally demanding, and it is important to prioritize your own well-being. Engage in self-care activities that help you relax and recharge. Seek support from friends, family, or support groups who can provide understanding and empathy for your own experiences. By taking care of yourself, you can better support and empathize with your loved one with ADHD. Celebrate progress and success. Finally, it is important to celebrate progress and success, both big and small. Recognize and acknowledge the efforts and achievements of your loved one with ADHD. Celebrate milestones and accomplishments, no matter how small they may seem. By celebrating progress, you create a positive and supportive environment that fosters motivation and self-esteem. Building empathy and understanding is an ongoing process that requires patience, education, and open communication. By developing empathy within relationships, you can create a supportive environment that allows individuals with ADHD to thrive and reach their full potential. 11.3 Conflict Resolution Strategies. Living with ADHD can sometimes lead to conflicts in relationships. The impulsivity, inattention, and emotional dysregulation associated with ADHD can create misunderstandings and disagreements. However, it is possible to navigate these conflicts effectively by employing specific strategies that promote understanding, compromise, and resolution. In this section, we will explore some conflict resolution strategies that can help individuals with ADHD build healthier and more harmonious relationships. 11.3.1 Active Listening. One of the most important skills in conflict resolution is active listening. This involves fully engaging with the other person's perspective and demonstrating empathy and understanding. When engaged in a conflict, it is crucial to give the other person your undivided attention, maintain eye contact, and avoid interrupting. By actively listening, you can gain a deeper understanding of the other person's concerns and emotions, which can help in finding common ground and resolving the conflict. 11.3.2 Use I statements. When expressing your own feelings and concerns during a conflict, it is helpful to use I statements. This means framing your thoughts and emotions in a way that takes responsibility for your own experiences rather than blaming the other person. For example, instead of saying, "You never listen to me," you can say, "I feel unheard when I don't feel like my opinions are being considered." Using I statements promotes open communication and reduces defensiveness, making it easier to find solutions together. 11.3.3 Take a break. Sometimes, conflicts can become heated and overwhelming, especially for individuals with ADHD who may struggle with emotional regulation. In such situations, it can be beneficial to take a break and step away from the conflict temporarily. This break allows both parties to calm down, collect their thoughts, and approach the conflict with a clearer mindset. It is important to communicate the need for a break respectfully and agree on a specific time to reconvene and continue the discussion. 11.3.4 Seek compromise. In conflicts, it is essential to find a middle ground that satisfies both parties' needs and desires. Seeking compromise involves actively looking for solutions that address the concerns of all involved. This may require brainstorming ideas, considering different perspectives, and being open to alternative approaches. By focusing on finding common ground, individuals with ADHD can foster healthier relationships and avoid escalating conflicts. 11.3.5 Practice emotional regulation. Emotional dysregulation is a common challenge for individuals with ADHD, and it can significantly impact conflict resolution. Learning and practicing emotional regulation techniques can help individuals with ADHD manage their emotions during conflicts. Deep breathing exercises, mindfulness techniques, and taking a moment to reflect before responding can all contribute to emotional regulation. By staying calm and composed, individuals with ADHD can approach conflicts with a clearer mind and make more rational decisions. 11.3.6 Use visual aids. Visual aids can be powerful tools in conflict resolution, especially for individuals with ADHD who may struggle with attention and memory. Using visual aids, such as charts, diagrams, or written summaries, can help clarify complex ideas and ensure that both parties are on the same page. Visual aids can also serve as a reference point during discussions, preventing misunderstandings and facilitating resolution. 11.3.7 Practice patience and understanding. Conflict resolution takes time and effort, and it is important to practice patience and understanding throughout the process. Recognize that conflicts are a natural part of any relationship and that resolving them requires active participation from both parties. It is crucial to avoid rushing the resolution and instead focus on fostering open communication, empathy, and compromise. By practicing patience and understanding, individuals with ADHD can build stronger and more resilient relationships. 11.3.8 Seek professional help. In some cases, conflicts may be too complex or deeply rooted to resolve independently. Seeking the assistance of a professional, such as a therapist or counselor, can provide valuable guidance and support in navigating conflicts. A trained professional can help individuals with ADHD and their loved ones develop effective communication strategies, explore underlying issues, and work towards resolution. Professional help can be particularly beneficial when conflicts persist or significantly impact the well-being of those involved. 11.3.9 Reflect and learn. After a conflict has been resolved, it is important to take time to reflect on the experience and learn from it. Reflecting on the conflict allows individuals with ADHD to identify patterns, triggers, and areas for personal growth. It is an opportunity to evaluate the effectiveness of the conflict resolution strategies employed and consider alternative approaches for future conflicts. By learning from past conflicts, individuals with ADHD can continue to develop their conflict resolution skills and build healthier relationships. In conclusion, conflict resolution is an essential skill for individuals with ADHD to cultivate in order to maintain healthy and harmonious relationships. By actively listening, using I statements, taking breaks, seeking compromise, practicing emotional regulation, using visual aids, practicing patience and understanding, seeking professional help when needed, and reflecting on past conflicts, individuals with ADHD can navigate conflicts effectively and build stronger connections with others. 11.4 Supportive relationships. Living with ADHD can present unique challenges in maintaining relationships. The symptoms of ADHD, such as impulsivity, forgetfulness, and difficulty with focus, can sometimes strain relationships with family, friends, and romantic partners. However, with understanding, patience, and effective communication, it is possible to build and maintain supportive relationships that can greatly contribute to managing ADHD. 11.4.1 Understanding ADHD in relationships. To establish supportive relationships, it is crucial for both individuals involved to have a clear understanding of ADHD and its impact on daily life. Educating your loved ones about ADHD can help them better comprehend the challenges you face and the strategies you employ to manage symptoms. By sharing information about ADHD, you can foster empathy, reduce misunderstandings, and encourage open communication. 11.4.2 Effective communication. Communication is the foundation of any healthy relationship, and it becomes even more important when ADHD is involved. Here are some strategies to enhance communication. Active listening. Practice active listening by giving your full attention to the person speaking. Maintain eye contact, nod, and provide verbal cues to show that you are engaged in the conversation. Expressing needs. Clearly communicate your needs and expectations to your loved ones. Be specific about how ADHD affects you and what support you require. For example, you might ask for reminders or help with organizing tasks. Using I statements. When discussing challenges or conflicts, use I statements to express your feelings and experiences without blaming or accusing the other person. This approach promotes understanding and reduces defensiveness. Avoiding assumptions. Avoid making assumptions about the intentions or motivations of others. Instead, ask for clarification and give them the benefit of the doubt. This can prevent misunderstandings and unnecessary conflicts. Regular check-ins. Schedule regular check-ins with your loved ones to discuss how your ADHD symptoms are affecting your relationship. This provides an opportunity to address any concerns or make adjustments to support each other better. 11.4.3 Building empathy and understanding. Empathy and understanding are essential in maintaining supportive relationships. Here are some strategies to foster empathy. Education. Encourage your loved ones to educate themselves about ADHD. Provide them with resources, books, or articles that explain the condition and its impact. This knowledge can help them develop a deeper understanding of your experiences. Sharing experiences. Share your personal experiences with ADHD, including both the challenges and the strategies that have worked for you. This can help your loved ones gain insight into your perspective and develop empathy. Encouraging open dialogue. Create a safe space for open dialogue where both parties can express their thoughts and feelings without judgment. This allows for a better understanding of each other's experiences and promotes empathy. Seeking professional help. Consider involving a therapist or counselor who specializes in ADHD in your relationship. They can provide guidance and support to both individuals, helping to navigate challenges and improve understanding. 11.4.4 Supporting each other. Supporting each other is crucial in managing ADHD within a relationship. Here are some ways to provide support. Encouragement. Offer words of encouragement and praise for your partner's efforts in managing their ADHD symptoms. Recognize their progress and celebrate their successes, no matter how small. Collaboration. Work together to develop strategies and systems that support both individuals in the relationship. This can include creating routines, setting reminders, and establishing organizational systems that benefit both parties. Flexibility. Recognize that ADHD symptoms can vary from day to day. Be flexible in understanding when symptoms are more pronounced, and adapt plans or expectations accordingly. Patience. Patience is key when navigating the challenges of ADHD. Understand that your partner may struggle with certain tasks or exhibit impulsive behavior at times. Practice patience and offer support rather than criticism. Seeking support. Encourage your partner to seek support from ADHD support groups, therapy, or coaching. These resources can provide additional strategies and a sense of community for both individuals in the relationship. Remember, building and maintaining supportive relationships takes effort from both parties. By fostering understanding, effective communication, empathy, and support, you can create an environment that helps manage ADHD and strengthens your relationship. 12. Thriving with ADHD. 12.1 Building resilience and self-esteem. Living with ADHD can present unique challenges, but it is important to remember that you have the ability to thrive and lead a fulfilling life. Building resilience and self-esteem are key components in managing ADHD and overcoming obstacles that may arise. By developing these skills, you can navigate the ups and downs of life with greater confidence and resilience. Understanding resilience. Resilience is the ability to bounce back from setbacks, adapt to change, and persevere in the face of challenges. It is not about avoiding difficulties, but rather about developing the skills and mindset to overcome them. Resilience is like a muscle that can be strengthened through practice and experience. Developing resilience with ADHD. Acceptance and self-compassion. Accepting your ADHD diagnosis and embracing self-compassion are crucial first steps in building resilience. Understand that ADHD is a neurodevelopmental disorder, and it does not define your worth or capabilities. Treat yourself with kindness and understanding, acknowledging that everyone has strengths and weaknesses. Positive mindset. Cultivating a positive mindset can help you reframe challenges as opportunities for growth. Instead of viewing setbacks as failures, see them as learning experiences. Focus on your strengths and accomplishments, and celebrate your progress along the way. Problem-solving skills. Developing effective problem-solving skills can empower you to find solutions to challenges that arise. Break down problems into smaller, manageable steps, and brainstorm possible solutions. Consider seeking support from trusted friends, family, or professionals who can provide guidance and perspective. Flexibility and adaptability. ADHD often requires flexibility and adaptability in various aspects of life. Embrace the ability to adjust your plans and expectations when necessary. Practice being open-minded and willing to try new approaches or strategies. Seeking support. Building a strong support network is essential for resilience. Surround yourself with people who understand and support you. Connect with support groups, therapists, or coaches who specialize in ADHD. Sharing experiences and learning from others can provide valuable insights and encouragement. Cultivating self-esteem. Self-esteem is the belief in one's own worth and abilities. It plays a crucial role in managing ADHD and navigating life's challenges. When you have a healthy level of self-esteem, you are more likely to take risks, set goals, and persevere in the face of adversity. Strategies for building self-esteem with ADHD. Recognize your strengths. Take time to identify and acknowledge your strengths. Focus on the things you excel at and the positive qualities you possess. Celebrate your achievements, no matter how small they may seem. Set realistic goals. Setting realistic and achievable goals is important for building self-esteem. Break larger goals into smaller, manageable steps, and celebrate each milestone along the way. This will help you build confidence and a sense of accomplishment. Practice self-care. Taking care of your physical, emotional, and mental well-being is crucial for building self-esteem. Prioritize activities that bring you joy and relaxation. Engage in regular exercise, eat a balanced diet, get enough sleep, and practice stress management techniques such as mindfulness or deep breathing exercises. Challenge negative self-talk. Negative self-talk can undermine self-esteem. Become aware of any negative thoughts or beliefs you may have about yourself and challenge them. Replace negative self-talk with positive affirmations and self-encouragement. Celebrate progress. Celebrate your progress and successes, no matter how small they may seem. Recognize and appreciate the effort you put into overcoming challenges. Keep a journal or create a visual reminder of your achievements to boost your self-esteem. Seek support. Surround yourself with supportive and understanding individuals who can uplift and encourage you. Share your goals and aspirations with trusted friends or family members who can provide guidance and support along your journey. Remember, building resilience and self-esteem is an ongoing process. It takes time, effort, and patience. Be kind to yourself and embrace the journey of personal growth. With resilience and self-esteem, you can thrive with ADHD and lead a fulfilling life. 12.2 Setting and achieving goals. Setting and achieving goals can be a challenging task for individuals with ADHD. The difficulty in maintaining focus and managing impulsivity can often lead to a lack of follow-through and a sense of frustration. However, with the right strategies and mindset, individuals with ADHD can learn to set and achieve goals effectively. 12.2.1 Understanding the importance of goal setting. Goal setting is a crucial aspect of personal growth and development. It provides a sense of direction and purpose, allowing individuals to focus their energy and efforts on specific objectives. For individuals with ADHD, setting goals can be particularly beneficial as it helps to improve focus, motivation, and self-discipline. When setting goals, it is essential to make them specific, measurable, achievable, relevant, and time-bound. Smart. Specific goals provide clarity and help to define the desired outcome. Measurable goals allow for tracking progress and provide a sense of accomplishment. Achievable goals are realistic and within reach. Relevant goals align with personal values and aspirations. Time-bound goals have a specific deadline, creating a sense of urgency and accountability. 12.2.2 Breaking down goals into manageable steps. One common challenge for individuals with ADHD is feeling overwhelmed by the size or complexity of a goal. Breaking down goals into smaller, manageable steps can help alleviate this feeling and make the goal more attainable. Start by identifying the ultimate goal and then work backward to determine the necessary steps to achieve it. Each step should be specific, actionable, and achievable within a reasonable time frame. By breaking down the goal into smaller tasks, individuals with ADHD can focus on one step at a time, reducing the likelihood of becoming overwhelmed or distracted. 12.2.3 Prioritizing goals. With ADHD, it is common to have multiple goals or ideas competing for attention. Prioritizing goals is essential to ensure that time and energy are allocated effectively. Start by evaluating each goal's importance and relevance to your overall aspirations. Consider the potential impact and benefits of achieving each goal. Once you have identified your goals, rank them in order of priority. This ranking will help you determine where to focus your efforts and resources. By prioritizing goals, individuals with ADHD can avoid spreading themselves too thin and increase their chances of success. 12.2.4 Creating an action plan. An action plan is a roadmap that outlines the specific steps and strategies needed to achieve a goal. It provides structure and guidance, helping individuals with ADHD stay organized and focused. When creating an action plan, start by listing the necessary tasks and deadlines for each step. Break down each task into smaller, actionable items. Consider any potential obstacles or challenges that may arise and develop strategies to overcome them. It can be helpful to set reminders or use visual aids, such as calendars or to-do lists, to keep track of progress and stay on track. 12.2.5 Utilizing strategies for focus and time management. For individuals with ADHD, maintaining focus and managing time effectively are crucial for goal achievement. There are several strategies that can help improve focus and time management skills. Chunking. Break tasks into smaller, more manageable chunks to make them less overwhelming. Time blocking. Allocate specific time blocks for different tasks or activities to create structure and minimize distractions. Pomodoro technique. Work in short bursts of focused activity, typically 25 minutes, followed by a short break to maintain productivity and prevent burnout. Eliminating distractions. Minimize external distractions by creating a quiet and organized workspace. Use tools such as noise-canceling headphones or website blockers to reduce digital distractions. Using timers and alarms. Set timers or alarms to create a sense of urgency and help stay on track. By implementing these strategies, individuals with ADHD can improve their ability to stay focused, manage time effectively, and ultimately achieve their goals. 12.2.6 Seeking support and accountability. Having a support system and accountability can significantly increase the likelihood of achieving goals. Share your goals with trusted friends, family members, or a mentor who can provide encouragement, guidance, and accountability. Consider joining a support group or seeking professional help, such as a coach or therapist, who specializes in working with individuals with ADHD. These individuals can provide valuable insights, strategies, and support throughout the goal-setting and achievement process. 12.2.7 Celebrating progress and success. Celebrating progress and success is an essential part of the goal-setting journey. Recognize and acknowledge your achievements, no matter how small they may seem. Celebrating milestones and accomplishments boosts motivation, self-confidence, and overall well-being. Find ways to reward yourself for reaching specific milestones or completing tasks. This can be as simple as treating yourself to something you enjoy or taking a break to engage in a favorite activity. By celebrating progress and success, individuals with ADHD can maintain motivation and momentum towards achieving their goals. 12.2.8 Adjusting and adapting goals. As individuals with ADHD navigate their goal-setting journey, it is essential to remain flexible and open to adjustments. Life circumstances, priorities, and interests may change over time, requiring goals to be adapted or modified. Regularly evaluate your goals and progress to ensure they align with your current aspirations and circumstances. Be willing to make adjustments as needed, whether it involves changing the timeline, modifying the steps, or even reevaluating the goal itself. By remaining adaptable, individuals with ADHD can continue to set and achieve goals that are meaningful and relevant to their lives. In conclusion, setting and achieving goals is a valuable skill for individuals with ADHD. By understanding the importance of goal setting, breaking goals into manageable steps, prioritizing effectively, creating action plans, utilizing focus and time management strategies, seeking support and accountability, celebrating progress and success, and remaining adaptable, individuals with ADHD can thrive and accomplish their aspirations. 12.3 Celebrating progress and success. Living with ADHD can present unique challenges, but it is important to recognize and celebrate the progress and success you achieve along the way. Celebrating your accomplishments not only boosts your self-esteem but also reinforces positive behaviors and motivates you to continue working towards your goals. In this section, we will explore the importance of celebrating progress and success and provide some strategies to help you do so effectively. 12.3.1 Recognizing the importance of celebration. Celebrating progress and success is crucial for individuals with ADHD because it helps to counterbalance the focus on difficulties and challenges. It is easy to get caught up in the negative aspects of ADHD, such as forgetfulness or impulsivity, but celebrating your achievements can shift your perspective and remind you of your strengths and capabilities. By acknowledging your progress, you reinforce the positive changes you have made and build confidence in your ability to overcome obstacles. Celebrating success also provides a sense of validation and recognition for your hard work, which can be incredibly motivating and inspiring. 12.3.2 Setting meaningful milestones. To effectively celebrate progress and success, it is important to set meaningful milestones along your journey. These milestones should be specific, measurable, achievable, relevant, and time-bound. Smart. By breaking down your larger goals into smaller, manageable milestones, you can track your progress more effectively and celebrate each step along the way. For example, if your goal is to improve your time management skills, you could set milestones such as consistently completing your daily to-do list for a week, successfully prioritizing tasks for a month, or meeting deadlines for important projects. Each time you achieve one of these milestones, take a moment to acknowledge and celebrate your accomplishment. 12.3.3 Personal Rewards. One effective way to celebrate progress and success is by rewarding yourself for your achievements. Personal rewards can be anything that brings you joy and serves as a positive reinforcement for your efforts. It is important to choose rewards that are meaningful to you and align with your values and interests. Consider creating a reward system where you earn points or tokens for reaching milestones or completing tasks. These points can then be exchanged for rewards such as a favorite treat, a relaxing day at the spa, a new book, or a fun outing with friends. The key is to make the rewards something you genuinely look forward to and that provide a sense of satisfaction and enjoyment. 12.3.4 Social Support and Celebration. Celebrating progress and success can be even more meaningful when shared with others. Social support plays a crucial role in managing ADHD, and involving your loved ones in your celebration can strengthen your relationships and provide a sense of belonging. Share your milestones and achievements with your family, friends, or support group. Allow them to celebrate with you and acknowledge the hard work you have put in. Their encouragement and positive reinforcement can be incredibly uplifting and motivating. Additionally, celebrating together can create a sense of camaraderie and foster a supportive environment. 12.3.5 Reflecting on growth and learning. In addition to celebrating your achievements, take the time to reflect on your growth and learning throughout your ADHD journey. Consider the challenges you have overcome, the skills you have developed, and the progress you have made. Reflecting on your experiences can provide valuable insights and help you appreciate the personal growth you have achieved. Keep a journal or a gratitude list where you can regularly record your accomplishments, big or small. This practice allows you to look back on your journey and see how far you have come. It can also serve as a reminder of your resilience and determination, especially during times when you may feel discouraged. 12.3.6 Cultivating a positive mindset. Celebrating progress and success is closely tied to cultivating a positive mindset. It is important to focus on your strengths and accomplishments rather than dwelling on your challenges and setbacks. By shifting your perspective to a more positive outlook, you can enhance your overall well-being and increase your motivation to continue working towards your goals. Practice positive self-talk and affirmations to reinforce your belief in your abilities. Remind yourself of the progress you have made and the obstacles you have overcome. Surround yourself with positive influences and seek out inspirational stories of individuals who have thrived with ADHD. By immersing yourself in positivity, you can create a supportive and empowering environment for your personal growth. 12.3.7 Embracing the journey. Finally, it is important to embrace the journey of managing ADHD and celebrate the process itself. Recognize that progress is not always linear, and setbacks are a natural part of growth. Instead of focusing solely on the end result, appreciate the small steps you take each day towards your goals. Celebrate the effort you put in, the resilience you demonstrate, and the lessons you learn along the way. Embrace the challenges as opportunities for growth and view each day as a chance to make progress. By celebrating the journey, you can find joy and fulfillment in the process of managing ADHD. Remember, celebrating progress and success is not about comparing yourself to others or meeting external expectations. It is about recognizing your own growth, acknowledging your achievements, and finding joy in your personal journey. So, take the time to celebrate your progress, no matter how small, and celebrate the unique strengths and abilities that ADHD brings to your life. 12.4 Continuing personal growth. Continuing personal growth is an essential aspect of managing ADHD. While there is no cure for ADHD, individuals can learn to thrive by developing strategies and skills that support their unique needs. In this section, we will explore various ways to continue personal growth and build upon the progress made in managing ADHD. 12.4.1 Embracing a growth mindset. One of the first steps in continuing personal growth is adopting a growth mindset. A growth mindset is the belief that abilities and intelligence can be developed through dedication and hard work. By embracing a growth mindset, individuals with ADHD can view challenges as opportunities for growth and improvement rather than as obstacles. To cultivate a growth mindset, it is important to focus on the process rather than the outcome. Celebrate small victories and acknowledge the effort put into overcoming challenges. By reframing setbacks as learning experiences, individuals can develop resilience and perseverance. 12.4.2 Seeking continuous learning. Continuing personal growth involves a commitment to lifelong learning. Individuals with ADHD can benefit from seeking out new knowledge and skills that align with their interests and goals. This can be done through various means, such as reading books, taking online courses, attending workshops, or joining support groups. When choosing learning opportunities, it is important to consider individual preferences and learning styles. Some individuals may thrive in structured environments, while others may prefer self-directed learning. Experiment with different approaches to find what works best for you. 12.4.3 Developing self-awareness. Self-awareness is a crucial aspect of personal growth for individuals with ADHD. By understanding their strengths, weaknesses, and triggers, individuals can make informed decisions and develop effective strategies to manage their symptoms. To develop self-awareness, it can be helpful to keep a journal to track patterns and identify triggers. Reflect on experiences and emotions to gain insights into how ADHD affects various aspects of life. Additionally, seeking feedback from trusted individuals can provide valuable perspectives and help identify blind spots. 12.4.4 Cultivating mindfulness. Mindfulness is a practice that involves being fully present in the moment and non-judgmentally aware of one's thoughts, feelings, and sensations. For individuals with ADHD, cultivating mindfulness can help improve focus, reduce impulsivity, and manage stress. There are various mindfulness techniques that can be incorporated into daily life. These include deep breathing exercises, body scans, and guided meditation. By practicing mindfulness regularly, individuals can develop greater self-control and enhance their ability to stay present and focused. 12.4.5 Setting realistic goals. Setting realistic goals is crucial for personal growth and managing ADHD effectively. It is important to set goals that are specific, measurable, attainable, relevant, and time-bound. Smart. By breaking down larger goals into smaller, manageable tasks, individuals can maintain focus and motivation. When setting goals, it is important to consider individual strengths and limitations. Be realistic about what can be achieved within a given time frame and adjust goals as needed. Celebrate progress along the way and acknowledge the effort put into achieving each milestone. 12.4.6 Building a supportive network. Building a supportive network is essential for personal growth and managing ADHD. Surrounding oneself with understanding and empathetic individuals can provide a sense of belonging and encouragement. Seek out support groups, therapy, or coaching to connect with others who share similar experiences. In addition to external support, it is important to cultivate self-compassion. Be kind to yourself and acknowledge that managing ADHD can be challenging. Celebrate small victories and practice self-care regularly to maintain overall well-being. 12.4.7 Practicing self-care. Self-care is a vital component of personal growth and managing ADHD. Taking care of physical, emotional, and mental well-being is essential for maintaining balance and reducing stress. Engage in activities that bring joy and relaxation, such as exercise, hobbies, or spending time in nature. Establishing a consistent sleep routine is also crucial for individuals with ADHD. Lack of sleep can exacerbate symptoms and make it more difficult to manage daily challenges. Prioritize getting enough restful sleep to support overall cognitive function and emotional well-being. 12.4.8 Seeking professional support. Continuing personal growth may involve seeking professional support from therapists, coaches, or healthcare providers specializing in ADHD. These professionals can provide guidance, strategies, and tools tailored to individual needs. Regular check-ins with a professional can help track progress and make necessary adjustments to treatment plans. Remember, personal growth is a lifelong journey. Embrace the process, be patient with yourself, and celebrate every step forward. By continuing to learn, adapt, and develop effective strategies, individuals with ADHD can thrive and lead fulfilling lives.